ภัยภูเบศรของเราชื่อภาษาอังกฤษเราเรียกว่าอะไรไม่อาจารย์ไม่ใช้อภัยภูเบศรใช่ไหมหรือใช้อภัยภูเบศรไทย traditional medicine college นะโอเคค่ะ ซ้อมประมาณนี้แล้วใจถึงค่อยกลับมาตรงนี้นะโอเค ประมาณนี้เนาะโอเคเนาะเสียงพี่ออกไปชัดดีไหมคะชัดดีนะคะขอบคุณค่ะงั้นเดี๋ยวซ้อมประมาณนี้ใหม่ก่อนนะโอเคอยู่นะคะฟังกันได้ยินอยู่นะค่ะค่ะประมาณนี้ได้นะอ้อเนาะซ้อมประมาณนี้นะคะมันพอใจจบ Who with me
ชนนีกรุงเทพทดสอบทดสอบวิทยาลัยพยาบาลบรมราชชนนีกรุงเทพทดสอบ1 2 3
So everyone will be ready for the accept the people to get in. So หน่อยเขารอบอร์ดคัสไซน์ Okay, so Ari after this go to the PowerPoint of the conference. Are we ready for the broadcast? So you have to show the conference, PowerPoint of the conference. Good morning, everyone. I'm Dr. Panarat Wisawatepnimit, Director of Research of Param Rachuni College of Nursing, Bangkok. I'm very glad that all of you interested in our virtual conference and cultural exchange on health professional education for effective response to COVID-19 and future health emergency, sharing experiences. As we know that right now, the COVID-19 pandemic is a big public health concern, and of course, its impact for the health education badly. So this is the long period of time of COVID-19 that we have to face. It's more than a year now, and we don't know when it will be end. So this is a very important that for the health professional education to sharing as the experience between all of us about the impact of COVID-19. So today we have our conference, we have 4 sections. So in the morning, we will have 2 sections from faculty section to sharing our experience about the impact of COVID-19 or our online education. Do we gain or do we lose? And the second section for the morning is about innovative teaching and learning methods that we have to use in new normal era. And the afternoon will be 2 sections from the student. So as a teacher, we have to listen for the perspective of student because our student is a very good customer. So when we have to ensure that they meet the outcome of learning, so that's why the feedback for them is so important. So for right now, we are going to go to the opening address. For our opening address, we have Dr. Vishai Tiantavan. He's a professor and our new chancellor of Pabarom Chonok Institute. And then we will have welcome speech from Dr. Suchai Chalansuk, and our director of the Central Network 1. And she is a director of Param Rachuni College of Nursing Chonburi. And followed by Dr. Kedeputus Dama Sayasat. He's a rector of ITKS Bali. So we start with our opening address. Please, Professor Dr. Vishai Tiantavan.
สวัสดีครับ Honorable co-host, distinguished guests, ladies and gentlemen, I am delighted to honor to have this opportunity to welcome you to the virtual conference on the topic Health Professional Education for Effective Response to COVID-19 and Future Public Health Emergencies, sharing experience hosted by a collaboration among the Central College Network 1 of Pabaromara Chanok Institute and partner from St. Louis College, King Mongkut, University of Technology North Bangkok, Thailand and ITS Bali, Indonesia. As we know, the COVID-19 pandemic is a major health public concern globally. Thailand and Indonesia also have faced this crisis. Although COVID-19 vaccination has begun, the number of new cases and deaths are still rising, and new clusters of infected patients have been found because the SARS-CoV-2 virus is very easily transmitted and mutated. The impact of the COVID-19 outbreak are not only on pupil lives, health, and economics, but also on health professional education. Teaching and learning approach need to be dramatically changed from classroom-based learning into online-based learning. For theoretical course and practicum in the real setting into simulation-based learning. Disruptive change have affected academic institute, faculty, and students to reform and transform their teaching and learning platform as well as evaluation methods. Since we need to face the COVID-19 outbreak for a lengthy time as academic institute, need to find opportunity in this crisis to maintain on mission and educational quality. Sharing experience are one of the effective platforms to simulate insightful ideas. Identify the challenge and their solution. Listening to student perspective and feedback on education during COVID-19 and its impact on their learning is also very useful input of faculty to redesign teaching, learning, and evaluation method to promote student learn outcome and their happiness. I strongly believe that the battle the COVID-19 situation, health professional academic institute need to collaborate and learn from each other. Therefore, I appreciate the collaboration between colleges under Pabromo National Institute, other partner in Thailand, and ITKS Bali, Indonesia. This virtual conference is an initiative to compensate the traditional face-to-face conference. With our strong collaboration, I do believe that we can share our experience and learn how we overcome challenge from the COVID-19 pandemic. This learning would be beneficial in future public health emergency happen. I wish the participants very fruitful and productive conference. With that, I declare the virtual conference on health professional education for effective response to the COVID-19 and future public health emergency sharing experience open now.
Chancellors, co-hosts, distinguished delegates, participants, and partakers, greeting to one and all. It is gorgeous moment to extend my warm wishes on behalf of Central College Network 1 and BCN Trang Faculty of Nursing PBRI. I am here at BCN Bangkok with our director from CCN 1, Dr. Mantana Hemchayat from พระปกเกล้า Nursing College, Dr. Kwanta Bunwat from BCN Bangkok, Dr. พยาวพงศักดิ์ชาติ from BCN นพรัตน์วชิระ Dr. กมลรัตน์ Turner from BCN จังหวัดนนทบุรี and Director สมศักดิ์มงคลธนวัฒน์ from อภัยภูเบศร Traditional Medicine College. It gave me immense warmth and great pleasure to guest all of you present in this virtual conference. Before begin this conference, I would like to express my heartfelt gratitude to all of you who sincerely committed to this event to make it a success. CCN1 and BCN Trang of PBRI, St. Louis College of Thailand, and ITKS Bali, Indonesia, has an outstanding, strong relationship over 10 years. Our relationship has made us grow together. We have joined several activities, including hosting an international conference occasionally, until the epidemic of COVID-19 has emerged in a couple years. This year, it gave us warm and great pleasure to involve Faculty of Applied Science, King Mongkut University of Technology, North Bangkok, Thailand. With regard to standard precaution of COVID-19 pandemic, this virtual conference is organized and conducted for Indonesian and Thai students and faculty to gain insight and information on health professional education for effective response to COVID-19 and future public health emergencies from sharing experiences. Through discussion in this virtual conference, we will gain understanding to improve health professional education, both in Indonesia and Thailand. I ensure the conference will be profitable and fruitful for everyone who presents here. Thank you.
Chancellor, co-host, distinguished speaker and delegates, participants, faculties and students. In this very beautiful morning here in Bali, I am Dr. Futu Dharma as Director of ITEKAS Bali. And on behalf of ITEKAS Bali, please allow me once again to congratulate the Prabowo Marajanok Institute for the upgrade into a university, and also happy 75th anniversary to BCN Bangkok. I would like also to express our sincere gratitude for inviting ITEKAS Bali taking part in this very important event on virtual health and cultural exchange conference between CC Network 1, BCN Bangkok, Faculty of Nursing PBRI, St. Louis College, Faculty of Applied Science, King's Mongkut University of Technology, North Bangkok, Thailand, and of course ourselves, ITEKAS Bali. It's been a very fruitful collaboration since April 2008, exactly 13 years ago, when CCN Network 1 signed the very first international collaboration of ITEKAS Bali, or STIKAS Bali as our name previously. As someone once said, the show must go on. I really appreciate all the effort to be together virtually in this international conference when COVID-19 is still with us. Yes, we all experience an unprecedented situation with the global pandemic of COVID-19, but it has also been a big yes too, that we need to be able to adapt and to come up with the effective solution on how to deal with it. That is why we need to be creative, optimistic, and innovative. And I believe this is the foundation of what we are going to do today, to share knowledge and experience. Last but not least, I would like to say thank you to speakers, participants who spare their time to participate in this virtual conference. Enjoy the events. Thank you. Kap kun kap. Terima kasih.
Okay, thank you for Adjunct Professor Dr. Vichai Tianthawon, Dr. Sukchai Charansuk, and our director from Central Network 1 of Pabarom National Institute, Thailand, and Dr. Putu Dhamma Suyasa from the ITEKAS Bali. So this is the next section is our very important section that is about the keynote speech. So today we have a very great honor that we have a very great keynote from Thailand and from ITEKAS Bali, Indonesia, that to provide us the what we can do and recommendation and our insightful for the suggestion for us to go forward for our education. So I would like to invite the keynote speaker. So the first one is Professor Vichan Panit. He is a chairman of National Health Professional Education Foundation, Thailand. He will talk about the COVID-19 crisis and health professional educational reforms. So please, Professor Vichan, the time is yours.
Thank you, Dr. Panarat. Good morning, everybody. It is my great pleasure and honor to have this opportunity to address this conference, the virtual Health and Cultural Exchange Conference on health professional education for effective response to COVID-19 and future public health emergencies. Actually, I have changed the topic given to me a little bit, probably not a little bit, but to focus more on the positive side of COVID-19. For the current situation of COVID-19 in Thailand, I hope that further activities will share with you that we are almost in the same situation as in Indonesia, Malaysia, and the Philippines, in which we are still struggling with the trying to contain the spread of the infection, and also to inject the vaccine as quickly as possible. My main focus will be on opportunities, not threat. That's the main emphasis of my very short talk. If we focus more on the threat, we are dealing with the present and the future and the past. I prefer dealing more on the present and the future. The future must be much better than the present. That's I think that's our responsibility, not only in health professional education, but also in health system development as well. So the proactive and creative approach will be more fruitful than the responsive to threat. Next slide, please. Can you go to the next slide, please? Yeah, thank you. In order to take the opportunity for the development of health professional education, we can approach in many ways, many angles. One way is to approach the main activities of education and learning, which is OLE. We can do lots of experiment to innovate OLE in health professional education. The objectives and skill should be more emphasized on the addressing the health emergencies as we have seen, and also the team skill, teamwork skill, health team competencies, the skill for being more agile or more resilient to situations. The COVID-19 situation tell us that we in the health professional education, health professions must be more resilient. Our students must be trained so that they have this capacity, and also we should provide them with learning skills from work, learn from work more than learn from textbooks or teachers. So in this situation, we can set up more appropriate learning objectives for the future. For learning experiences, we need to train our students to be agentic, which means a person who's active, who's an active learner, active practitioner, who's servicing the other people, servicing the community or the society, agentic person. Students should be trained, should have opportunity to practice, to be an agentic person, a health professional. And in this age of the world, the learning from IT tool is a must. And when we face the limitation of face-to-face learning, online learning is becoming more and more important, and we have more and more experience using this. And I think in the future it will be hybrid. All learning will be hybrid, and we have the opportunity to develop learning experiences in which even the skill practice can be facilitated by online learning and online coaching, and also online evaluation or assessment. So there are lots of learning experience innovation that we can imagine and try to accomplish. For evaluation, there are lots of evaluation or assessment to by online means, in which the learning experience can be strengthened by assessment, which is called formative assessment. We should emphasize more on this formative assessment, which can be done both face-to-face and both online. So that and also formative assessment plus constructive feedback, so that the students learn better, and they can also do peer evaluation, which means that students among themselves evaluate their friends, and even the self-evaluation. All of this contribute to lifelong learning of our profession. Next, please. Can I have a next slide, please? Next slide. Next one. Oh, yes. The roles of people in our education system can be changed a lot in order for the transformation of the health professional education. For example, students. Nowadays, we treat them as a person who comes to learn, to absorb a new knowledge, new skills, and new attitude, which is correct. But education, the new approach of education, more and more treat students as an active partner, not a passive partner of education. So they learn better by doing, by taking role of active worker in the service or in the activities, and for their own action, they get the feeling of what's happening, what the result is, and then they can reflect on it. So learning from doing and reflecting is the new way of learning. even from childhood and for lifelong learning. So students should be more and more treated as a co-worker, not only as a passive recipient of the learning. Patient as well. Patient can for profession education. Please go back. And also the community. The community can also be an active partner, not only receiver of the professors teach in the higher education. Students, patients, and the people, and so people, the community can join hands and try education. Next, please. In summary, I propose that we should collaborate in 3 main aspects, which is not in this slide. The 3 main aspects are education and training. The second is the health system development. Health professionals in any profession should take part in the development of the health system of the country and even of the world. So we can join hands in sharing our experience in doing this big picture task. The last one, and probably one of the most important, is research. We should join hands in doing research, both in the health professional education research and also in the health system research or health service system research. The value is that Bali, Indonesia, and Thailand have a different culture, different context in the social aspect and also in health system. So doing the same intervention of health in different contexts, and then combined and then compare, will give a very powerful research results, a very important research results. So I would like to propose that we from Bali and from Thailand join hands in at least 3 activities, so that we can take the opportunity from our COVID-19 pain, turn into opportunities to develop a new way or transformation of our education, health professional education, and also for health service system. I hope that I will have opportunity to get information from the future collaboration from both sides. Thank you very much.
Recording in progress.
Okay. So, okay. So I would like to thank you, Dr. Vitan Panish, very much. He gave us really insightful recommendation and challenged us a lot. about that we should don't miss this opportunity for the COVID-19. It's just not only the bad side, but we have very good side for experimental and make a lot of produce a lot of innovation. And we have the new laws of the nurses and our health professional education, but we have to have a new team as well. And it's just not only our part of professional, but we have to work as a team with the professional or the professionals. And we have still concerned about the OLE, that is objective learning experiences and evaluation, that the student to meet their curriculum objectives as well. And we as health professional, we have to work in the health system, and collaboration between Thai and Indonesia is very great, and we should extend this collaboration to prove with the new challenges. So thank you very much for Professor Vichan Panit for your very good recommendation and very challenging us. Okay, the next keynote speaker. So I would like to introduce all of you to Ketu Suwachana from ITCS Indonesia. He is a head of research and community service. So he are going to talk about the current situation of COVID-19 in Indonesia and how its impact to education and our future recommendation. So the time is your Dr. Ketu Suwachana, please.
Thank you, Dr. Panarat, for the time. Good morning, ladies and gentlemen. Here, I would like to present one topic in terms of the COVID-19. Okay, thank you very much. I would like to present a current situation and impact of COVID-19 in health professional education in Indonesia. Here, I would like to present the first one is about current situation of COVID-19 in Indonesia. The second one, impact COVID-19 in health professional education. And the last is about conclusion and recommendation. So the first one, I would like to show the COVID-19 data in the global level. So now in global levels or in the world, the total confirmed cases is more than 175 million people confirm cases COVID-19, and 3.8 total death cause of COVID-19 in the world. And how about in Indonesia? In Indonesia, the total confirmed cases right now is more than 1.9 million people with 53,000 deaths in Indonesia. And this is the daily new confirmed cases of COVID-19. So let's say we compare between Indonesia, in the world, India, Brazil, United States, and also let's say in Thailand. Indonesia is still high for the daily cases. This is in 14 June. Indonesia with more than 9,000 confirmed COVID-19 cases in Indonesia. Compared to Thailand is very low if compared to Indonesia. Thailand is around 2.8 thousand cases. So how about the case fatality? Case fatality in Indonesia is very high. Let's say compared to Brazil, 2.8, the first one, and Indonesia 2.7, so almost 2.8. So let's say compared to Thailand, it's only 0.7. So it's big problems in our country in terms of the case fatality rate of COVID-19. So now move to the proportion of patients with symptoms, mostly with a cough, fever, and then malaise, and also shortness of breath. And how about the proportion of patients with comorbidities? Mostly the patient with hypertension, diabetes, and also cardiac disease. And this is the confirmed cases is still high in Indonesia, increasing until February 2021, and increasing until May, and in the middle of May, increasing again. So this is a big problem in our country. This is the comparison of the confirmed cases, death, cure, and also being treated among the provinces in Indonesia. So the highest one is in Jakarta, and Bali. We are in Bali. Bali is in the top 9 in Indonesia. Okay, look at this picture. This is show us that how the health professional working very hard, fighting with the COVID-19. This is the only one example of picture. Medical personnel take a break after conducting COVID-19 swab test in Depok, west of Java. So because of the big cases, so many times they have to do in terms of the swab test with the limited number of health professionals. So this is also one problem. So mostly the problem is burnt out with high responsibility. And this is COVID-19 deaths among nurses, September 2020. So this is Indonesia. The total nurses death because of the COVID-19 was 50. Again, this is September 2020. I believe now is increasing a lot. And this is the physician death from coronavirus, from the COVID-19 in Indonesia. The total is 17. This is April 2020. So the highest one is Italy, Iran, and also Philippines. And this is the hot issue right now in Indonesia in terms of new mutation of the COVID-19, about that virus, mutation of the virus. This is the 3rd of May 2021. The first one is 13 cases. This is from England variant B117, 2 cases India variant B1617, and 1 case B1351 variant from South Africa. But right now, this is just 14 June 2021, some days ago. The new mutation in Central Java, in Kudus. So we call Delta variant. Delta variant means the India variant. It's already 28 cases, and then we know all about this variant. It's very high, very speed in terms of the transmission. So this is also another problem in our country right now. This is the under testing of COVID-19 in Indonesia. Look at here, Indonesia, for the number of tests per 1 million population. It's only 247. Compared to Thailand is 2,500 tests per 1 million population. It's very different, big difference. So this is also another problem. So that's why here they mention number of COVID-19 cases in Indonesia is likely to be significantly underreported, and lack of testing capacity is a result of delay policy response. So this is the impact to the delay of policy. And the national policy in Indonesia is not locked down for the COVID-19, preventing COVID-19. So our government choose large-scale social restriction. And then another policy is work, study, and pray from home. And then we reduce that restrictions now become enforcement of restriction on public activities with micro restrictions at village level, and also health protocol in preventing COVID-19, testing, tracing, treatment, and also isolation. This is the impact of COVID-19 pandemic to health professional education. Of course, directly impact to the education, especially the impact to the health professional education. And another thing is health professional also infected by COVID-19. So this is like a double burden. And this is impact to the health services delivery system. Sometimes the hospital or health centers is closed for some days because of the high transmission in that health facilities, and also impact to the clinical practice of our students in the hospital or in the health centers. So we have to stop for the clinical practice, and now we have to open again for the clinical practice with the strict health protocol. So for the students in the campus, and then we start for the online learning. The online learnings, here we need to improve campus technology and facilities, improve the ability of lecturers and students, because this is the new things. So before we have to study, the students and lecturers attending to the class, but now we have to start for the learning, online learning. So we have to adapt, we have to adjust, we have to improve our ability in terms of the online learning. And then modification, and also doing research to improve the online learning quality. And the nursing clinical practice also affected. We start usually with the preclinical training, also COVID-19 test before practice. So before our student attending to the hospital or health center, they have to test rapid test antigen or PCR, and then limit the number of students who are practiced in the health facility. And also the most important is PPE, personal protective equipment, and practice with strict of health protocol. What is the role of the university for the recovery? Because we need the recovery. Because COVID-19 pandemic impact to the multiple crises, and then we need the recovery, economic or health recovery. So of course, health professional education is involved, especially in university. Let's say for the volunteer for the prevention, volunteer for treatment, and also volunteer for vaccination. So many health professional students also help the government to success the vaccination, doing research innovation, and also thematic learning practice in the community. And then for the innovation, this is the process of innovation. Start with the assessment, defining options, until the preparing student for innovation, implementing innovation, evaluation, and also sharing the outcome. This is some evidence about the education during the COVID-19. We know that Indonesia with 17,000 islands, very big islands, many islands with a big population. So because of COVID-19, all the schools closed, and then we start with the learning, online learning. But now for the school located in the green and yellow, they can start for the face-to-face, obtain to the class, but with permission. And then for the orange and red zone, they continue study from home. This is the comparison of anxiety and suicidal thought, among Thai students, Indonesia, and also Taiwanese students. For the Thai student, the highest level of anxiety, but lowest level of confidence in pandemic protocol. For Indonesian student, less perceived satisfactory support associated with the more suicidal thought. But for the Taiwanese students, more negatively affected by information from internet and medical staff. So this is the variable that associated to anxiety and suicidal thought. And this is the correlation for the academic health, self-efficacy, and burnout. Majority, 46% of students experience severe burnout. So we can imagine 46% experience with the severe burnout during the distance learning. And moderate self-efficacy were more likely experience severe burnout. Look at the coefficient correlation is 0.8, so very strong. And so that's why the nurse educator need innovative learning strategies to create the favorable learning environment. And this is the tables that mention about the moderate self-efficacy, and then burnout, and also the association, the correlation between academic self-efficacy and each dimension of burnout. And each dimension burnout, the most is about association with R minus 0.9 and PPU less than 0.001. And this is the impact of COVID-19 among pharmacy and education. Pharmacy education in Malaysia and Indonesia. So fully online, and then they use blended learning also, and then universities with traditional didactic courses still struggling until now. So that's why we need creativity for the lecturers and students. This is the student perspective in terms of classroom and distance learning. So let's say here, I like distance learning than classroom learning. So majority of students strongly disagree about the distance learning. And then the most variable with the highest OR or ratio is efficient with OR 18. And this is the challenges. The external factors for the challenges was unstable internet connection, and also extra financial burden for the internet quota. And for the internal factor was time management and difficulty to focus while learning online for the longer period of time. And majority agreed blended learning that combine classroom and the distance learning. And here is the effective learning. So we need the effective learning. Here the effective learning is focused on the active interaction among faculty, student, and also student peers. And creative strategies designed not to entertain, but to inform and stimulate, and then recognize that the student as individual with the unique one. So that's why we have to consider every student. And this is the conclusion. All countries are fighting with COVID-19. COVID-19 infection ended among health professionals. So online learning, and also the faculties still doing the research. And the recommendation continue for COVID-19 prevention and treatment, improve online learning quality and condition, implementing a better online learning with modification, let's say blended learning, for example, and more research and innovation for a better and effective learning. So that's all my presentation. Thank you very much. Kapungkap.
Okay, thank you, Ketua Suwachana. This is a very informative data. And we see that the Thailand and Indonesia face the same problem with the number of COVID-19 cases. And we face the same problem with the COVID-19 strain, and that is because it's easily mutants and it's difficult to control. And that is affect a lot for the education, and especially make online education. Very good that you highlight the result of many research, and we see that it still have a perspective from students. Some students may say that they're very burnt out and they're very exhausted from the online learning, but some students may like it because this is the way that is different from the learning style of the student. And we see that the COVID-19 impact is different on the context as well, because Indonesia have many islands and different from the Thailand and some part of the world. So every teacher have to modify and adapt for their teaching and learning style. And then we'll be ready for our new challenges. And this is our new roles as a teacher as well. So the next section will be the first panel discussion is on gain or pains experiences on online education during COVID-19 outbreak, challenges and effective solutions. So we will have a 1 to 2 minute break before we start for this section. Hi everyone. So this is we are going to go to the very interesting topic for the panel discussion. So as a teacher, you know that for the online learning, as we hear from this morning for the impact. So we are going to discuss about gain or pain, experiences on online education during COVID-19 outbreaks, challenges and effective solutions. So I would like to introduce our guest speaker. So our first one is Dr. Kamolat Turner. She's a director of บรมราชชนนี College of Nursing จังหวัดนนทบุรี Thailand. So hello Dr. Kamolat.
สวัสดีค่ะ Om Swastiastu Selamat pagi. Very glad to be here.
Yeah, you're very good in Indonesian language. So the next one, our panels is Dr. Sukjai Charansuk. She is a director of บรมราชชนนี College of Nursing ชลบุรี Thailand and the chair of a Central Network 1 of Faculty of Nursing พระบรมราชชนก Institute.
Good morning สวัสดีค่ะ Selamat pagi.
Yes, next panelist, I would like to introduce you to Nariman Mahaputra. So and because his name is quite long, and after it I will call you Maha. Please, Maha. He is a lecturer in medical surgical nursing department from ITKS Bali, Indonesia.
Okay, thank you, Ajahn. Hello, my name is Arya Mahaputra. Nice to meet you all. Thank you.
So nice to meet you, Maha, as well. How about Indonesia?
Yes, it's very brightly today. It's very sunny day.
Okay,
It's
very
beautiful.
good. Yes. So the last but not least panelist Her name is Dr. Pacharaporn Thanjakul. She is a head of international affairs of Barom Rachani College of Nursing Trang.
Good morning, everyone.
Thank. Hello, อาจารย์พัชรพร How about at Trang?
The weather quite, I think, is maybe raining soon.
Okay, very good. It's at the same. It's in Bangkok right now. So, so I would like to start with you first, Dr. Pacharaporn.
Sure.
But I would like you to give some information about the educational approach in theoretical courses. Please, the time is yours.
Good morning, ladies and gentlemen. I'm Pacharaporn Thanjakul, a representative of BC and Trang. I feel honored to be here with you today. So I would like to share teaching and learning experiences of theoretical courses during the novel COVID-19 pandemic. Currently, nursing education institutions around the world are facing challenges to provide instructions amid COVID-19 pandemic, including BC and Trang. The COVID-19 pandemic have driven urgent changes to all educational institutions by moving traditional classes to online learning. This situation is a threat and opportunity for nursing education institutions to prepare and develop alternative approaches of teaching and learning. There are many challenges that us teachers are facing at the beginning of unpredicted online learning in terms of the preparedness of institutions, faculty, and students. There were many questions came up. Is our college facility and IT support ready for online teaching? Did all our teachers ready to launch online teaching? And did students know what to do in online classes? I can say we have both good and bad experiences while teaching online classes. Look back to what we have done at BC and Trang. We start with looking for what kinds of learning tools available for our faculty and students. Do we have enough IT equipment and facility? Do we have online examinations, software, and learning management system? And then we thought about which one can be used and which one need to buy in order to making the best online teaching. Here we come. We end up with two modes of teaching approaches for our theoretical courses. So let me talk about the 100% online teaching first. During the first wave of COVID-19 in Thailand, BC and Trang allowed students to go back home and study from home. So this was the reasons why we go with 100% online classes. I think other colleges might do the same. Typically, online conference platforms are required for online teachings. At the beginning, BC and Trang used the basic free versions of Zoom. Unfortunately, free Zoom only offer video conferencing for up to 100% participants. So we have to buy a licensed one. It's quite expensive. Then we change our mind and decide to go with Google Meet for a big size class, or we use a live group call for a small group teaching. Not only the online conference platform that we use for online teaching, we have to use LMS to launch our tutorials, so students could easily access our lessons from home. Most BC and Trang teachers use Google Class, whereas only a few teachers use Google Sites and Ad Model. Ad Model is a better choice due to its feature. For example, a teacher can easily upload a big e-learning file. Teacher can make a quiz on Ad Model itself. Anyway, online teaching is not a happiness. Let's see what our teacher think about online teaching. Most of busy and drunk teachers believe that they have sufficient knowledge of online teaching and they can launch their online teaching. Some teachers quite perceive benefits of online teaching in terms of convenience. In the meantime, some teachers pointed out that online teaching was time-consuming. Let's move to hear what our students gave us feedback about online teaching. Over 2/3 of students believe that they were ready to learn through an online method. Around 70% of them report positive attitudes towards online learning because they believe that they love to use IT and they always use it. Students also claim that they have somewhat self-directed learning skill. In the other hand, most students say that the Thai culture have negative effects on Thai student learning style, such as they always try to ask questions or even show their opinion. So they prefer to learn in-person classes rather than online ones. Students also pointed out that online classes alone may not be an effective teaching and learning approach for this kind of exceptional emergency. Students were not prepared for the unexpected change of online during COVID-19. Busy and Drunk director and team are working hard to find out how can Busy and Drunk faculty and students feel happy and succeed in teaching and learning during the third wave of COVID-19. Then we come up with hybrid learning or blended learning, which is a combination of online and traditional learning. So we are ranked 70% to 80% of online teaching, and then followed by 20 or 30% of traditional teaching or in-person class. We also intend to try a new teaching approach, which is the online jigsaw method, in case that we have to go back to 100% online again. This teaching method is the same one as traditional jigsaw teaching, but the different thing is it will be launched on the online platform. To sum up, I would like to confirm our plan in teaching and learning during COVID-19. COVID-19 taught us that we can teach today the same way we did yesterday. However, change comes with pain, but this pain later become a gain. To explain it well, let's feel the pain and make a difference. Thank you for your attention. Let's move back to Dr. Panera.
You mentioned, you highlight that you use many platforms for the Zoom, Google Meet, and a lot of Google Class, Google Site. So it's all the varieties of the platform like this. If the student complains, it's like a example of my students, sometimes they complain that they want all the teachers use the same platforms of the online education. Do you have the same complaining like this?
Absolutely. At the beginning, when we start the new things, students always complain like, what teacher, why you have to let us start new thing? The old one is already, like they get used to the old one. Like when I start at model and they already use the Google Classroom and they keep arguing and complain, but not in front of me, but keep talking with their classmates or something like that.
Yes, that all we hear, and but we try to adjust and try to tell them that the IT literacy and IT ability is very important. They have to have this competency. So before we allow Maha to talk about his topic, so for Maha, I think guess Bali, what the online platform that you use for theoretical courses?
Okay, Ajahn, about the platform, we use all of platform that we can use in because our rector is give us, especially at lecture, an optional method to using online learning. So the lecture can use Zoom meeting, you can use the Google Meet and else. And I think the WhatsApp groups is a popular platform we use in the e-takers. And beside in the Zoom meeting too, the popular. Thank you, Ajahn.
So as we see that in Thailand, we use the line a lot for communication, but different from Indonesia, you use WhatsApp. So what kind of platform that we can use? We just use it because that is our benefit. So as Dr. Pacharapon highlights that she thinks that the good conclusion should be the hybrid learning or blended learning. So may I ask Dr. Kamonlat, what do you think about that? So during this period, we should have a 100% online education, or is hybrid learning or blended learning is still, we can do it or not?
Thank you for the question. Actually, the blended learning, I think what they recommend best is the blended learning. But for the situation of Thailand, it's not easy to do the blended learning because like we got order from the country and from the province that we not allowed to use the classroom, to use the any building for learning activities or anything that have more than 10 people. So it's hard to do the blended learning. So we have to do the 100 online teaching. But the problem, when you teach like face-to-face, it's easy to do it like 3 hours class, or sometimes you do it the whole day class. But when you have to do online teaching and learning activities, it's not easy to continue for 3 hours. So I usually recommend my staff that you have to design, like the hard thing is design. You have to try to design the activities for the students. You don't have to be there 3 hours talking or be with them and they have to be on the screen or monitor for 3 hours. You can plan about activities. You might be with them half an hour and after that get them to do some work or group work. They can work by themselves. And I ask them, they're happy that they can work without the teacher. And after that, we can come back to conclude at the end. That's what my recommendation. And I use this with my students and they like it. Thank you.
Very great strategy. I think because when I teach online education for 3 hours, I feel really tired. Then I teach with the traditional approach. So that is the same. I think we should break up for have a strategy to have some groups or do another activity as well. But I think not just only as tired, student tired as well for the 3 hours for the learnings. So as we know that the teacher is always important. I would like to ask Dr. Sukhjai, before the COVID-19 outbreak in our country, do we use online education for theoretical course or not? And when you change rapidly like this, because you are a director, is there some faculty complain and how you prepare them for the online education? Please, Dr. Sukhjai.
Thank you for question, Dr. Panarat. Of course, all teachers, they also face with the challenge when we have to change from the traditional face-to-face classroom to online classroom. At first time, some of them who are in the baby boom generation, they got a difficulty to use the IT. So I need to set a short course training for them to learn about how to use Google Classroom, how to use several kind of application online. But for the new generation, like a teacher from Gen Y generation, they're really happy to do online teaching, and it make them create something more fun for students.
Yes. Yes, that I think for the student, they like it. Sometimes we tell them the platform, we never teach them how to use it, but they can. But for the teacher might have a little bit some difficulty, but we can overcome that. It's no problem with us. So as you see that this is we discussed about the theoretical course in during online education, and we come back to discuss about this issue again. But if all the participants, if you have a question, suggestion, and would like to share your experience with us or have some question, you see the chat below. Could you please type your question and we can ask the question for the panelists or share your suggestion. So I would like to go to the practicum part because the practicum is very important for health professional education. And it's very challenging for educational or institute right now because the hospital not allow students to practice there. So how we cope with that, with the practicum course. So this is very important that we need to highlight and discuss. May I invite Mahaputra from ITKS Bali to share your presentation about practicum courses.
Thank you, Ajahn Panarut, for the time, and good morning, everyone. In this opportunity, I'm glad to present about a topic, educational approach in practicum courses, especially about my experiences in medical surgical nursing practice courses in ITKS Bali. But before that, let me introduce myself. My name is Arya Mahaputra. I'm one of lecturer in the medical surgical nursing in ITKS Bali. Okay, now I share my presentation. Okay, pardon, Ajahn Panarut. Can you see my presentation and the
Yes, I can see
screen?
it very
yes,
well.
okay.
Yes,
Okay, thank you. Okay, the first of all, I want to inform about the COVID-19 outbreak effects in Indonesia. As we know, the COVID-19 outbreak started in Wuhan, China in December 2019. In the 3 months later, Indonesia also have experience about the COVID-19. And because of the outbreak of COVID-19 spread widely, the president of Indonesia declared about the national disaster in April 2020. And responding to the president instruction, Ministry of Education and Culture in Indonesia established announcement letter about work and study from home, supporting to the local government too, to the all campus or college in Indonesia. ITKS Bali as one of campus in Indonesia, responding that issue, that instruction, so our rector in ITKS Bali issued a distant learning policy to regulate work and study at home. Okay, and about the campus policy, learning process finally is carried out at home through online learning. And director gives an option to choose any kind of learning method suitable for the student. For example, learning management system or using other platforms. So based on the instruction of the government and policy at campus. So this is an example of the learning management system of ITKS Bali since 2 years ago. This is learning management system of LMS, can facilitate students to access the information, the presentation or PowerPoint slides, the media, which given from the lecturer to the student, and also student can discussion in the LMS. But maybe we can say that weakness or the lack of the LMS is a need more bandwidth to running well the LMS. because without enough bandwidth, the learning management system can slow respond, so can disturb the online learning. But to resolve this problem, our campus or some lecturer using the other platforms such as Zoom meeting, Google Meet, Google Classroom, and WhatsApp group to using online learning. Okay. Okay. Now about the medical surgical nursing program. In our campus, particularly in medical surgical nursing program, teach both theories and practical. And both methods are delivered through online learning. So that the question, why practical courses or practical method are delivered through online learning? As we know, the practical courses carry out with the online learning carry out with the aim of improvement the skill. So to supporting a student improve their skill about the medical surgical nursing, they need practical fields such as hospital. But in this condition, especially in the pandemic, especially in Bali, almost all hospitals did not accept the student to practice in their hospital. Why? Because they afraid if the student practice in their hospital, they can infect the SARS-CoV-2. So they did not accept the student for a while until maybe the next time after the pandemic. So to resolve this problem, our campus take a lead to online learning in practical courses. And same with the theories online learning, director gave us a lecture to use some platform consider the student needs. So what the difference in theories and practical courses? I can say that the difference is a media, substances, and evaluation. So what about that? I will explain in the next slide. So this is the process of the online learning. Before pandemic, we use offline learning process, starting from appointment between the student and the lecturer about the time, about the class, and then continue to teaching with the PowerPoint slides and discussion about the journal, else, and finally dismissal. And the online learning process during pandemic is not, there is not significant differences. It's starting from appointment until dismissal too. But the differences of the online learning and the offline learning is, especially in the perspective of the lecture, we cannot observe the student what they are doing during online learning. That the differences. In the offline class, in the offline learning, we can observe the student what they are doing, still focused or still serious in our learning process. But in the online learning process, we cannot see that. We cannot see the student is asleep or maybe they doing the other activities. So we cannot observe that. That's the lack of the online learning process. Except we give rule to require activating the videos so we can see them what they are doing or still focus in our online learning. And the focus one is the differences of theories online learning process and the practical courses in online learning process. In the theories online learning process, it's same with the online learning like usually we do from appointment until dismissal. But the differences of the practical online learning process is about the substances, the topic or the media we can use to the online learning process. I mean that sending videos or the PowerPoint is focused to the practical skill. In the theories, maybe we can say, for example, we say about the dengue hemorrhagic fever. maybe we can say what the definition until what the intervention of the theory is in the nursing. But in the practical online learning process, we focus on the practical, what we can do to monitor the fluid, maybe how to use or how to install the IVFD, focus to the how to install the urinary catheterization, maybe. So we can focus on the practical skill, practical skill, because the student cannot hands-on to the patient. So that's the problem for the practical learning. So in the online learning of practical courses, we just can give them or sending them more videos or PowerPoints of the practical skill. So can the student get the describe or get the picture how to do the procedure of one or more practical skill. So that's the difference. The substances is the difference. The second differences of the practical courses in online learning with the theories online learning is the evaluation. As we know, the theories online learning, maybe we can evaluate in the quiz, such as using Google Form. But in the practical online learning, we can use demo video or by making a video. So the student have to make a video about one or more practical skill and then send to the lecturer, and the lecturer can evaluation or give the feedback if needed to improve the skill of the student, what they take the practical skill. So I think that's the evaluation can we do in the practical courses if us used on a online learning process. Okay, this is the obstacle during online learning. Based on our experiences and evaluation after 6 months of online nursing, the problem that we find in the during online learning in the theories or the practical online learning, the first problem is how to use the platform, and the second problem is the signal. Okay, what the meaning of the how to use the platforms? In the first month or at the beginning of the pandemic, in the beginning of using online learning, the ability of the lecturer or student about how to use some platform is like. So this is make our lecture and in the first month and the second month, make our lecturer and student adapt the platform. So we learning about how to use the platforms, but this need time to use it because like we know that not all people can use the platform. It depends on the individuals. So need time to use the platforms. And the second problems or obstacle during online learning is the signal. Because we know that in Indonesia, not all areas or all location has get a good infrastructure, especially in the signal, in internet signal. So based on the experience evaluation of online learning addressed to the student, they said that the problem is the signal, the internet signal in their home. So in this, to resolve this problem, especially for the lecture, need to using more platforms. So considering the student needs, if the student can use the platform like a WhatsApp group, the lecturer have to give them the information or the lecturing or teaching with the WhatsApp group, because not all students can use the platform like a Zoom meeting, which need more enough bandwidth. So some may be student, if they have a signal problem, we can use the other platform to teach them. So how about the learning outcomes? Even though we use even though we can, we found that two problems before I say it, but the learning outcomes can still achieve. that seen from the quiz score mostly met the standard and some score were outperformed. But different with practical online learning, the assessment result on skill averagely met the standard, but some results still need improvement. So this is the problem to a lecturer to give them more educational approach maybe to make or to help the student improve their practical skill. So the suggestion of, based on our experience, the first suggestion is discuss still or always discussion to choose platform using in online learning, consider student needs. And the second suggestion, if their student have problems such as a signal, lecturer can sending the video or PowerPoint slide with the other platform. And the third suggestion is sending the student more videos about practical skill and give chance to practice in their home. So they can using in their family maybe to to give them nursing care. Okay, thank you for the time. Thank you for attention. This is the last my presentation. Time is your Achan partner.
Yes, Maha is very good presentation, and we learn from that what Indonesian face, and that now you still work and study at home for the student, or they can come to the college, or 100% at home.
Okay, now we use hybrid maybe Achan Panarot. We starting from hybrid learning because some of the student, especially for the laboratorium or practical before they go to the hospital, we use the blended learning. So some student go to campus, go to the laboratorium, and some campus, some student at their home.
Okay, so that is quite challenging for the practicum if they're at home. As you mentioned, that the hands-on materials such as video or PowerPoint for the skill practice is very important. So now for how do you give them the hands-on? So you just give them video, PowerPoint, or you give them some small device that they can practice, such as dressing wound or the do suture. Do you give them some small device to practice or not?
For now, we use the blended learning because the hospital now accept the student to practice in the hospital, Achan, actually.
Oh.
But before that, before this hospital did not accept our student to practice their hospital, we still use the sending the videos, like I said before, just sending a videos of how to do the procedure of practical skill, like a wound care or something like that. Just sending an explanation about the topic using the platforms. Just do like that. But now I am very lucky because the hospital now starting to accept the student, so the student can hands-on to the patient now, in the real patient.
Yes, that's very good. Let me discuss about our Thailand situation. Usually the Thailand is we have assigned categories as a red zone, yellow zone, green zone, something like that. And let's go to the very red zone for the in Nonthaburi. How about I would like to ask Dr. Kamulat about the practicum courses right now that you organize for the student, because I know that so now we still have the problem and Jawat Nonthaburi is on the red zone.
That's quite a hard question. Yeah, like for practicum, and when we got ordered that we can't have more than 10 students in one room, we have to think very hard how to make the practicum go well. And fortunately, like the Thailand Nursing Council, Nursing and Midwifery Council have allowed us to have like simulation or like virtual practicum, and they give credit to that. In the past, we can't have practicum outside the setting, like the service setting. We have to do it in hospital or in the real situation. but since the COVID-19 situation has been long and doesn't look like that it's gonna stop. So Thailand Nursing Council has allowed us to have practicum in their simulation or virtual, use it as virtual. So in Nonthaburi, what we have done for just last semester, we got students to do the online for 2 weeks. And then after that, we plan for them to do the practicum in our skill lab. But we have to plan really hard because like think that before we send 8 students to 1 ward, and we have so many wards in hospitals around Nonthaburi. But now we have to have every group in the college. So how many room and how much the resource, how many models that we need for student practice. So the plan very important for that, and everyone will need to help, but at least we pass everything, and our student has gained their our students have gained their practicum skill that way. Is that does it that
Yes.
did I answer the
Yes,
question?
yes, you're right. So you use simulation based, and even though like that, we still control the regulation, right? If we do simulation based, it have to keep 1 teacher per 8 student. Is that correct?
Yes, that's right. And especially we have to look at the learning objective. That's the important thing. We have to look at learning objective, what they need to learn, what they need to practice, and then we have to do lots of case study. Sometimes we have to do the patient standardized patient, and we need to get someone to pretend the patient, and that way the student can learn well too. And I think the most important thing is the design and the plan and the cooperation among the staff, because like you need to know that in one subject of practicum, what you need to achieve, what you need your student to learn. So you have to design who will get student to learn what, and how many cases, how many studies that you need student to get experience.
Yes, that is very good. I like the word co-creation. That is very important word for this current situation. So we go to Dr. Sukjai. She is in Chonburi. That for right now, situation better. I think it's better than Bangkok and Nonthaburi. So how about your teacher provide for the practicum course?
Thank you for question. It is very interesting when we have to change our practice from practice in the real situation into practice online. At first time when COVID-19 pandemic occurred in Chonburi for the second wave, it was very serious. So at that time, we have to practice online as well. And I will show how we do that in my presentation later. But now it's, the situation become better. So now I can recruit my students back to the school, but we still cannot practice in the hospital because the hospital doesn't allow us to practice with the real patient now. So we practice in the simulation lab with a small group learning, like in Boromrachani College of Nursing, Jangwat Nonthaburi. And I think we do the same with all nursing colleges, that we try to help our students gain skill, nursing skill by the simulation lab as much as they can. And hopefully we can make them practice again in the real situation before they graduate, because many of my students, they still complain that they want to practice with the real patient in the real situation because it's the best way to gain the practice skill.
Yes, that is a very important practice because we are nursing students. I think the participants need to know our context a little bit. For the nursing in faculty of Boromrachani College of Nursing, usually our students stay at our dormitory. And before you take the student back to the college, you have the regulation to separate students 14 days, something like that. Is that correct, Dr. Sukjai?
Yes,
Yes.
14 days.
Yeah, we follow the regulation, and they have to stay at the dormitory with very keep physical distancing and a lot of preventive measures, as the government said. So for Dr. Pacharapon, I think Trang is a lot better than all of us. And but I think that your students start to be able to practice in the hospital. What is the regulation of the hospital? Do your students have to inject the 2 vaccines or have to swap for the RT-PCR, or what else that your student have to do as a regulation of the hospital?
Thank you, Dr. Paneras, for the questions. But right now, the Trang Hospital or our cooperative hospital doesn't allow our students go back for the practicum course and practice in the hospital yet. But as you said, we have the requirement that all hospitals require all students to get vaccinations before they go back to the hospital. And lucky for us that Trang situation is always under control. And we never thought about online practicum course, yes, because we never faced this kind of situations. But we may talk and discuss a little bit in case the COVID-19 come back, or and maybe other emergency situations. Maybe online version simulation would need to be applied in any college. Maybe just finger crossed that we don't have to face this kind of situations again. Thank you.
Yes, that you still have a regulation from the hospital. For the Maha, for how about the Indonesian hospital? Do they set the regulation for student or not? What kind of regulation for student that you said that some student they allow to practice in the hospital? Do they have any regulation before that?
Okay, Ajahn, about the regulation is different each location, especially in Bali. The regulation for accepting student to practice in a hospital now is about considering the situation, right? I mean that because the situation of COVID-19 in Bali, as in this moment, is get vaccination or something like that, make a different situation. So the chance for students to practice in the hospital now is open after the vaccination is comes from the early 2021. So the regulation about the hospital regulation still considering the condition of the COVID-19. If the condition of COVID-19 increase in the future, maybe after this second wave, maybe the regulation can change again to acceptance the student. But in this moment, the hospital still give the chance for the student to practice in the hospital. So I think the regulation of the hospital is different from each or one hospital to the other hospital, but in general they accept, but with requirements. I mean that maybe not in one hospital, maybe have the limited amount of the student, so they can give us the limited amount of student. So we have to spread the student in the other hospital so they can hands on the patient and giving the time, a different time, each group. So the student is the group of the student is different time to practice in the hospital. I think that the regulation, Achan Panarut.
Yes, you said that the same with in our countries depend on the regulation and depend on the how bad of the viral transmission in that area. So, and we still keep the first thing, even though we focus on skill performance of students, but we still need to protect their life. That is very important part. And just not only our student life, but our population and people life as well that have to be saved from our practice. So we have question that talk about they want to know about how we evaluate skill performance of nursing student. That is very good, challenging. And I would like to invite Dr. Sukjai to present her presentation before we asking the question of a participant that asking us. So Dr. Sukjai will present about the evaluation issue. This is a very big issue of online education. So, and how we come up with the effective solution for the very challenging issue on evaluation online education. Please, Dr. Sukjai, the time is yours.
Thank you. Talking about evaluation issue is a systematic determination of a subject merit, worth, and significance using a criteria governed by a set of standards. So in Thailand, the Office of the Higher Education Commission has set standard called Thai Qualification Framework for Higher Education. This standard have been developed to ensure a quality of graduate using a program learning outcomes. The TQF consisted of 6 domains for nursing education, including ethics and moral, knowledge, cognitive skill, interpersonal skill, communication and IT skill, and especially its psychomotor skill for nursing profession. Usually, when we talking about the evaluation, the principle of evaluation in my idea is about we need to use a valid methods and also assess or evaluate at a various time, not just only once for one student performance. So we need to assess or evaluate in several times of the performance or of what the student learned. And also it would be better if we can use a various assessor. So 3 various things, various method, many kinds of method, many assessor, and also in many times. Usually in the traditional classroom, it's not difficult to do these 3 various things for evaluation. Because when we teaching, we can assess our student during our teaching that we call formative evaluation, because we can observe their behavior from face to face. But when the teaching have to change, it's become a challenge for us. Usually the assessment, we have like a formative evaluation that is assessed for the process of learning of the student. And we have summative evaluation that aiming to assess the learning outcome. During this time of learning and assessment can be the process that students can develop their performance by the teacher that monitoring and give feedback to them. So the process of evaluation, I think, is a process of development. So we can use this process to evaluate our students from formative and summative. But like I mentioned before, that is not difficult for us to do assessment or evaluation in the traditional classroom. But when the COVID-19 occur, it have to be changed to new normal classroom. At first wave, it's quite rapid change for us. But for the second wave and now today, I think many of us get familiar to this kind of new normal classroom already. So the challenge come when we have to do assessment online, because we cannot see our students face to face. We cannot observe their behavior directly. At first time in my college, most of the challenge that I have listened from my colleagues is about how we can evaluate our student performance, and the issue that we most concerned is about tasks, especially when we do online examination. Many teachers concerned about how we can task our students that they can perform a test that we can think that is will be their real knowledge or their real performance, not make from others. This is one big issue for us. And another one issue for the teacher is about the IT competency that I already mentioned before when I answered the question from Dr. Panarat, that some of my teacher who's not familiar with the IT, especially teacher from the baby boom generation, they not get used to using technology. So I have to make a class to get IT training for them. But for the teacher in Generation Y, they are very happy to use the online education because it challenges them to create something new to do with the student. And this also the issue about the accountability and responsibility. Because like Dr. Kamolat mentioned before, when we teach online, it's different from face-to-face or traditional classroom for 1 hour or 3 hours teaching. Usually in nursing course, we have like 2 or 3 credits. So it took about 2 or 3 hours per course when we teach. If we teach online, it's different because we cannot make it last and the students still make attention with us. So the attention and retention is also a challenge from the student point of view because most of students, they get tired and also they get bored if we don't have active activity for them to do for 3 hours of teaching. And usually we do assessment or evaluation, like a formative evaluation during we teaching. So we have to do at the same time. When we teach, we also assess our student performance. If we know that some of them cannot get along, we have to repeat. It's easy when we see them in a person, but when online, we cannot see some of them. So some of them lost from the monitor and some of them lost attention. So we don't know. They still come with us. They still can follow the course. And another important challenge for us is about availability of computer and internet, especially when students they study at their home. Like Dr. Panala said, when we have a hit on the second wave, it's very serious in Thailand. At that time, many provinces have to close and the government announced that we don't allow the students come to study at the college. So they have to study from their home. Many of the students, they don't have internet available enough speed. So some, they leave or they lost from the class, from the examination during we teach or the we do exam. And also some of them don't have the computer notebook. They use their mobile phone. It is very difficult to do examination online using the mobile phone because the feature is different from the monitor of computer and monitor of the mobile phone. So this is the challenge that we have to face with at that time. This is the example of the monitor of one of my students who do examination online. You can see that for the student in this generation, they don't pay attention only on the test. They have many monitors that show one is on the movie, another one is on the exam, another one is on the handout that they give in class, and maybe they can check it and then answer. And also another thing, so they do many things at the same time. This is the issue that we discussed about the challenge that we have to solve the problem. So one kind of solution that I have to set early is about the training and give the clear policy and also tuning about the attitude. Even some teachers, they love online teaching, but some teachers, they feel this is very difficult for them. And many teachers don't trust the student if they don't see the student face to face. So this kind of attitude need to be clear, need to be tuned together, that learning and teaching, we have to trust each other. Teacher trust student, student trust teacher. And then after we trust each other, we can make something happen, something new happen. And the institute need to have the clear policy to support this kind of online education. So I have to buy some more application to use during this period of time. And also we need to support some kind of material, like buy more notebook, computer, and I also make the student loan money to buy the notebook for them, and also provide internet for them. One thing that is very good for online examination or online evaluation is about flexibility. Many teachers and students told me after we finished the class from this academic year, we have just finished it. So I I do a small survey, asking my student and asking my teacher, what is the best thing during the online education, and how do you do, and what is the recommendation that they want the college have to improve to provide education online again if it occurs, because we cannot deny that life is never same again. So the teaching also have to change, and we need the blended learning. We need to do the online with the on-site all together. And it is beneficial for all of us, not only pain, but it's many gains as well. One thing that people told me, both teacher and student, they love online because it's flexible. Some of them are busy during daytime. So many of them set class together during evening time or even night time between teacher and student. And they can do many things at the same time. This is one good thing that happens when we do online education. Another thing that might be one significant problem is about how we evaluate the performance or psychomotor skill. When we have to do online performance tests, we have to trust each other, like I told before. So my teacher asked the student have to perform their performance online and make a camera. So we do examination with camera. The student have to put the camera on the computer show for the teacher, and then we can observe their behavior on the camera. So I will show you a video that the student make video to show their performance. This is the second year student, and it's on the course of maternal and child nursing care. They have to perform how to do bathing, child bathing. So the student introduced herself, who am I, and they also pretend that the baby, they make their own baby. She make this baby from her child, and then she explain what the procedure, what she is going to do to the teacher, step by step. This is one way that we use the video and camera to assess the student during their online classroom. So this is an example. Not just only online examination with camera, we use various methods. Like I mentioned before, the principle for evaluation needs to be various methods. So some students really love games or quiz, like when teacher use Kahoot and then have a question, the student enjoy to answer. It's like a game when they play game. So this is really interesting for them and they like it. And also we use a varied assessor. So we use the peer evaluation and also self-evaluation. So not just only evaluation by the teacher. So it's kind of triangle to help students to see the view like a 360 degree viewpoint from themselves, from teacher, and from their peer. And then they can improve their performance. We also monitor and give feedback by students using the application that very famous in Thailand is LINE application. So we make a small group of LINE when we have a small group of learning, and also we exam on a small group too. And the student can express their feeling, or they can answer the question of the teacher more easily by LINE. I also use the Google Classroom and have the set of the question and test on the Google Classroom and allow the student to answer. Interestingly, that I think this one is more, I get more feedback or more active participate from the student than when I teach on class, because when teaching face-to-face on class, I have to teach about 150 students at the same time. So the attention that I can pay to the student is just only a few of students among 100. But when I use online, I can make them in a small group, and then I can follow the answer, follow their feeling and their participation on the Google later. And that made me have the feeling that I feel closer with my student more than when I teach in the classroom. This is something that I think is a gain for me from the online. So like I mentioned before, with our effort, we can overcome the challenge. So when at the end of semester, we evaluate the student achievement from the program learning outcome. Of course, every student can achieve their learning outcome from what we teach them and we evaluate them. And also many of us, especially the teacher, they gain more competency on the technology. And many of us enjoy and happy with the flexibility and freedom of learning and teaching. And of course, I think it's very important. This online education bring creativity to teacher and student. This is what I think is a big gain for us. Finally, I would like to end with this word. Evaluation is not for judging our students, but for developing them to be a qualified graduate. Thank you.
Okay, thank you, Dr. Suchai, for your very informative and give us examples. So the issue about accountability, responsibility, and trust is very important, as you mentioned. Okay, so we have one question from participant related to Dr. Suchai's presentation. So she asked about how many assessors, because you said have various assessors. Do you have some regulation or limitation about how many various assessors?
It depends on the course. So I just give them a principle of evaluation that we need to have not just only one assessor, because it's just only one point of view of people. So in the course, when we decide course, we have a committee that look together to check what kind of evaluation and assessment that we use for each kind of course. So we will have like at least 3 point of view, like I mentioned. So one point is self-evaluation, another point is peer evaluation, and the last one is the teacher evaluation. So at least 3, but not every time. Yes. It depends on the context and it depends on the subject.
Yes, so we still use the same principle of evaluation, have assessor, methods, and time, and key formative assessment and summative assessment. Okay, so before we have more discussion, I would like to invite Dr. Kamolat Turner for the very important topic as well. As we heard from this morning, that we need the IT, we need the computers, we need the platform. So that is the things that administrators have to think about it carefully. And because we have to prepare and manage all the educational resources, because this is supporting the education is very important. So may I invite Dr. Kamolat to present about the topic about educational resources preparations. Please, Dr. Kamolat.
Mention about Dr. Acara on this morning that he said today came, tomorrow came, but for me, for the learning resources, I think yesterday came, but today we have already came. And for the resources, learning resources, in terms of learning resources, I would like to show you one video to ensure you that with the budget, we can get good staff, good device or facilities, but if not, we can put fit around us. Let me suggest show you the video that was made.
I'd like to show you the doll cannot move, but this student very clever. I'd like to show you how she did it. The teacher asked her to find anything in her room that can make as a baby and do the bath and look, and she got the cat. I think this cat cooperate very well. That good, isn't it? So actually, resources not barrier if we can manage it well. So that's why I said yesterday pain, but today we have already gained. So from pain to gain or pain. I'd like to talk about the educational resources. So I might introduce you a little bit about the early stage of the COVID pandemic in Thailand. We start to have it in January, in January 2020. That the first wave, that what we call in Thailand, and then the second one, the government that's like us to call the second wave, so we call it the new wave. And then now we have the current wave. So we got 3 hits, like the first one in Jan, but the peak is in March last year. And then we got it again in December. And the current one, we got it around April. Last year, we have to close our school around March, that from 18. And then we have the declaration of a state of emergency on 26th of March. At that time, we all, I think, still like stuck, didn't know what to do, because that's the first time that we got this hit, and we never got this kind of situation. So the first state, I think, all of us feel pain before we gain what happened. At the time, we still stuck a bit with the digital disruption and try to do transformation. And on top of that, we have to try to adapt into the new normal. we have to rush to prepare for the resource preparation because we have classroom suspension. We need to change to be online teaching methods, and then we can't do clinical practicum in the real situation. At the first step, look at this. I like to show this because like one of my students that when we had to send them all home because the province didn't allow us to have students at the college. We need to ask them all go back home, and one of the students stay in the top of the mountain and no internet, no Wi-Fi, no anything. So I have to contact the health promotion hospital near there, and every day she had to walk down from the mountain to the ground, and then went to the hospital and used internet connectivity there. That how pain that we had, but at the time we didn't learn yet. So when the second wave or current wave hit, we plan that for students who have this kind of problem, we let them in the college, and then we ask permission from the governor that we got some students who have problem if we send them home. So some of our students can stay at the college for the current wave. And another pain, when we had to change the method of teaching, we had to try to develop overnight. We have to increase our internet connectivity. We have to buy more equipment. We had to try to set up like many nursing skill labs. I think like we're gonna run out of time, right? I try to be quick. And at the time we didn't know what is Zoom, Google Meet, WebEx, and Microsoft Teams. We had to learn which one better than another. We try Zoom, we try Meet, we use WebEx, and we use Microsoft Teams. And for the learning resources, we had to try to buy more of the models, the sim, and also we had to develop lots of learning innovations. For example, the AR, VR, MR, or even MOOCs. For the practicum course, we had to do virtual problem-based learning and simulation. So we had to do like online during the day that the student had to be home. And when the student can come back to the college, we do the virtual practicum. What another gain we have? I think this is the gain side. Like we start to have global learning resource exchange and sharing. Like before, we didn't have much of sharing for learning resources, but I think after the pandemic, people seem to be more kindly. I think like they seem to share more. You can see that we have lots of free access for online learning courses or learning material, lots of video clip that we can use for free. So this is the benefit for education. And I think like a thing that gonna make this success, you have to change your mindset, have to think that, okay, the pandemic can be the benefit too. You have to change from crisis to be the benefit. And another important factor is the policy. You have to launch quick policy to support that, how you can make, how you can change from pain to gain quickly. So policy person, very important. The policy to prepare everything, to prepare learning resources, like all the facilities, to prepare the staff, because like many of us, like the early speaker that said, some of our staff didn't learn about how to use like all technology for teaching, but they have to learn overnight. So that can happen because of the pandemic. So that the good side of it. And we have to prepare and manage the course very well. That what another big preparation we need. And also we have to prepare the student too. Students and also their family, because we found that when students are at home, sometimes their parents didn't understand that they are learning online. So their parents ask them to wash the dishes, to do the housework, to help raise or look after their younger sister or brother. And continuum development, very important too, to try to get them all, both students and staff, to have their ability of digital literacy. That's very important for online learning, and transform both their idea and then their methods of teaching, and adapt to new normal of learning activities to get desired and qualified graduates. Empowerment is another issue that we need to do it along the way to change from pain to gain. And everyone, we need to be ready to change. So that I think this slide can tell you the solution for preparation of the learning resources for the new normal way of education. The mindset, the policy, empowerment, these three factors very important for you to be success in your education during COVID-19 pandemic. And that was I'd like to share with you. Terima kasih.
Thank you, Dr. Kamola. I think your last slide is very important.
That we just change our mindset, and in this we learn from pain and gain. So today I think we run out of time, so unfortunately we don't have the time for answer the question much. If you have any question, please feel free to type in the chat box. All panelists still here and they will type to answer you after the conference and during this conference until around 4 p.m. as well. Please feel free to type on the chat if you have any suggestion or the question. So as we see that even though the COVID-19 pandemic is hit us, but we still cope and we still make a lot of solutions. I like the idea of the kitten, of that you make the cat to be initiative, that we can see that this is creative for the student as well. But of course, the principle of education is still important. The policy, the teacher, the student, and the stakeholder, including the community, the hospital, that have to be together, and including the parents of the student. We all together, I think we can fight with the COVID-19 and we can win with that. And we are going to change from the pain to gain. And I think right now, many people gain, but we are going to do that more. So this is very great section. And I would like to thank all the panelists today, including Dr. Pacharapon, Mahaputra, Dr. Sukjai, and Dr. Komalat for your very great presentation. Thank you very much for everyone. Thank you. So participants, we are going to have the next section that is on panel discussion is on innovation in teaching and learning during the new normal era. You see from the first section, you hear some innovation, but we still have more. I think the second section is very interesting topic as well, but I think some of you might want to relax a little bit, as we said that the burnout or that exhausted is very important. So we are going to have a break for 5 minutes and we will come back for the second section. See you soon.
Good morning อาจารย์โนค่ะ
Okay, everyone, welcome back. I think you have a little relaxing time for your break, because if we are on the online for a long time, you might very exhausted. So now I think I'll ask Lady for the second panel that is very interesting topic. So the panel discussion will be on innovation in teaching and learning during the new normal era. So because of COVID-19, it's opened the opportunity for us, as Professor Vichan said in the morning, that it's opened the room for us to have a lot of innovation. So for the second session, you will hear our innovation that we have, and hopefully you can apply some innovation and can share with us your innovation as well. So I would like to introduce the moderators of this panel. Her name is Dr. Olarat Wangpadit. She's a pharmacist at the Sirinthorn College of Public Health, Chonburi, Thailand, that we are under Paparom Rajanok Institute of Thailand as well. Hello, Dr. Olarat, are you here? Yeah, I saw
Yes.
you. How are
Yes,
you?
thank you. Fine. So far, so good.
So very good. So I give you a floor, and then for the innovation. Okay, the time is yours.
Okay, thank you very much, Dr. Panarat, for an invitation and introducing me for this panel sessions, the session 2, I would say. This session is about innovation in teaching and learning during new normal era. And I have 4 panelists with me. This session is focusing on the experience on educational approaches and theoretical courses, practicum courses, as well as the evaluation, effective solution, and the resources preparation that we have from traditional approach to the new approach during COVID-19 pandemic. And with me, I have 4 panelists, as I mentioned previously. The first one, I would like to introduce, briefly introduce all the 4 panelists together before I give them the stage. The first one, I would say that I would begin with Assistant Professor Dr. Laiyat Jamjan. She is an instructor as well as the former dean of the Faculty of Nursing St. Louis Colleges and the former director of Paparom Rajanok College of Nursing Noprat Washira. Good morning, ค่ะอาจารย์ละเอียด สวัสดีค่ะ And Yes. Ha. And the next one, I would go further to Assistant Professor Dr. Amarin Ratanawit from Department of Industrial Physics and Medical Instrumentation. He also the department head as well as the head of Laser and Optic Research Center from 2012 until now. Good morning, Dr. Amarin Ka.
Morning. Yeah, pretty good. Yeah.
And the next one, she is in Pabarom Rajchanok Institute as well. She is the speaker from Pabarom Rajchani College of Nursing Nopparat Washira. I would like to introduce Dr. Suchiwa Vichaykul. She also the Deputy Director of Research and Academic Services. She was the Deputy Director of Student Affairs of Pabarom Rajchani College of Nursing Nopparat Washira. สวัสดีค่ะ And the last but not least panelist for me, I would like to introduce Mr. I Kadek Neryanto from ITKS Bali. He is a instructor of community nursing and he has experience in community nursing teaching since 2006. Please welcome and สวัสดีค่ะ เนอะ สวัสดีค่ะ สวัสดีค่ะ He is quite familiar with Thailand because he is one of the master student of Nopparat Washira College, right? Okay. All four panelists already been introduced, so I would like to begin with the first one. But let me inform you, the audience, if you have any questions or comments, you can leave it in the box here in Zoom. You can leave in the chat box, or you can ask someone beside you and let them leave the questions in live group as well. But it's easier for you to leave in the chat box about your comments and questions. Now, we would like to begin with Dr. Suchiwa first about the integrating tele-education and entertainment to encourage and evaluate students in online classroom. Please, Dr. Suchiwa, the time is yours.
Can you hear me?
Just really, could you speak louder?
Can you hear me?
Yes, very well.
Okay. Okay. Can you hear me? Can you see my slide?
Yes. Yes.
Okay.
Yes.
Share. Okay. สวัสดีค่ะ Good morning and selamat pagi everyone. My name is Suchiwa Vichaykul from Pabarom Rajchani College of Nursing Nopparat Washira. Today I'm grateful to share about my integrating education and entertainment to encourage and evaluate students in online classroom. Let me go to the next slide. According to the online pedagogy, there is the same objectives as the classroom learning. The alignment of outcome and learning objectives are also required within this platform of teaching as well. I think so we heard many things about the online classroom before from the previous speaker, so I will go maybe fastly. To meet the objective of the learning outcome from the subjects such as like TQF, as Dr. Suchai mentioned before, and also we need to meet the 21st century skill as well. There are many challenges for teacher to decide the learning activities and encourage the student to pay attention that we face the problems while we teaching before about the online classroom, and we have also designed the many learning activity in the online classroom, and we still have the problems as well as because sometimes they have many like a dilemmas. So we try the best to force our students to meet the learning outcome, and today I will focus the one of learning activity like a game-based learning to encourage our students. So as the online classroom, we also have to focus on the Bloom taxonomy to evaluate our student as well. So in digital taxonomy, we have many like tools like a material to evaluate our student. As one of the thing that we use a lot is a Kahoot that as Dr. Suchai well. So I will go like show some material that like a like a useful for our teacher to force our student as a game based. So as if we talk about the game based, so we also use in the classroom as well, just like crosswords or something. So, but in online game based, we have many like materials to use. But in the process of using game based, first teacher need to introduce about the game manuals and directions, and also the rules of the playing of to the student before start, and allow students to play the game. And also the teacher needs to give the worksheets and learning outcome need to be clarified before start the game. And then the next process, the teacher needs to like allow students to play and give a timetable for them. And the final process, they need to reflect their like a learning outcome and conclude the present learning outcome to the teacher. This one is like the rule of the using game based in your uh, learning design. And today I will show some of the equipment that the teacher can apply to use with the game base, and also you can use the content while using this program as well. Let's go to Edpuzzle. Anyone know about the Edpuzzle before? If you used to use this one, maybe you can share your experience as well. So Edpuzzle is the online like equipment that you can design your class or your content. For example, that I use this one, I upload the Denver developmental exam with my subjects, and in this program, while the student open the like online video, and if they come to the part of some program, they have to like answer the question as the teacher decides like this. If they answer the questions and then they submit, then we go to the next part of the video. So this online equipment or track. The teacher can submit and design your content with this, and I think it's a quite good for students that they can learn the content of the subjects, and then they can check themselves uh, and feedback, and they can answer the quiz that the teacher design with this program as well. So it is not difficult to design for the teacher, and the feedback of my student is very good about this one. And the next one, we will go to the virtual games that they have many virtual online game that the teacher can apply. This one is one of the website that the teacher can submit and use the online virtual game to teach your student. So when the student learn this content and they can practice and give the feedback, and after watching this or playing this one, the teacher can reflect with the student for and like a check that they meet the learning outcome or not. This one is the other website or virtual classroom that the teacher can use to force the student to learn about the social activity and social life. And this one is the sample of the online virtual game that the student can learn about the National Geographic. And this one also is they have a application online to learn about antibiotic resistance, which maybe Ajahn or can apply with your student as well. And the other one is like the community crisis virtual game that you can learn about the social life and the problem solving skill from this online virtual game. And I also have like some sample of learning English program or application like a Duolingo that you can download to your mobile phones and learn about the conversations, the English words, and also the crosswords game. And the other one is like a Scrabble Go. If you used to play about the Scrabble, this one is an online Scrabble that the student can learn about the English words, and it's many applications that you can use for free in online and ask students to learn. And the next one is a Kahoot. I think many are like teachers use this one before, and we can learn a lot about this one. And if you did not like have experience about this before, it's quite easy to learn how to use. And they have a lot of published nursing education subjects online that you can search and apply with your subject as well, or you can create by yourself. I think we can use in like in real time for your student, or you can create and push in like a learning management system like a Google Classroom to ask the student to practice like post test as well or homework. So I think as the previous speaker told us before that they have many of the school use this one, and the other application online that you can use to entertain your student is like a Mengisi. Have anyone used this program before? Sorry, because I didn't see the response. So maybe I will talk about this one first about Mengisi, that you can create like a Kahoot. You can play real time while you're teaching, and also just make them like a lesson homework. I will show you this one that I designed and push it on the learning management system and ask the student to like a practice as like homework, and we can see the report of the. I will show you. This one is the report of the student work, and you can also download. And it will show you in like a Excel. So, and then you can see the answer of your student and which one, and also you can evaluate, and then you can use the score to evaluate your student as well. Okay, let's go back to the slide, the main slide. So while they are learning and they can evaluate themselves, and I think this one, if you use in the classroom, like an online classroom, like as a real-time class, maybe it's make them to compete, like compete together. Yes. The next one, like a Google form that you can design the quiz, like a homework for them as well. Sorry, it is like Thai versions. So all of this is like an application online that we can apply to like a game or quiz, online quiz, that make them to evaluate themselves or practice. And I think it's make our students like a fun while we are teaching, or sometimes we use those of them to reflect their skill after class as well. And the key success for clinical teaching is as I want to mention, is material and internet access, including accessibility is very important due to speed of internet both teacher and learner. That's one is will make the problem if the have low speed of internet, because if the student cannot access to the online classroom or online game that you are design, that it will make them like a bored and don't want to join, don't want to participate with the classroom. And the second one is the teacher have to gain have that skill of teaching to encourage and empower the feed forward to the learners. And also the teacher have to learn about to use the technology and have to get the digital literacies. The last one is the learner have to get the high responsibility and honesty while they use the online classroom, because if they ignore and they have don't want to participate, it will the learner will not meet the learning outcome. So maybe if you have any question, you can ask, and after that the MC said you can ask in the chat room, and maybe we can answer later on. Okay, that's it.
Well, thank you very much, Dr. Sushiwa. That's what a very nice one. I myself have used some of those, especially Kahoot. Kahoot, I use it many times, and I would say that students enjoyed it very much because only the lecture itself is quite boring for a really long time. For example, 3 hours, and they could not focus. Whenever I introduce Kahoot, everything just changed and they have energy one more time. Kahoot, Quizlet, and many things I have used in my class as well. This is a good example for technology and application that we could use in our classroom to make students enjoy their class and still have content of what we would like to deliver to them. Well, that for the lecture, mainly for the lecture, I would say. Next, I will go further to practice, and let's see what they do on the practice and use the technology. May I introduce Mr. Kadek Noyanto to present the innovative online learning for community nursing practice during COVID-19 pandemic, and the questions about the application or any evaluate student things that Dr. Sushiwa had, you can leave it in the chat box and we can go over it later after Mr. Noyanto. Please, Mr. Noyanto, it's your time.
Okay, thank you, Dr. Horara, for the time.
You may have to speak louder.
Okay, now you can hear my voice.
It's better.
It's better. Okay, thank you. I want to share my slide. Okay. You can see Dr. Horarat, my slides.
Yes.
Okay. Good morning, everybody. Very happy to meet you all in the virtual conference today. Today, I would like to share about the experience of our students at ITKAS Bali when they're doing community nursing practice during pandemic COVID-19. As we know that pandemic COVID-19 make change all of our activity in the world, including in the education. Community nursing practice that we do at ITKAS Bali before COVID-19 as our normality lives. We can do all of community nursing practice in the community. We can do assessment, meet with the people in the community. We can do community meeting 1 and 2, doing implementation and evaluation in the community. But when the pandemic COVID occur, we cannot like normality lives. So we setting all of the process community nursing practice by online. Some of the reason why we conduct community practice by online. The first one, because the pandemic COVID-19. As the presenter previous speaker that mentioned is in our government have a larger scale social restriction, and then we have regulation from government to work from home. So we cannot do some activity, meet with the people, meet with the community. So we setting some of activity in the community by online system. And then in the educational, we have a regulation from Ministry of Education and Culture of Indonesia. As Mr. Arya said that we have work from home. That's why we setting the community practice by online system. And the last, we have the curriculum of nursing profession in ITKS Bali. So the student must have a practice in the community. This is our situation in Indonesia during pandemic COVID-19 in March and then up until September. So the number of cases, the pandemic COVID still increase. And then this is government policies on education, and this is our curriculum of nursing professional at ITKS Bali. Nowadays, nursing community practice at ITKS Bali, we use all of activity from assessment and then diagnosis, intervention, implementation, and evaluation by online system. For the first one, in the assessment, before we doing assessment, the student conducts tool that they want to use to access information from community. The student discuss with supervisor to make assessment tool with online media. In ITKS Bali, we use Zoom application is very common we use by a student. And another application we use Google Form, Google Meet, and WhatsApp. After the student have assessment tool, the student conducts the tool by Google Form, and then the student send the Google Form to the community by email, WhatsApp, or other social media to collect the data of the community. The second process of community nursing practice that the student do is in intervention. The student conduct a community meeting one to discuss with the community to determine of the problem based on their data. After that, the student and community make the priority, solve the problem. All of this intervention we set in the Zoom meeting. So we can invite the community for the conduct intervention. And then the third one is implementation. We have some implementation practice in the community. The student and the community doing implementation based on the plan that they have been done when doing community meeting one. For the implementation, the student using some video and then some poster and also leaflets. All of the implementation they're doing by some platform like as mentioned before, like Zoom meeting, like Google Meet, and also WhatsApp. In the last slide, maybe we can see the video and then some our picture that we do all of our activity in the process of community nursing practice. And then for the last process for the community nursing practice is evaluation. The student and the community conduct of community meeting to evaluate the community problem. The community meeting one also they conduct using Zoom meeting is a very common we use in ITKAS Bali. These are some experience that we conduct in the community nursing practice before and during COVID-19. The first one, like I mentioned that we do assessment, we set the tools, and then the tools we set in the Google form, and then the Google form we send to the community by WhatsApp, email, and another application. After we have the data, we have collect the data. After that, we have a community meeting once. So these are some example that the student explain about the community meeting one in the community by Zoom meeting. So they can present about the data, and then they can make the problem with the community, and also make a priority of the problem to solve what they can do in the community. These are some implementation that the student do in community by online system. So the student make some video, and then they can share for the community, and then they can explain the video with the community by the Zoom, Google Meet, and WhatsApp. Another video also the student create some brochure, leaflet, poster, and another media for give some education for the community. And then the last for the evaluation, we still conduct the community meetings too with the Zoom meeting to refer the problem, to follow up the problem in the community, what they must do in the community when the student not stay, not can doing anything in their community. Okay, there are my experience in ITKAS Bali to conduct of community practice during pandemic COVID-19. Maybe I have a video to can share some information about what we do in the community. Please play the video.
Hello everyone, very happy to meet you all. Today I want to share about community nursing process that ITKAS Bali doing when pandemic COVID-19. The first process is community assessment. Before the student doing community process, they must develop tool to assess the community. After they have community tools, they create the tool in the Google form. The student send the Google form by email or WhatsApp application for every participant in the community. is the sample that the tool community that the student send by WhatsApp and email. After the data collection, the student doing the analysis data. The second process is the community nursing diagnosis and intervention. After analysis data, the student create community meeting 1 to discuss with the community about the problem, priority, and discuss about the planning to solve the problem and make the schedule when the planning can be due. After the student and community agree with the planning, the student doing implementation based on the planning. The third is community nursing implementation. Is some activity that the student doing implementation in the community by application Zoom, and the student also send video and leaflet in the social media like Facebook, Instagram, and another social media. The last process is nursing community evaluation. The student doing evaluation to refer to goal and objective to follow up the plan. This is the sample of the evaluation that we doing in online process by Zoom.
Okay, that's all of my presentation. Thank you very much. Good morning.
Well, thank you very much, Mr. Nuryanto. That was a very interesting presentation as well. I do have a quick question for you. Actually, it seemed like you use the telecommunication for the community meeting with the community. So is there any problem like people in the community, they don't have, do all of them have internet connection and the device they can use with the teleconference with your students? So they have all of this. You don't have any problem with this, or your student have to set it up for them?
Okay, thank you for your nice question, Achan. Of course, we have some problem when the student occur the community meeting by conference or Zoom meeting. The first one, like you said, that the signal. So some of the area in our community is not good signal, but the problem we can solve, we can share in the WhatsApp group. We can communicate with the community by WhatsApp, because the WhatsApp can cover maybe all of our places in the community. So the problem maybe can be solved by the WhatsApp application. Thank you.
Okay, thank you. Because in Thailand, WhatsApp is not that famous, so we generally use Line and other application. But some of the community in Thailand, they don't even have the device, the smartphone to use it. So that might be a problem for the community meeting with the student for the teleconference. That what really an issue for this one. But thank you very much for your information in Indonesia. Maybe we have to look in WhatsApp. Maybe it might be useful in Thailand as well. Thanks. As again, everyone can put the questions and comments for Dr. Suchiwa and Mr. Noyanto in the chat box, and we can go back to ask them later after all of the 4 panelists have present. Yes, Mr. Noyanto, you want to speak something?
No, thank you, because I heard that my voice not loud because this microphone is too long in my mouth.
I can still hear you, but I have to turn my speaker a little bit more, but that's not a problem. Thank you anyway.
Thank you.
Thank you. And then we are moving to, because we are a little bit behind the schedule, so I will just skip the question and answer session for my 2 panelists, my first 2 panelists first, and we come back with them later. And I will just move forward to Dr. Amarin Ratanawit to present his presentation about biomedical engineer and nurse partnerships for innovation project. That would be a very interesting one for the nursing college for this presentation. Please, Dr. Amarin.
Okay, thank you very much. I'd like to share the slide. Okay, so it's good, right? Okay.
Yes.
Okay, so yeah. Okay, so maybe I start. Okay, so first we'd like to thanks for the opportunity from the conference that allows the KMT NB teams from the physics department and the part of the biomedical engineering team to present the process of the biomedical engineering nurse partnerships for innovation projects. Okay, first I would like to introduce the BME team. Consists of the Dr. Surapan as a team leader, and he also the Dean of the Faculty of Applied Science, Professor Payung, Dr. Rocherin, Dr. Thiralat, Dr. Sudalat, Dr. Sumet, and myself, Amin Ratnawit, and all credit of the work here is going to be devoted to the BME team. Okay, so the first we like to introduce our university, KMTNB, and we as well known as some of the name of a Thai German, and we focusing on the innovation, especially in engineering, and the department. Our department located inside the Faculty of Applied Science, the Department of the Industrial Physics and Medical Instrumentation. The BME program is one of the program in the department. We have roughly about 900 students for the several of the program in the bachelor degrees program, and about 20 students for the graduate programs. And we also take care minimum number of 2,000 students for the engineering student of the university who going to take the physics classes. All right, so there are going to be some background here, and just move on to the point. The innovation program for the BME biomedical engineering. The program goals that the first, we would like to develop the knowledge base in biomedical engineering. And the second, we would like to do the prototype of the medical device. The broader impacts, we would like to educate and train students, and then cooperate with medical and nursing school. And also we would like to promote or enhance the innovation research capacity at KMUTNB. So the first problem that we need to keep in mind, the first that, okay, we are going to be the engineer. We're gonna train students to be a good engineer. And what we need to balance that the engineering and the leadership skill, they're gonna be very, very critical requirements for this current situation. The first thing that we have to concern is that about the project management, the leadership, how to work together with other engineering design. You can get some problem of the engineer and you want to design something. And then when you build something, you need some kind of a tool. One of the tools that you need to have is that you need to be able to do the computer programming. And the next thing is that you need to be able to know the electronic troubleshooting and test engineering. This is going to be the center of the skill that we need to focus for our student. And this kind of the problem, this can be one of the solution that we need to do some project. This project is going to be based on the medical device innovation project. And we got to focus to the 3 technology right now for electronics, sensor technology, and Internet of Things. So we wish that our students going to learn this technology and using some skill that we would like them to learn and then combine together and then get something new, something advanced, something exciting for them. And then, yeah, we hopefully that we're going to get a new good engineer in Thailand. So that the first thing that we want to do the background or the basic understanding how to do the works. And we use the design thinking approach. And you will know that we have to teach about how to emphasize, define, get the idea, do prototypes and the testing. And then this is going to be the first concept that students need to keep in mind in order to do the project. And then another thing is that we are engineer, and some point that we refer to, okay, the TRL level proposed by NASA model. This can be categorized to be about the 9 steps of that. 1, 2, 3, 4, and 5. We would like to have the student that have some kind of the project or the opportunity. Maybe start from DIL1, the basic principle, what it could be, and then go to the second, the concept, and then do some experiment, and then it's going to be some kind of good project. And then this is how we start. I'd like to give to have this opportunity to thanks and for the first one that give us the opportunity to work with the doctor and with the clinical problem. We will start the project. Actually, Dr. Surapan and Ajahn Payung started a project about 10 years ago with the Panitia hospital, work together. And then after we have the BME program, so we cooperate more, and the student can be the chance to get a challenge of the clinical problem. So how the project works is quite simple when they start the project. Dr. Surapan and Ajahn Payung, the two of them start the project by joining the innovative clinical project settled by the last WITA hospital. So the first one that the engineer and the doctor or nurse is gonna have some meeting to each other, make a discussion what is going to be the problem and what it could be the solution. And then they're gonna build the prototype, and then the patient come to test, the nurse come to test the prototypes, and if the test fail, it's not working, can we repeat again and again until it's certified by the two party, the engineer and the doctor and the nurse. So that's how it's worked and how it start. And then this project has been extended to do some exhibition, the open house of WITA hospital, and with the cooperation with KMTNB. So the biomedical engineering student join the exhibition, show their project that they work on for the whole year, maybe 1.5 years or so. So that's gonna be how we start with that. So we start with some feedback and something that we don't know. People say that it's good that you know what are you doing, but some might say that, well, and you should know that what you not knowing very well. So that we try to figure it out. Okay, we know very well, we believe we know very well in the term of engineer, but how about the patient? We have some more information. We need some more information about that. So to further development of the program, so we think that we need a partner, because we need some group of the people who know very well, know better than us about the patient. So that's why we join the innovative program with the Brom Ratchathani College of Nursing, Bangkok. So that's gonna be the first cooperation between the two groups of the engineer and the nurses. So we use some approach that we cooperate the term of the project in the classroom, and then we make a discussion in the classroom in terms of the thinking designs, design thinkings of innovation projects. And we aiming to invent and implement the new medical device and instrument. So that kind of the project that has been performed. And then what is the benefit? What is the point that we join with the nurse to do something in the project? The first that the biomedical engineer, they can respond to the patient need. We don't know about that much, that we need some information, that we want to get that information from the nurses, and the nurse can share their clinical perspective. And then who got the benefit? It's going to be the patient, that we got the new device to serve the patient, and that are going to be how the things work. And we keep working, I think maybe 2 or 3 years, and then the success that we receive in very recent year, there are going to be a lot of the project that has been cooperated with Brom Ratchathani Bangkok. But I would like to highlight the one that has been received the recognition internationally and locally in Thailand. That's going to be the simulation pregnancy box that received several of the award. And then some of very nice project, the Mama Sus, the project has been cooperated and working hard between the engineer and the nurse team. So that's going to be the project that we keep continues. We hopefully that we're going to do a lot more project with the Brom Ratchathani Bangkok. And then at the same concept that we start with WITA and we further to the Brom Ratchathani, and we also expand the concept here to join with the Faculty of Nursing St. Louis College. So we do about the same thing. Okay, we share experience, and we allow student, the engineer student and the nursing student talk to each other and decide what they want to do for the project. And there's going to be a lot of project that has been done. This can be the first from the concept, and then do the prototype, that what we want, and the students join to each other and get to know each other, and then exchange the knowledge between the engineering and the nursing knowledge. That's going to be the project has been performed. And very recent year before the COVID period, we have an honor and opportunity to make the side MOU with ITEX Bali, Indonesia. And we wish that after this or during this period, and if we can settle and understand what is the period of the COVID, how we're gonna live with it, we can further do some project with the ITEX Bali, Indonesia. Okay, that's gonna be how it's worked. And let me just have a few minutes talk about the COVID project in Kim Mongkut. The first one, the team leading by Dr. Surapan and Ajahn Payung, they do the project by build a UV sterilized oven. So this one can be used for the mask. That is we start with nothing. We start with the concept that how we can infection the mask, and then what we can do is that we just do the calculation of the UV lamp. We pick up the wavelength and we calculate the power, the optical power, the intensity of the light, and then we also do the calculation of the dose that need to be used. And then we in that time last year ago, we have no knowledge about the COVID, but project has been launched last year ago, and then we use kind of information that we can have, and then we do some approximation and we do some clinical testing. So this oven has been distributed to the hospital and the government sector. So that's going to be one of the project. And then one of the project here during the COVID, since we have a lot of the problem when we try to teach students, and then as you know that when we do the examination, the problem is that there are going to be a lot of the platform that you can use. That you can use the Google form, you can use some available commercial available, but the pain is that in my department, in our department, we have to take care roughly about 4,000 students this year. 4,000 students have to take an online exam. What it could be possible? So the thing is that we have a plan on the last December, that before the second event of the COVID in Thailand, and we were thinking about that. Okay, if we need to do the exam online for the 4,000 students, what we can do, and what could be the problem, what could we start? So we start the project we call freetest.org. So that time that the goal is that this platform can handle at least 4,000 students at the same time, and the exam time is about 3 hours. So that's what we want to do. And then as you concern that when the student have time, the challenge time on it online, we want to keep the minimum list that student that need to focus only for the exam. The things to be decided is that we decide to limit the time for each problem. So for each problem, we limit the time about whatever how or the level of difficulty of the problem. So for example, you can see that the platform is very easy. First, you go to freetest.org. You can go to right now, and if you have the password, you can enter the password. Okay, and then you can see the status of the exam. If you have the time of the exam, so if say the exam start now, you can click for the status, and then you get the exam, and then you do it. Okay, and the red box, okay, the red box with the time about 2.31 is going to be the time that has been limited. So this problem, you have only about 2 minutes to finish the problem, and then after that go to the next one. And then we also concerned to the connectivity of the internet. Sometimes from platform, when the internet go down, so everything go down, start from zero, it's going to be the nightmare. And I can tell you, 4,000 students is going to be the nightmare. And then how we start the project? We will start the project by doing the programming. Everything's done, and we test with the 4,000 students. 4,000 students of the Kim Mongkut, or of engineer and scientific student join the test. And the first test, yeah, it failed. Yeah, the platform or the website cannot handle 4,000 students, so it failed. And then we set up the parameter and then start again the second time. So it failed, okay? And then the next is failed for 5 times. It was a nightmare, but students keep patient because we told students that, okay, this platform is going to be yours. We don't want you to come to university to get a risk of the COVID, but you have to be patient that, okay, now we're going to help each other. You you test the system with us, doing with us. So this program has been tested, I think, more than 20 or 30 hours, and then we finally get the system that can be handled 4,000 students, and the platform can handle the time for each problem about 1 minute. So if you want to get the student to do something in 1 minute, this platform can do it for you. And then if you have the maximum number about 4,000, so it can handle. So that can be the project that has been done during the COVID. So as we say in the beginning of the conference, the COVID, sometimes in the positive side, they make us stronger, do something that we don't think that we need to do, but we just did that. Okay, that's gonna be the project. And the last one is just use this opportunity to introduce the new program, the sub-program in biomedical engineering program in Mengikuti, UC of North Bangkok. That's going to be focused on the laser. We build this project and to be ready to launch this year. We're going to focus on the medical laser spectroscopy, state laser system, UV laser. So this laser is going to be built. So we teach students to build the laser, to build the machine and test the machine, and we see next year what is going to be going on about this kind of the project. Okay, so that's going to be all of the story for I think for past few years and this year. And I would like to give the stage next to Dr. Lain. Okay, thank you.
Well, thank you very much, Dr. Amarin. I think there's a lot of things happening during the COVID-19 pandemic, and we have seen so many innovative from engineering side to help with the medical side, and that was very appreciated and for this moment and for the future as well. Well, for the last one. For the last panelist, I would like to invite Dr. Lain on the stage and present about the imagination to kitchen, from imagination to kitchen, future food creativity. I'm not sure if Dr. Lain is talking about food. We are approaching to lunch, so please be kind to us, Dr. Lain. The time is yours.
Okay, yes, thank you. I'll wait for a long time. I forgot to open the microphone. Thank you, General, and thank you, General Marine, to talk about the engineer will focus on the patient and should talk with the nurse. Then let me talk to my topic. But before I start, I would like to say that how beautiful that I see our director this morning. And then I would like to thank for the conference committee that work today is beautiful. I will go to my topic that talk about. Let me slideshow next. Agenda, can you see my slide?
Yes, Dr. Lain. It's your slide now.
Okay. It's just very like a easy topic, but from our idea and go to the kitchen. Let me thanks first to both them, Dr. Chintana Maidin and Dr. Suropan that KMUT Dean and Ajahn Piropong and his faculty team and student crews, and also go to Dr. Kupisha and Ajahn Supawati. Back to the beginning, for 3 years that I worked with Ajahn Amarin, and for this year we start teaching about the new track that make student create something. I asked Ajahn, shall we start with food? Ajahn Dr. Priyabhum said, yes, we start with future food. And then we use the nursing innovation by the course or course framework like this. We make a small group. One track is nurse with DME and 2 team facilitator from both sides. And then small group as well work with another branch, 2 team facilitator and make a project-based learning. We have the innovation based on engineering, 13 groups, and future groups, 10 groups. For the course for the future foods, the course is entrepreneurship and innovation. And then the learning process divided into 4 steps. The student will start from the nursing side, problem from the patient first, and then design thinking that Ajahn Dr. Amarin mentioned. Design thinking we do both from the 2 team faculty to create innovative by the workshop, and then students work a small group with each other, develop the prototype of nursing innovation of future food. By the end, the student will show their product by exhibition and evaluation, but for this year, we do nothing about that. Let's talk about the future food projects. It's good for me that close to lunchtime, I will provide you virtual pad thaiกุ้งสด after I finish my presentation. It's a virtual dish. Okay, we have the 10 projects from students. We have the hot drink GABA rice. It means that GABA is a neurotransmitter. It's good for the older person. And then the next is calcium almond candy. Calcium is needed for children and older person. So it changed the new product from tablet to candy, easy to take. And next is this. This is a high collagen mulberry. I think that who are over, the ladies who are over 30s, collagen is needed to prevent wrinkles. So this product made from gelatin, high collagen, and add more taste by mulberry. And next is egg white raspberry chip. The older person who need protein, they can make the choice from the combination of blueberry, raspberry in violet color with the white egg in the crispy form. And next is a very interesting for me as a midwife. One group of students, they make banana blossom from breast milk. For Thai culture, always make food from banana blossom for increased breast milk. I don't know this idea or this kind of culture in Bali or not, but the flavonoid or lactobacillus in the banana blossom is good for the mother during give feeding. But the technique to do is very interesting because this group uses banana blossom powder. So they should have find out the technique to make it like a one white. So they select the I cannot say movie, but how to technique in Thai ways to pack the banana blossom powder to be a sweet or dessert in Thai ways. And next is the whole grain cookies. Whole grain cookies, it means that who want to have sweet bite during stay in the television, but don't need increased blood sugar or control weight. They go to select the whole grain cookies that is like a rich of grain but low sweet. They use inulin to make it sweet. And then the children, kindergarten, 3 to 6 years, they don't like vegetable. So this group decided the crispy veggie from tomatoes and what the green one, spinach, right? Spinach and carrot to be crispy. The color is not so good, the taste is fine. And next is butternut milk. For butternut is one vegetable from the royal product. It seems like a pumpkin, but more rich of vitamin A. For it's good for the older person who are common problem about macular degeneration. And the last one is crispy white egg. The patient with renal failure and always treated by hemodialysis. We know well that the more frequent treatment by dialysis, the more loss protein. So they make the white, crispy white egg to use albumin from white egg. That's a biological value. This is a quick showing you about the 10 product of future food. But I would like to share you about the learning process, something that everyone stay home. Both side of students from KMUT and students from seluruh. So kitchen everywhere, right? Quite hard for them to do, but let think about that, how they go over the problem. Let's see the student work online for this type of project, but every project do the same. They perform the formula based on the nutrient, support the knowledge by the food science technology from the many agents, and then they use the white egg with something in some ingredient first time, second time, third time, and fourth time, and record it. Every report run by a digital form. They keep it and show this to their advisor and talk about that, how do it better, how it can set to be a product. This is one sample of the record from their kitchen. Let's see the product. From the pictures seem like cookies, many form, seem like crispy in platform, and then they select one form to design for the packaging and like a mark of the, in case of they want to sell it. This is every group finalized with design the future food with the idea to sell. I think that the time is it's close to 12. I will finish to share you that how future food run from the kitchen. Now I think that it's very soon that can say that tempura just only prototype. It's too soon to say it's good, but I'm sure that I can say that imagination can do everywhere, even from everywhere, kitchen as well. Thank you.
Well, thank you very much, Ajala Iat, for your presentation. It's very nice that it's close to noon time and you make me hungry, at least for the cookie and the white crispy thing. If you have one of the bag, please send it to me at CPC College. Thank you
Okay,
in advance.
next time, please.
All right, and I is the time is now almost noon. It's 11:53, and I think I still want to have some short comments and suggestions from our four panelists. Well, each have only 1 minute to give a suggestions on the what do you think the online application or the way forward for you to maybe want to have more things about, let's say, if the pandemic still going on and we have to live with the new normal era, and also we have to live with this for quite some time, or maybe the student and the teacher already get used to technology and innovation. What would be your idea about the moving forward in your opinions to have the education go on with the technology in your side? I would like to begin with Dr. Suchiwa first.
I think this one, if the COVID-19 still be with us, so we have to apply some technologies with us, and then I think we have to recheck with our students that they are happy to be with the online classroom or not. Some of them may be not happy. Some of them might be happy, and I think we have to try the best for them to meet the learning outcome. And if it's possible, I think we have to discuss with the student as well which way, like a mini research, which way is like compatible with them. And I think so in the future it should be maybe many of the studies about this. And I think if which one is useful, maybe it's the alternative way for us to choose with our classroom, maybe hybrid or blended learning, or maybe many learning styles. So I think this one is maybe it's good for our student and our teaching as well. It's for me. I think so if you have any questions about the application, maybe you can ask or contact me via email as well. So I will be happy to share with you. Yeah.
Okay. Thank you very much. That answered the question, because well, we have to know both sides, both student and teacher, if they are satisfied with the technology and the classroom like this, and we will still have to use technology for it. Thank you very much, Dr. Suchiwa. May I get to Mr. Nuryanto? Do you have any suggestion and comment to move forward with this situation?
Okay, thank you, Dr. Orarat. I hope that COVID-19 gone from the world. If the COVID-19 still in the world, I think in the community practice, we should do like a hybrids, and then practice in small community, not in the big community, to have practice with the student real situation. Because if we observe and evaluate our student practice in the online system, some of the skill maybe cannot we evaluate very good. I think that's my hopes. And then I think in the chat box, they have one question, Doctor, for the meeting with the community. Yes, I think in ITKAS Bali, for the meeting, community meeting, we do in the real situation. It means that the community and the student and the teacher also join in the conference, but they not come in the community, but they join in the conference by using Zoom, and then they can discuss in the Zoom about the problem, about the intervention, and so on to solve the problem in the community. I think that's all, Achan. Thank you.
Well, thank you very much, Mr. Noyanto. And that's a very good idea to have the smaller community to make a communication with them easier and more effective. And I would say the hybrid, both lecture and the community practice would be work in the situation. Next, I would go further to Dr. Amarit. Could you give any comments or suggestions on the an outbreak and the innovation that you would have suggest for us to move forward?
Okay, let I comment about maybe my opinion. The thing is that we try to teach students, and then the final thing is that we want to do some evaluation, pass to the exam platform, and then for the online, it's going to be very tough to do that. And then the thing is happened for us that we have, let's say that we have about 4,000 students, and the first thing that the system we need to build to can handle for the 4,000 students, it's not that easy. But the thing that we try to do this for the two reasons. The first one, that we try to show students that, okay, if you want to do something innovative or innovation, you start with the problem that can answer the crisis right now. Okay, we have the COVID problem, and you are 4,000 students. We cannot use any kind of platform to handle you. But the things that we have to work together. So the student who takes the class this year, they see the progress of do the innovation. The first one, we do the programming, we do the platform, and we test to each other, and it failed. Yeah, it was failed about 4 or 5 times, and then take about 1 or 2 hours. And students help us, give us the feedback how to improve the system, and it's likely to be the closed loop. And then we do the testing and do some evaluation, and then we work together, and we are so proud of them. And then finally we get the platform, the fit test that can use for the physics, for the mathematics, for the chemistry in the final. And then the things that more importantly, for do the exam online, we need to respect to each other. For on the side of the instructor, and we have to respect to the student. But people try to think, okay, if we do the online, okay, we think about the student can do some bad thing or some whatever they think that the student can do. But don't think that. I believe that if we respect to student, believe in the student, they do their job. I mean, they want to do best for the exam, and then that what the results show us for the last semester. So again, we are so proud of the engineering student who take the physics class last semester. Yes, and it would be honor and would be great for us to work with students closely. Okay, thank you.
Okay, thank you very much, Dr. Amarin. The cooperation from the student and the idea about to improve what we have so far to make it better would be a very nice suggestion for every online education. And last but not least, Dr. Laiyat, Ajahn Laiyat, please give the suggestion or comments or what would we move forward. And again, we have only 1 or 2 minutes. Please. Ajahn Laiyat, please turn on microphone.
Okay. It's enough for me for 2 minutes because I only asked that how do we make imagination come true. I'm so agree with Maureen that we proud of our student. I'm proud of my nursing student who work closely with engineering, and because this year we have a new track about food. Let me talk more further about planning for next year, right? Okay, let's see the submachine from Ajahn Payung. Ajahn Payung is a team from KNUT. He mentioned about some machine. I don't know for detail, but this machine can control the oven and can make something dry by under this control. We talk about this machine on Friday and asked him, can you do herbs? 2 herbs for me. I call him Pradapot. He made that the teacher who always stay for us. He sent me stay in the kitchen, right? And Ajahn Amarin told me that his warehouse can do everything except the visual. So he cooked something and sent the picture for me. Let's see. This is a basil. Thai is kapra in dry. And next is he sent me the dry camphor. I think that both you have in Bali, right? Ajahn, do you have both herbs in Bali? I don't know. Let's check later. This kinds of herb, they announced that for basil is anti-inflammatory property and can help lower the risk of inflammatory conditions such as arthritis. Wow, it's good for older person who have knee arthritis, right? And camphor, this is an anti-virus action. Just know about that. Let's thinking about the next imagination of us. How could we do with the 2 herbs? I have been studying in Japan, so I get familiar with furikake or something that on top on rice. And there are varieties of furikake in many types, but mostly they make from dry fish, seaweed, vegetable, and grains. Wow. And they can make furikake by like some dish, like a soup. So I'm wondering if I make furikake in terms of pat kaprao. So can I call the curious from someone that attend this program and interest to arrange the like a future food? Just curious to know. But I noticed that this morning, Dr. Somsak from Apai Pubet maybe can make my curiosity come true. Just thinking about that everything can do, even COVID or not, we can do idea everywhere, not only kitchen. Thank you so much.
Well, thank you, Dr. Lain, for your suggestion. So everything can come true, even with pandemic or without pandemic. So you can just create things and use it, just like that. Well, the session is about we are a little bit late, and I would like to thank all of my panelists for your nice presentation, innovative and inspiration for all people for the audience in this room. And thank you very much. ขอบคุณค่ะ
ขอบคุณครับ
I would like to go back to thank you.
Terima kasih banyak, Kak.
And I would like to go back to Dr. Panarat, so our main MC, for her to introduce the next session and the state issue. Dr. Panarat.
Interesting panel and stimulates my appetite a lot by Dr. Lakiat. So in the morning section, we have a very informative for the data, even though we see the compact, we have the impact of the COVID-19 situation. But you see that we have a lot of positive side and we have a lot of innovation, development and improvement, even though that we face with this, but we tie the way. I think this is the important part that we gain a lot from the COVID-19 and we change a lot, even though it's to be the disruptive change. So for the afternoon section is we still keeping on for the important topic. So in the afternoon will be for the student section. We have two sections for the student. So the first one will be student views on online education, practicum and evaluation on student during the COVID-19 pandemic. Do they gain or do they lose? So this is very important topic that our instructor need to hear from the student. And the second one is the panel discussion. The student will talk how we help or how to help students success in learning with happiness as well in the new normal era. So, but during the lunchtime, we are going to have the videos of all the colleges, the collaborations in this conference. So, but you can have lunch and watching the video as well. But before we finish the morning section, we would like everyone to turn on your camera for a second, and then the host will capture to be witness that you will come back in the afternoon with us for the important topic for the student and support our student. So now the camera is on. I think we captures all of your photo and then we come back at 1:10 p.m. Okay, so we start with the clip video. Thank you, everyone.
The Boromarashani College of Nursing Bangkok has developed its vision and mission to serve the needs of nursing education for society. By providing bachelor degree in nursing and short course training programs are offered in both Thai and English, including a program in teaching and learning nursing education, emergency nursing, nurse practitioner, and international short courses and adult clinical care, pediatric clinical care, midwifery, and neonatal care. In order to strengthen public disease for nurses and expertise in the professional field and fulfill the needs of society. These courses are taught by faculty members that have knowledge, experience, and professional expertise in the field. Management of the curriculum also follows the educational standards of the country. The system with the Educational Act BE 2542. The college has set a system and strategies to control quality assurance within the college, along with the promote and develop managing system and supporting system to meet standards in a concrete way. There is a monitoring a system which is regularly evaluating from both external and internal agencies. including information distributions to the public. With a strong commitment to efficient operations, the Brom Ratchanani College of Nursing Bangkok has set goals and policies to guide the operations as follows. For the administration, the development of an enterprise management system carries the principles of good governance, good moral. Members of organizations can coexist happily and have fun with operational responsibilities. For academic management, there is teaching with the development of educational to produce quality graduates, with teaching correctively and making the college a center of development for nursing faculty, including the promotion of information technology for improving the learning of students. For students' activities, college encourages creativity and implementation of project activities, both within and outside the institution, in order to preserve arts and culture, develop lots of skills, professional skills, morality, and ethics for students. For the faculties, the college supports the use of technology, leading a networking of information through the implementation of the mission of the college. Improving nursing laboratories as well as the operating rooms for training nursing skills. Maintaining a laboratory and high standards as the source of knowledge, both the location and the quality of media, including books, periodicals, and other resources which are conducive to learning and self-study. For research and academic work, the college has developed a mechanism to support the productive and dissemination of academic research results and innovation applications of the research to improve teaching and professionalism. This is consistent with the philosophy of the college, in which it has a high standards as a nursing school and producing nursing and healthcare personnel with the knowledge, skills, ethics, and social responsibility for using process as a learning and a clean environment, as well as the continuing to develop research in knowledge, which is congruent with the culture and wisdom of Thailand. All this with the purpose to serve the needs of the society, as well as to improve professional development and the nation's healthcare system. This is our inspiration with the noble cultivation of our nursing students in achieving academic excellence.
Brom Ratchasonani College of Nursing, Nonthaburi is an institute located in Nonthaburi Province. It was established by the collaboration of 3 colleges under the Collaborative College Production and Development Network project, including บรมราชชนนี College of Nursing Nonthaburi บรมราชชนนี College of Nursing บำราศนราดูร and บรมราชชนนี College of Nursing ศรีธัญญา Furthermore, the college has been named บรมราชชนนี College of Nursing Nonthaburi on March 19, 2003. Sawa, which is the short name of Her Royal Highness Princess Mahachakri Sirinthorn, is the official emblem of Barom Rachachonani College of Nursing Nonthaburi. The college has been accredited its curriculum by Mahidol University and admitted an affiliate institute on March 19, 2003. Official symbols of the college are crown flower and purple and white, which is the color of crown flower. The college has been offering Bachelor of Nursing Science for students. After the graduation, students will obtain bachelor degree and be qualified for working with public and private hospitals, along with district health promotion hospitals and other organizations. Bachelor of Nursing Science program takes 4 years of education. On freshman year, students have to take fundamental science courses. On sophomore to senior years, they will take nursing profession courses and training courses at different sources. Throughout the education, all students are trained to be self-confident and prepared to be healthcare leader who provides healthcare for their patients with generosity, knowledge, and morale, so that people in the society live happily. The college is providing standardized learning-based education to promote intellectual process of the students and allows them to share their experience with their peers and instructors using various teaching methods. Teaching and learning is consistently developed so that instructors can apply their knowledge and experience with their teaching while integrate them with research and academic works and maintain Thai culture and tradition in order to turn the college into the learning institute. College philosophy is based on the belief that nurses are required to understand life holistically. Nursing profession is valued and essential for the society. The college therefore commits itself to develop nationally accredited nurses who can apply their integrated knowledge with the work based on professional generosity, morale, and ethics. The college is also providing learning facilities to promote its teaching and learning, such as quality classrooms, nursing laboratory, conference room, library, computer lab, fitness center, canteen, and dormitory, along with greenish environment and learning area for conducting different learning activities so that students will have good quality of life. The college has researched and produced academic works to create knowledge of different fields for professional elevation for quality academic work publication. In addition, the college has also published Health Science Journal and awarded first category of Asian-based science and technology by Thai Journal Citation Index Center. The college has also provided Thai massage service, senior center, and training center for public health care providers and the outsiders. The college has been preserving Thai art and culture, the environment, and Thai wisdom to different activities on religious days integrated with academic services, such as on New Year Day, Songkran Day, and Makha Busha Day. Good governance administration of the college promotes and develops desired graduates by motivating consciousness under virtual family holding on moral and ethics, which is considered critical identity of the students who acquire experience and learning process with humanized healthcare. From the past to present, from the beginning to the step beyond, all of us commit ourselves to produce knowledgeable and skillful graduates, to provide good public health care for the community and the society that will finally ensure reputation of the college.
Welcome to Boromrashonani College of Nursing, Chonburi. Our college is one in 30 colleges in faculties of nursing, Boromrashonani Institute, Ministry of Public Health, Thailand. Visions is, we are one of the leading institutions of higher education in nursing, an outstanding of creative contribution to community health.
Boromrashonani College of Nursing Chonburi has committed to produce qualified nurses who think globally, act locally.
Cha Cheong Sao, Chonburi, and Rayong provinces have been designated for the development of Eastern Economic Corridor, or EEC, a pilot project for the economic development of Thailand's eastern seaboard. It is era of industrial revolution. To support and accelerate the economic growth in the EEC, the needs of human resources are increasing, include nurses.
Today, Asia is indisputably the global leader driving investments and economic growth, with China, the Republic of Korea, Japan, India, and ASEAN powering this momentum. Asia is not only home to a combined population of over 3.5 billion people, but more importantly, the combined GDP of Asia now accounts for 32% of the global GDP. Thailand's centrality naturally forms the hub connecting Asian economies from north to south, starting from China down to Indonesia and from east to west, linking Vietnam to Myanmar. Thailand is also strategically located at the heart of the ASEAN Economic Community, or AEC, already a center for regional production, trade, exports, and transportation. Furthermore, Thailand is surrounded by the world's fastest growing economies: CLMV, Cambodia, Laos, Myanmar, and Vietnam. Thailand is undoubtedly the best investment destination in ASEAN. The Eastern Economic Corridor will be pivotal for Thailand as we progress towards Thailand 4.0. The EEC's goal is to be the most complete and modern special economic zone, the EEC metropolis of the future, gateway to Asia.
We are located in the eastern coast of Thailand, where the government implements special strategy called Eastern Economic Corridor or EEC. We provide nurses and scale up their competency to serve with significant health problems in the area. About 150 of new graduates will work in the healthcare setting at the every level of healthcare services, from primary care to tertiary care. We also provide special short course training in 4 areas, including adult critical care, emergency care, psychiatric and elderly care.
There are 2 curriculums available at BNC. One is bachelor degrees in nursing science, and another is 1-year training program for nursing assistant. Our curriculum has a solid foundation of nursing science to develop knowledge, skills, the value of person and nursing profession, essential skills and abilities that are necessary to promote holistic nursing care. We offer diverse opportunity for nursing practicum in hospital, clinics, communities, and industrial factory. Academic departments include 5 major nursing sciences: obstetric and gynecological nursing, childhood and adolescent nursing, community health nursing, psychiatric nursing, adult and gerontological nursing. Overall, there are 57 nursing instructors. 11 instructors hold doctoral degree from Thailand and abroad. 3 of them graduated from the USA and 1 graduated from UK, and the rest graduated from universities in Thailand. 42 instructors hold master degree in various areas of nursing sciences, and 4 instructors are holding bachelor degree. SimLab is one of the solutions in COVID-19 pandemic situation in nursing education. Our plan is to extend more SimLab in the next year. Study here, I've got opportunities to see the world and to understand what the nurse is. In 2019, when I was third-year nursing student, my journey started with being a representative start to present my study in local northeast part of Thailand. At that time, I saw different perspectives of nurse and I curious to know more. The global challenges of health and nursing. The year 2021 will see BNC Chonburi reaching out for the international collaboration. Currently, we collaborate with the 3 researchers from 3 universities in 3 countries in 3 different research projects. The 3 projects reflect BCN Chonburi's strong belief in research and friendship as foundations for educational and practice excellence. To build nursing career pathway, I joined ASEAN Congress and Student Assembly in Singapore. At this time, I know and I learn how nurses around the world work together to influence WHO and a high level of decision making. And I have an opportunity to join exchanging program with ETKS Bali and CCN1 Thailand. By this change, it fulfilled me about the healthcare service and the different culture in Asian country. By this change, I learned how to become a better nurse for the patient.
The beginning of Varom Rachanani College of Nursing Noparat Washira started as the first school of midwifery in Thailand. Established in 1977 in response to the royal initiative of His Royal Highness Prince Mahidol Adulyadej, Somdet Phra Brom Rachanok, and was located inside the compound of Washira Nursing School. On April 18, 1994, the institute was gradually betrothed the institute's name, Varom Rachanani College of Nursing Washira, and was also granted a royal permission to use the initials of the royal signature สังวาล Sawal as the college symbol. The following year, in 1995, the institute was relocated to the compound of Noparat Ratchathani Hospital under the mutual agreement whereby the College of Nursing become an integral part of Noparat Ratchathani Hospital, much like a single enlarged family. On such auspicious occasion, the institutes under the jurisdiction of the institution of Pabaroma Rajanok was given the name Barom Rajanani College of Nursing Noparat Washira by royal permission of His Majesty King Bhumibol Adulyadej on the 5th of June 1996, which has since been recognized as the date the institute was established. Barom Rajanani College of Nursing Noparat Washira has its own symbolic flower known as Rajapuk. The branch of flowers is slightly bended, symbolizing a bowing gesture of staff and students who are being polite, modest, cheerful, quest for knowledge by striving for know-how and competence through moral and ethical means for their nursing profession. In 1998, the institute collaborated with Kasetsart University in the fields of general academic teaching, subsequently approved by the University Council's resolution on the 19th of February 2001. Since 2001 to 2019, the institute was concurrently recognized as Faculty of Nursing Science of Kasetsart University. In 2019, His Majestic King Mahawashiralongkorn Prawashiraklao has been graciously placed in Act the Barom Rajanok Institute Act 2019 and announces in Government Gazette on the 1st of April 2019. At present, Barom Ratchathani College of Nursing Noparat Washira is an educational institution specializes in health sciences under the Faculty of Nursing, Barom Ratchathani Institute, Ministry of Public Health. Originally, the institute offers a program of bachelor's degree in nursing science, and since 2011 until 2015, the institute had offered master's degree of nursing science in family and community health nursing, which is an international program which was collaborated by the Barom Ratchathani College of Nursing Network 1, Kasetsart University, and the universities in Indonesia. There were 54 Indonesian graduates from the master degree program returned to their country to work as a health professional in both practice and education. As an institution of higher education, Barom Ratchathani College of Nursing Noparat Washira strives to meet the following: producing and developing graduates in nursing profession who are conscious of their duties and commitment to Thailand. Currently, the institute offers 2 degree programs, bachelor degree in nursing science and certificates of practical nursing. In keeping with the principal commitment to academic teaching as an institution of higher education, the institute deploys a variety of teaching methods, multiple media instruction, as using technology in support of its academic affairs. Moreover, students are also given opportunities of getting real life experiences through nursing practicums in various healthcare facilities, experiencing community life, as well as on-site learning at local industrial factories. Developing knowledge of healthcare from research studies. The institute has developed the Institutional Review Board to review and approve of research proposal projects, following the ethical principles and federal regulations for the protection of human subjects. Providing health promotion and health services to community. The institute also provided information forums as social services to various groups of people, like local communities, whereby the institute has developed a network of alliance with the local communities leaders, Bangkok Metropolitan Authorities Health Service Centers, and private enterprises. Moreover, the institute offers training courses for both health professionals and civil servants working for the Ministry of Public Health, like the First Line Public Health Administrators Training Program and programs of nursing specialty in nursing for organ donation and transplantation. Creating and accumulating wealth of knowledge and ethics to maintain and enhance Thai wisdom and culture. The essential resources which enable the institute to meet these commitments are the development of its human resources to realize the full potential, to be adaptive to ongoing social changes, and the use of participative management involving personnel at all levels, as well as enhancing staff's morale so that every staff member works toward fulfillment of the institute's goals, both short-term as well as long-term goals. Building wealth of knowledge of nursing for competent graduates, building communities of self-care for health, and striving to become a leading educational institution qualified at the national and international levels. In addition, the students would learn from exchange students from overseas institutions under joint collaboration with the institute, such as exchange students from Indonesia and Finland. According to the previous work of the institute, Brom Ratchanani College of Nursing Noparat Washira has been approved by the Thailand Nursing and Midwifery Council, which is the highest level of approval of a bachelor degree in nursing science.
Pukul Nursing College, Chanthaburi is a tertiary institution under Paparom Ratchanok Institute, Ministry of Public Health, with the responsibility and objective of producing and developing health personnel in accordance with the Ministry of Public Health policies. Pukul Nursing College was founded by Pabamrat Naradun, Minister of Public Health at the 4th Nursing College, which was the first in the Eastern region under the Ministry of Public Health. The college was first called at the School of Nursing, Midwifery and Health, Pukul Hospital, and officially opened on March 12, 1965. Her Majesty Queen Rampai Pani, the Queen of King Prachatipo of King Rama VII, received the college under the royal patronage from the opening until the death of His Majesty in 1984. Receiving such kindness is also the delight and pride as Pukul Nursing College residents. In addition, the college has been sponsored by the Prachatipo Rampai Pani Foundation, continuing to the present. In order to pay tribute to His Majesty, the college had exhibited the image of various royal duty in the Museum of Pukul Rampai Pani. เฉลิมพระเกียรติสมเด็จพระกนิษฐาธิราชเจ้า Her Royal Highness Princess มหาจักรีสิรินธร visited and opened the museum on June 20, 2008.
The logo of พระปกเกล้า Nursing College จันทบุรี is abbreviated as พระมหามงกุฎ with its abbreviations of พปก. The vision of พระปกเกล้า Nursing College is the standard nursing college produce and develop quality health personnel for the community. พระปกเกล้า Nursing College has 5 missions. 1. To produce and develop health professionals, to support healthcare system and to meet community needs. 2. To conduct research for creating and developing knowledge. 3. To provide academic services to society. 4. To preserve arts and culture. 5. To have organizations management under the principles of good governance. The uniqueness of the college is to establish people from the localities in order to correspond with the community health system. The identity of the graduate is health service with humanizes nursing care. The organization's values include support, harmonize, collaborate, strive, share, and learn. Dr. Pisut Uttamod was the first director and he created the groundwork for the college development in all areas, which has been passed down to all subsequent directors to continuously improve the college. The current director is Dr. Mantana Hemchayat, the 10th director of พระปกเกล้า Nursing College จันทบุรี. In order to ensure quality graduate students, the college therefore attaches great importance to course administration and the student care since the admissions process, with physical and mental preparation. There also is a counseling system throughout the course including the management to create learning atmosphere, happy living, and working together with all members. Students are well equipped to become nursing graduates with complete competencies in performing tasks that sustainably meet the needs of healthcare system.
To trends in public health, Thai people are living longer. The number of senior citizens in Thai society is rapidly rising. In 20 years, an estimated 1 in 4 Thai citizens will be an elderly person. Illness and mortality plans will change from contagious diseases to non-contagious diseases. Age adversely affects the performance of body organs through degeneration, combined with poor health habits, which result in diabetes, hypertension, aches and pains, gout, heart disease, and cancer. Most patients don't even realize they have these chronic illnesses. Sirintan College of Public Health, Chonburi, is an academic institution committed to developing public health personnel through standardized education with emphasis on the students. Graduates possess the highest quality and ethics who continue to learn throughout their lives. By building and disseminating knowledge to society through learning from real-life experience, using culture and wisdom as a foundation to improve society, to create graduates who are leaders for change. raising health standards, and bringing good quality of life for themselves and the population. Under the motto, Quality and Ethics for Life and Society. The college uniquely develops local human resources to meet health requirements of the community. Sirintan College of Public Health Chonburi is responsible for educational administration of bachelor's degrees and lower to meet Thailand's demand for public health professionals. In order to achieve the goals of education, academic service, research, and cultural preservation. Programs at Sirintan College of Public Health Chonburi are as follows. Bachelor of Public Health Program in Community Public Health to meet the health needs of local communities. Today, there is great demand for graduates skilled in environmental health, hygiene, occupational health and safety, for management of community health planning and prevention, as well as administering the public health of companies, economy, society, technology, and environment that is constantly changing. Bachelor of Public Health in Dental Public Health Program to meet the needs of the community. Today, there is demand for public health professionals for dental disease prevention, providing dental plans and solutions to dental public health, as well as dental public health administration. According to ever-changing economic, social, technological, and environmental factors. Bachelor of Applied Thai Traditional Medicine Program is dedicated to creating Thai traditional medicine healthcare professionals with aim in prevention, treatment, promotion, and rehabilitation for the preservation of traditional Thai wisdom and environmental conservation. Administration is efficiently carried out through good governance. Technical Certificate in Public Health Program in Pharmacy Technique aims to provide public health in accordance with human nature, communities, and society. Pharmacy Technique graduates have holistic knowledge in science, humanities, and public health. They possess the necessary skills to perform their duties, especially basic pharmacy, as well as practical skills providing pharmacy services to the general public. Technical Certificate for Emergency Medical Technician Program creates personnel able to provide basic emergency medical services with ability to work in emergency medical unit service under supervision of the Medical Council. In addition, the quality of instruction and learning atmosphere at the college is enhanced by modern facilities, residences, and dormitories that are clean and safe. Role of academic services for society. Sirintan College of Public Health, Chonburi, is developing a universal knowledge center for community learning and training of the Eastern Seaboard. As for research and cultural preservation, the college has built a network to register patents and disseminate research works, along with application of such research. This includes development of local traditional wisdom to go hand in hand with community healthcare with distinction. With dedication to development, the college's pledge for excellence, for efficient and continuous progress. Sirinthorn College of Public Health, Chonburi, is ready to become the famed, internationally recognized academic center for public health of Southeast Asia.
What is an applied Thai traditional doctor and what exactly do they do? All we know is that Thai massage is good and pretty well known, but is that all to it? You can find all the answers here in Apai Phubet College of Thai Traditional Medicine, where a professional curriculum of Thai traditional medicine is offered, with 4 majors that you must know in order to understand a complete Thai traditional medicine. Applied Thai traditional massage is the study of massage therapy. In order to develop a massage therapy as a precise treatment, the therapist must build the strength of their fingers, practice diagnosis, practice analysis of illness, and the skills of massage therapy. Applied Thai traditional massage does not simply target the pain area, but applied Thai traditional doctors must analyze the whole body structure along with the 10 major life energy channels. In order to analyze the methods of Thai massage therapy, which is very different from typical relaxing massage. This makes applied Thai traditional massage not only a treatment for muscles and joint diseases, but also for the diseases in other systems, including nervous system or alimentary system. Applied Thai traditional medicine is to think like Thai traditional doctors by understanding the patients through their life elements, discussing with patients, conducting physical examination to analyze the balance of coldness and heat of the body, the flow of blood and energy, the balance of water, and the abnormality of different organs, in order to understand the diseases of patients better and hence plan and develop the right treatment for them. Applied Thai traditional pharmacy is the study of herbs from the very beginning of how to plant, harvest, compound, process, develop a standardized and quality formulary, and learn about choosing the right medicine for treating certain illness. Midwifery for applied Thai traditional medicine involves care for both mothers and babies from before pregnancy, during pregnancy, and after delivery, particularly in terms of diagnosis, increase in the nutrients of breast milk, and postpartum recovery of mothers to become healthy again. Once complete with all the studies in the college, now it would be the time for the students to start learning by doing, as they start to practice through the actual works in clinical settings, which includes history taking, physical examination, a treatment plan of either massage therapy or herbal medicine, and follow-up care. It is noticeable that the procedure is very similar to that of modern medical procedures. However, the main difference lies in the method of treatment that is based on the difference in the knowledge base. In the herbal medicine store, the knowledge about herbal medicine is not only limited to its chemistry, but the processing of quality medicine requires understanding of the taste, for which taste suits to be with one another, and which herb is effective for which kinds of patients and illnesses. This makes the prescription of Thai traditional medicine more complex than simply reading from the bottle label. This may not be the whole answer to what applied Thai traditional doctor is all about, but this is an open door towards knowing more and more about applied Thai traditional doctor, Aphai Phubet College of Thai Traditional Medicine, Prachinburi.
My name is Nikki. I'm a lecturer in the Department of Adult and Elderly Nursing and Department of International Affairs. Nice to meet you.
Hello, my name is Michael. I'm one of the English teachers here at the college, and before coming to Trang to teach, I used to be a nurse in the UK for over 20 years.
Okay, first of all, we would like to talk about the history of university. Here we go. The university was established in 1990 for 32 years and is located in the southern part of Thailand in Trang province. The college area is situated on 19 acres, which includes 3 buildings, a children's center, a cafeteria, an auditorium, a basketball court, a dormitory for teachers and students. More recently, we have built a new 8-story building for teaching and learning, which we will show you around. Currently, we have 2 main courses, including a curriculum of nursing and a nursing assistant course. The nursing curriculum has 4 academic years, and there are about 100 students per year who enroll in this course. For the nursing assistant, there are 2 academic years and also have 100 students per year. Students come from across a lot of different areas of Thailand.
The learning resources we have for teaching in the classroom consists of intelligent screens, active learning activities, a laboratories room that is fully equipped for practical nursing skills such as simulations, and also training in hospitals and the community. In addition, we promote English skills by following international standards of learning and assessment. In the first 2 years, we focus on everyday English, and in the final 2 years, we focus on professional nursing English, enabling students the skills to communicate with international patients. The new building will also include a language laboratory. However, during current times, we need to have online classes to prevent the spread of COVID-19, and we are in the process of ensuring college personnel and students are fully vaccinated.
The Health Promotion Project. We have a health promotion program with the community such as home visits in community subjects, health promotion program for the elderly every Friday, volunteering to help screen patients who will receive vaccination at Trang Hospital, running or exercise projects with the community and many more.
Finally, we'd like to welcome you to come and visit the college, or you can contact us via our website or through our email address, and we look forward to seeing you in the near future. Okay? ขอบคุณครับ
Welcome to St. Louis College, a leading health science institution in Thailand. St. Louis College is known for shaping future compassionate health professionals. The college is located at the heart of metropolitan Bangkok and is easily accessible through major highways, SkyTrain, and other means of transportation. In 1985, with the philosophy, "Where there is mercy, there is God," His Eminence Most Reverend Michael Cardinal Mechai Kitbunshu, together with Sister Clemens, Dr. Mana Bunkanpan, and Professor Dr. Bunsom Martin, established St. Louis College as a Christian commitment of quality education to the people of Thailand amidst the diversity of faiths and multicultural environment. SLC mission is to produce well-balanced graduates who excel in their fields in integrating academic excellence and professional ethical values while upholding Thai culture and carrying on the Catholic spirit of service to society. St. Louis College offers numerous bachelor's degree and master's degree programs. The Faculty of Nursing prepares students to be clinically proficient in the ever-changing healthcare system with its solid academic program. Student-focused advisors manage a dedicated small class of 8 to 10 students and integrate learning system quality objectives with the latest technology in health sciences. Learning procedures are combined with carrying theory through a student-centered instruction to produce first-rate and good-hearted nurses with much passion for work. St. Louis College Faculty of Nursing offers specialized fields for advanced clinical practice and nursing administration for professional nurses who want to earn a master's degree given a demanding schedule. In these programs, the professional nurses are developed to be proficient in studies and research while conducted in their workplace or chosen clinical settings. The Physical Therapy program provides 2 career directions for its graduates. St. Louis College develops students to be competent and excellent in the full spectrum of physical therapy knowledge and methodologies, plus add-on training in community-based physical therapy practices. Graduates can have careers in hospitals and other clinical settings in the city. The school has entered into academic cooperation with colleges and universities in Australia, UK, Japan, Canada, Indonesia, the Philippines, Cambodia, and Vietnam through joint researches and exchange programs of students and faculties.
KMUTNB's 62nd anniversary, the phase embracing the new normal, innovation-driven policies, advanced inventions, and the community unity. Education is an important foundation for human development and the progress of the nation. Adapting to the new normal of education brings unprecedented challenges and thus offers the possibility to revive the education perspectives in various aspects. Specifically, the use of digital platforms to drive learning and instruction toward transformation goals, enabling an appropriate progress into limitless information society. King Mongkut University of Technology North Bangkok, or KMUTNB, was founded on February 19, 1959, from the academic cooperation between the Royal Thai government and the government of the Federal Republic of Germany. The institution was initially called Thai-German Technical School, and the instruction scheme was based on Germany's dual education system that integrates practical training with theoretical classroom instruction. The school became renowned and was promoted to a degree-granting institution called the Thai-German Technical Institute. Later on, the name was officially changed to King Mongkut's Institute of Technology North Bangkok, and then to King Mongkut's University of Technology North Bangkok, due to gaining autonomous status. The name of the university and the emblem of Phra Maha Mongkut, or Great Crown of Victory, were graciously granted by the royal endorsement of His Majesty, the late King Bhumibol Adulyadej. At present, KMUTNB is a government-affiliated autonomous university. On the basis of invention to innovation strategic orientation, KMUTNB offers different levels of education, including vocational certificate and all degree levels from bachelor's, master's, and doctorate qualifications. KMUTNB has expanded educational opportunities to Thailand's eastern region, where the Prachinburi campus and Rayong campus were established to support and promote the growth of businesses and industrial sectors within the Eastern Economic Corridor. The innovative potential, including formal research and development, inventions and innovations of student inventors and faculty alike, have been specifically promoted. Personnel and students are able to showcase their inventions and are encouraged to attend national and international competitions. KMUTNB constantly maintains and sustains industry-government academia collaboration with national and international institutions. The attempts bring about the expansion of new knowledge and thereby drive KMU-TNB towards a leader in university-industry cooperation. Furthermore, the adoption of corporate governance principles implementing ethical governance scheme, transparency, and verifiable transactions has earned the university and its members a selection of awards and accolades that have been nationally and internationally recognized. Throughout the past 61 years, KMU-TNB has shown great commitment to the development of human resources, along with its constant pursuit of strengthening science, technology, innovation capabilities. The engagements and efforts would be driving forces for national economic growth in compliance with the university policy and vision toward an internationally recognized University of Science, Technology, and Innovation disciplines.
Om Swastiastu. Welcome to Itekas Bali.
Itekas Bali was developed from a vocational school of nursing, which was established in Bali in 1983 by the founding fathers Itekas Bali Foundation. Itekas Bali continues to develop and now accommodates over 1,700 students. Itekas Bali offers 10 courses in the field of nursing, nurse anesthesiology, midwifery, pharmacy, and food technology.
From the beginning of its development, Itekas Bali has set its purpose to be a changing agent.
To give significant contributions to the country and to the world, Itekas Bali sets its vision to produce professional graduates which are able to compete both nationally and globally. Situated within the community, the Institute's value for Indonesian and Balinese traditions is evident by the preservation and enhancements of local architecture on both campuses.
In Itekas Bali, you will receive an excellent standard of training for your professions. Itekas Bali is special.
What do you mean by special?
Because Itekas Bali is different from other institutions.
So what makes Itekas Bali special?
Let's check this out.
Foreign languages such as English and Japanese are thought to address the need of English or Japanese-speaking health practitioners in Bali. Class supervisor and academic advisor are available to support students in maintaining their study motivation and assist them in dealing with any academic-related issues throughout their academic journey.
Itekas Bali graduates are highly acknowledged for their good practical skill joined with their strong theoretical understanding.
Extensive clinical practices are a part of all courses offered by the Institute. Not only clinical practice in the campus laboratory, but also in other clinical settings. Students undertake a range of practice placements in both community and hospital settings as a part of their program. All these practices allow students to interpret knowledge into practical experience and maximize student employment prospects.
Laboratories in Itekas Bali are equipped with sophisticated medical equipment.
Similar to equipment in modern hospitals.
Committed to assist its students finding their best method in studying
and have a fulfilling and enjoyable campus experience.
ITKS Bali students also have the opportunity to join student associations and students clubs such as English clubs. ITKS Bali also accommodate its students to preserve the Balinese culture
by establishing the traditional dance and gamelans club. We also have Indo football clubs known as futsal in Bahasa. Other students club available in ITKS Bali are basketball, martial art, emergency management, yoga, students with military training, and choir.
With more than 35 years of experience in education, ITKS Bali is committed to develop highly education system and graduates who are able to meet the future challenges of globalization.
Through its mission, ITKS Bali has been conducting internationalization as a response to the globalization. ITKS Bali opens its heart widely for international cooperation, students, guest lecturers, and research partners to visit, study, and share ideas with ITKS Bali staffs and students.
And all these efforts are supported by staff in all departments,
including our centers of research and community service,
and our Office of Public Relations and Partnership.
The Office of Public Relations and Partnership is the Institute's division dedicated to support the internationalization goals of the institution and to handle international cooperation and mobility.
As in implementations of the cooperations between ITKS Bali and the partner universities from overseas.
Students of ITKS Bali and partner universities could participate in student and faculty exchange program.
ITKS Bali Student and Faculty Exchange Program offers chances for international students and teaching staffs to experience studying at ITKS Bali for 2 to 4 weeks. It combines the experience of university life at one of Bali's leading institute with the unique opportunity to live on the island of Bali, one of the most popular tourist destinations in the world. ITKS Bali students also have the chance to join the student exchange program in partner universities, which offers an exciting experience to enrich their university life and develop their international outlook.
ITKS Bali graduates work in many different sectors of health service,
not only in Indonesia, but also overseas.
And some of our graduates are also providing care to elderly at nursing homes
and working as nurse in hospitals in Japan.
Konnichiwa. Konnichiwa. 私たちはITKSバリの卒業した学生です。今、日本語を勉強しながら働いています。皆さんぜひ来てくださいね。
For more information about ITKS Bali,
you may contact our campus
on the following contact number and address.
So, come and join us at ITKS Bali.
Good afternoon. สวัสดีค่ะ Om Swastiastu. Welcome back to the conference on health profession education for effective response for COVID-19 and future public health emergency sharing experiences. My name is Sirithorn Yingleng, the Deputy Director of Academic Service at Boromarajjanani College of Nursing, Bangkok, Thailand. I will be the MC for the afternoon sessions. In this afternoon, from 1 to 4 p.m., there will be 2 panel discussions of Thai and Balinese students. Each session will have 2 moderators and 7 panelists. A topic of the first panel discussion is on students' views on online education, practicum, and evaluation during COVID-19 pandemic. gain or loss. I'm pleased to introduce the moderators, Mr. Thatthon Naatdilok, the third-year nursing student from Boromarachonani College of Nursing, Bangkok, and Miss Kalayaporn Hasiri, the second-year nursing student from Phapok Nursing College, Chanthaburi, Thailand. Please join me to welcome Mr. Thatthon and Miss Kalayaporn. Now the time is yours.
Thank you, Selamat sore. Good afternoon, ladies and gentlemen. I would like to welcome you here today. So, my name is Thatthon Naatdilok from Boromarachonani College of Nursing, Bangkok, and second modality.
Selamat sore. My name is Kalayaporn Hasiri. I am a second-year nursing student from Phapok Nursing College of Taburi.
We are the modality from student group groups. So today, we have some students to speak our topic. So the first one is about this advantages of learning online. We call them gain groups. And the second one is the student will on disadvantages of online learning. We call them loss group. Okay, first of all, let me introduce of gain group. So the first one is Panada. Please introduce yourself.
Hi everyone, my name is Panada Pokum. I'm a nursing student in the third year at the Boromarachonani College of Nursing, Mengikuti. Nice to meet you.
Good afternoon, everyone. My name is Savitri Sumanmit. I'm a second-year nursing student from Seluruh College. Nice to meet you.
Hi, I'm Sila Anyamulang from Mengikuti College, Thai Traditional Medicine, Singapore. Nice to meet you.
Good afternoon, everyone. My name is Thanit Jinda. I'm a third nursing student year of Boromarachonani College of Nursing, Jangwat Nonthaburi.
So, next section of all, let's move into the last group. The third is Ms. Pisasha. Please introduce yourself.
Hello everyone, my name is Tisasha Yoyen. I'm the third year nursing student from Boromarachonani Chonburi Nursing College. Nice to meet you.
Hello, my name is Cholada Pangmat. You can call me Som-O. I am dental public health student at Linton College of Public Health Chonburi. Nice to meet you.
Hello everyone, my name is Pianat Phakjin. I am a third year nursing student of Boromarachonani College of Nursing Trang. Nice to meet you.
And the last is Windy. Windy, can you turn on your microphone? Okay, so this is the name and status of all the members of the student group. So what are we doing today, Mr. Thatthon?
Okay. Slide, please. Nowadays, as we were living in COVID-19 situation and how many people were infected with this pandemic.
Today we have about 175,000 inside people. There are too many people. The number of infected people is increasing day by day. This is really bad news.
Yes, that's very bad news. And anything else?
And so we also have online classes. I know it can help prevent COVID-19 infection, but we want to know how others are doing and what happened to everyone in COVID-19 situation.
Everyone, I have some video to show for all you to share for you guys today. Let's see together. Okay, so how do you feel when you see this video? You can tell us in chat box. Okay, so today we have a discussions about your student opinion, and I think everyone are very excited for to join us. Okay, so we will start with Ms. Panada from the green groups. Let's start.
Good afternoon, ladies and gentlemen. I am a leader of the teams presenting relevant to the topic of the advantage from online learning in the COVID-19 situations. First of all, I would like to inform you about the reasons that our team concerns about online learning. According to the World Health Organization, has declared COVID-19 era pandemic that had a post-contemporary to how many days. This pandemic has forced global shutdown of several activities, including educational activities. Therefore, the social distancing measures have led to closures of school and higher educations in the most countries. There is a shift in the way educators deliver quality education through various online platforms. We, as the students who study in health science, we have less experience in online learning because we need to study in both classroom and practicum. This is new for us. So this is the reasons that need to be concerned about the advantage from online learning in the COVID-19 situations. Next, I would like to inform you about what our member will speak. The first member is Saviti Samanit. We're going to talk about the experience of students in online education, and the second is Sila Ayama. We will talk about the online practicum, and the last one, Chanite Jika, will offer the information about online evaluation. Well, we are going to start with our first member.
Thank you, Panata, to invited me. And good afternoon, ladies and gentlemen. I'm a second speaker of Advantage Group. Today, I'm going to talk about the advantage of online learning. Even though the COVID-19 situation brought a lot of disadvantages, difficulties, and sadness, it isn't all bad. There are a lot of advantages too. As Chong Labuye said, out of difficulties grow miracles. This COVID-19 situation is an opportune time to study, practice, and rebuild nursing skills. Nursing students have ample time to read and review lessons in a relaxed environment. Students don't have to wake up so early, rush every morning, and prepare to come to school, oftentimes missing the much needed breakfast. Plus, we are spared from wearing our school uniforms and look our best because as teenagers, we have to belong. For our college, online classes provided awareness to learn the different learning management systems like Moodle, ebooks, and many others. We are now expert on the different video conferencing platforms like Google Meet, Zoom, and Teams. Our IT knowledge has so much advantage and widen which give us an advantage. When we were in the future, it seems we took a minor in the platform. In information technology minus the program fees and certificate. Furthermore, for Stanley College students in the situation of COVID-19, resulting in online learning as an exercise enabling students to develop themselves by training themselves to become disciples of St. Louis by practicing to the 12 virtues. Online learning has developed virtues such as perseverance and patience. When the teacher teaches us, we often do not concentrate on the studying much because the thing around us interferes with the study, but if we study hard, ignoring the surrounding can help us understand the lesson well and also practice this virtue. Including exam time, honestly, in online exam is very important. In moral training, honestly, this virtue has a huge impact on virtual work, future work about if we make a mistake but we don't admit it. For example, if we intake the wrong dose but don't accept it, it can affect to the life of patient. And for St. Louis College, it's a private college. Our tuition fees and other fees for studying were also reduced, which is a big help to our parents nowadays. There are many parents who are having a difficulty making board ends meet, and we have contributed a lot in easing the financial constraints of our beloved parents. Finally, and most importantly, we can spend more time with our family. When before our parents, siblings, and us don't see much because we are so busy with school and going out with friends. Now we have the time to bond together, to feel what it is like to be a family. Even parents now help their children with their lessons or their homework. They get to know our difficulties and guide us along the way. A good family builds a good community, and good communities build a great nation. We can turn the crisis into an opportunity. We can make a good of what is seemingly bad. We can turn what is negative into positive. Indeed, because of online class, we are helping our government deal with the COVID-19 infection because we just stay at home, physically distant from each other. We have to be one with our government in fighting has pandemic. Online class is a way to show our nationalism and our love to our country and our countrymen. Let's be the one with our government. Life is constantly changing. We need to learn and to adapt to different situations. According Roy Burnett. Your hardest times often lead to the greatest moment of your life. Keep going. Tough situations build strong people in the end. And instead of worrying about what you cannot control, shift your energy to what you can create. When you can live a happy life, happy online classes made me one. Thank you. And I would like to invite Sila to speak about the world. Sorry, I would like to invite Sila to speak about the next. Thank you.
Thank you, Nulek. Like the second speaker talking about online classes, education, we increase time to spend with family and we can adapt life skills to a different situation. But now I am Sila, I am from Gen Group. I will talking about online practicum. The online practicum is will decrease you from infectious of COVID-19. It's not the best way to study, but it's the best way to protecting yourself from high-risk situation. Online class is safer. You don't contact with people like you do distancing. And online classes you can be learning everywhere and every time. Online class does not work from practice, but it's the best way from now to reduce the transmission of COVID-19. The practical study in the hospital is a high-risk situation. The online class will decrease the knowledge in the part of practice, and my career must be practice with real pattern. But now in a situation, we will protecting ourselves from COVID-19. And now I will be talking about the universal precautions. Universal precautions are the practice of avoiding contact with patient blood and body fluid, regardless of their infection status. Principle of the universal precaution are method from enhancing effectiveness in the infection prevention in medical and public health services, which essential for safe medical operation in physician and public health officer daily life. There are essential principles for infection prevention in the medical operation as follows. Sanitation and hygiene mean that workplace has to be organized, clear, and neat. In addition, disinfectant and sterilization must be appropriate from a medical equipment. Protecting barrier refer to appropriate use from protecting equipment such as glove, gown, mask that can reduce the risk of contacting with patient blood and body fluid. Avoid the accident mean the regulation and guideline has to be clear and strictly put into action in order to decrease accident or prevent infection during an operations. Most importantly, the actual goal from the universal precaution is to be supplementary method rather than replacement of the standard infection prevention guidelines, such as washing hands, wearing gloves in contact with the contaminated equipment or object. To bring this presentation this end, thank you for your attention. Now next to the next speaker. Thank you.
Hi, good afternoon, everyone. My name is Thanitdet Jinda. I'm the third year of Nursing Barom Rajoni College of Nursing Jangwat Nonthaburi. I'm the first speaker of Advantageous Group. Today, I'm gonna talking about how we can form online evaluation. First of all, I want everyone to look at the graph of infected patient by the COVID-19. From the graph, everyone can see the raising of infected patients from the COVID-19. I think everyone knows how bad the COVID-19 situation in Thailand. The currently COVID-19 situation in Thailand is quite really bad for Thailand, making it impossible for us to practice in hospital or communities. But it is a situation that we cannot avoid, which is the same all over the world. And this year is the 21st century. We have technology for help us. such as video conference, virtual technology, augmented reality, virtual reality. We can learn from virtual reality situations. Also, when we return to the college, we have a nursing laboratory room to practice. I'm sure if everyone or if I or if anybody do it together with reading book and reviewing knowledge in every day, we will be pass the exam and get good grade together. From my experience, practicing child-ethic nursing to the use video conference, the effectiveness not decreased at all. Practicing in child-ethic nursing is quite difficult because we don't actually work with the patients, but our teachers are quite adaptable, able to find material for help us. It gives us more time to do case study because practicing through video conference take less time to complete case study than practice in the hospital. And finally, that everyone needs in our lives to survive from the COVID-19 situation and more efficient government management of the COVID-19 situation in all sectors, such as physical and mental, and more effective vaccine. We need very effective vaccine. Thank you, and let's move to the next speaker.
In conclusions, online learning comes with many benefits, such as reduce the traveling time for teachers and students. And I think everyone has a positive experience in online learning in the class and a good experience in online education. Follow the prevention measures of COVID-19. As now, we are conducting an international online meeting to reduce the transmissions of COVID-19 as well. Therefore, online learning is now becoming important in new normal era. For all that reasons, our team totally agree that the online learning is the best way to protect ourselves from contracting the coronavirus and reduce the transmissions of COVID-19. And of course, we have gained some good experiences. Well, that's it for me. Thank you.
Okay, after we know some advantage from the game group, so what about the disadvantage? We will start with Ms. Pishira on the last group. The time is yours.
Good afternoon, everyone. My name is Pisasha Yuyen. I'm the team leader on the topic, what students lost from online learning in the COVID-19. First, I would like to say to you all that the COVID situation that no one wants to achieve, and no one wants to live with the terrible virus for a long time. Due to the COVID-19 situation, social exclusion measures from the COVID-19 epidemic have forced school and tertiary education institutions across the country to have different methods of coping with COVID-19. The Ministry of Education had a policy during COVID-19. This policy is called School Can't Stop, but Learning Can't Stop. Its policy is the continue normally teaching and learning, as it can include the link of export and contact. And this is another cause of the coronavirus outbreak as a result of this policy. More online teaching and learning are available by studying through various online video meeting programs, such as Google Meet, Zoom, and Microsoft Teams, and etc., to reduce the chance of spreading the virus. This crisis makes educational institutions, both learners and teachers, need to adapt to get used to online learning. Many subjects are beginning to see direction for possible of online learning, which is a matter that the university had always tried to support. And this could be an opportunity to expand your study in the future. But usually, health students like us don't just study in theory, but we need to apply the knowledge when we learn in the classroom to work, because our work is all about take care patient or client. which must be experienced by practice in real situation with a change at the hospital or ward to gain experience that will be further developed in the future. But these situations, students like us are available to practice normally. That also affect to our experienced student deserve. Although there is substitute online teaching, but it's not as effective as learning in the classroom, both in terms without interaction between teacher and learners without of interaction with friends or some course that must be learned mainly through practice, especially the lack of readiness in the field of computer equipment and internet access, making some students inaccessible to learning. So today I would like to introduce our team members to discuss. The first person, Ms. Windy, talk about the students' experience in online education in the classroom. And the second, Ms. Sholada will talk about online practice. And the last one, Ms. Piyanat will present information about the online education in the classroom. Next, Ms. Windy first. Yes.
Thank you, Ms. Pisasha. Queenie, please, let's start.
Okay, thank you for the time that given to me. Seems like I didn't have a time to introduce myself previously because of the internet connections trouble. Let me introduce myself. My name is Windy Astuti. I'm fourth year student nursing from ITKS Bali. Today, I would like to continuing my previous speaker talking about this advantage of online learning. Especially today, I would like to talk about this advantage of online learning to online classes. The next slide. The term of online learning seems like it's not something new for us. Long before this pandemic, COVID-19 attacked us, some country already invest to having online learning as a substitute or complement for conventional learnings for the futures. For example, like Indonesia and Thailand, they already prepare for having this online learning system for the future online system of education. Kesersak University in Thailand and Bina Nusantara University in Indonesia is one example of university that prepare that already having online learning system through their education process. But what happened on December 2019 when coronavirus attacked us, we are forcing to have an online learning classes to just continuing our learning process or education process. We forced to having that as an unprepared online learning system because previously we just prepared, but nowadays until this current situations, we forced to use this kind of system to replace the face-to-face education systems. And then because of, next slide, please. Because of this unprepared learning system, the students see it as having a lot of struggle to follow this kind of system. They said online learning have a lot of disadvantage because they see a lot of struggle. Our previous speaker before already told you that students have a lot of struggles, and it seems to be disadvantage of online learning. I would like to point three things as disadvantage of online learning. First of all, I would like to talking about unavailability of devices and also unstable of signal. Second of all, I would like to talking about unsuitable style of study or unmatched style of study itself for students or for some of students. Third of all, I would like to talking about unmatched or unsuitable environment study. Let me start about the first thing, unavailability of devices and unstable of signal. Seems like devices and signal play important role in having an online learning system. Some students doesn't have a smartphone or even laptop, or even when they have a phone, they only have an ordinary phone, which is they can use it to follow the online classes. Sometimes when they have a smartphone, their memory is something getting out of memory capacity, so they cannot download some pictures that the teacher use for them that they use to run the online classes. And it's truly happened to my friends in a class. He is need to work to gain some money to buy some devices or to change his current devices, because his current devices not support him to follow the online learning itself. Another than the availability of devices, the real struggle that the student face currently is that unstable signal. That what happened to me previously also, I don't have a stable signal, so it's disturbing the process of this conference. It's happened also when my first time, and also my friends doesn't have a suitable when they don't have a stable signal, they're facing a hard times to follow or even catch up to the to the online classes itself. Based on a survey that we are held just to ask the student about what their opinions about advantage and disadvantage of online learning, we got 17.7% of Thai students who filled the form, and 14% of Indonesian students saying that they don't have a stable signal during their class, which is disturbing the process of those classes. And when they have to come back to their hometown because of this pandemic, some students who live in a remote area, that make them hard to get the signal in their place. And it also make them hard to cope with the online classes, and sometimes they are left behind. And what the government try to do with this problem, ladies and gentlemen, the government nowadays give a free load to every student. If even nowadays the distribution still not cover all of the students, but at least we are trying to improve these systems. And then by saying that, also by knowing this disadvantage of online learning, basically we're not going to talk about just only this advantage, but we try to find a solutions of this problem. And second of all, I would like to talk second point of disadvantage of online learning is that unmatched style of study or unsuitable style of study. In terms to help students to get an objective of education, for example, like to help students having a good personal growth, intellectual achievement, and to treat them as a good problem solver, as different students have a different style of study or different way of study. Some students are really faster to understand when they just watching a video, and some students can understand the material of the subject that the lecturer give by just reading one times, or another student can get the understand of the subject when they are read the material 3 times. And then some students also cannot study alone, ladies and gentlemen. They are prepared to have a corporate learning in group learning discussions. But what the online learning and provide to them, they are forcing students to study alone in their home, in their rooms. They cannot have a they cannot have a corporate learning group discussions. They cannot do their brainstorming directly to solve the problem that they face in that times. And then that's why by the survey that we held also 18.7% of Thai students and 23.7% of Indonesian students that followed the survey, they are saying that the online learning couldn't replace the classroom itself, because different style of study means that means that they are means that this way can help them to get the aim of education. Third of all, the last point that I would like to point out about this advantage of online learning is that unsuitable study environments. Ladies and gentlemen, when we are forcing to having this online classes, we are back to our home. Seems like all of the students, most of them are having online learning in their home or in their house. Sometimes this environment just ruining the schedule of the study itself. For example, like because your mom, knowing you are home, think you are in a holiday sometimes, and they left and they give you some schedule to help her, to just help her in a house, and it's make you loss of your time to preparing the class. Other than that, we also really get a personal problem when we study in our room by ourselves, just alone. We are keep doing something that's we are easily to distract to and unfocus to our online classes. For example, like when you are because you are studying in your bed, in your bedroom, that's easily for you to get sleepy. The tendency you get sleepy in your bedroom is higher than you get sleepy in your classroom, because when in your classrooms the teachers like easily point out you and guide you to be focused again to your to the class. But what happened when you are having a class in your bedroom, because sometimes you easily to turn off your camera, that will make you easier to distract. And then because of this change to turn off your camera, sometimes you are doing another things. For example, like watching your K-drama, or even you playing your Mobile Legend game. That's also ruining the process of the class itself. And then by saying three things that we see as a student, that's disadvantage of online learning. First of all is unavailability of devices, and then unsuitable style of study. Third of all is unsuitable of environments. It seems like all of these things result with unmet of the aim of the study itself and decreasing the student discipline. As what I said in the beginning, this online learning during pandemic is unprepared learning system. Even though we know it is the only thing that we can do, the purpose, the aim of I'm saying this several disadvantages is we want to find some solutions. For example, like personal solution, we need to make ourselves consistent to do and to do the online classing and focus to the online classes itself. Even the government and also the teachers try to help us, we need to make ourselves help ourselves also. So by saying that, we have and we hope that we can increasing the process of the online learning itself. Okay, that's all that I would like to say. And then my next speaker would be talking about disadvantage about the online learning through the practicum. Thank you.
Hi, I am the third speaker from this advantage group. Continue from online learning on COVID-19 pandemic. Its impact to students, both Indonesia and Thai students, in availability of device and internet. Style of learning is different, and sometimes home is not a conducive place for learning. So online practicum rising too. The online practicum of dental public health on during the COVID-19 pandemic has many limitations because of birth. That might be the list of dental infection, which is known to be constipation, and they may be diffusion of saliva secretion. that may carry coronavirus in the patient to the operator, making the intern as increased risk of infection. Therefore, measures have been put to reduce the risk and prevent the spread of infection. In order to support dental procedure in patients, which is increase the need for equipment such as personal protective equipment, mask, face shield, also has an increased workflow, such as taking a more detailed medical history. More unit storage and cleaning between classes is a great opportunity for an internship, as well as nursing home. The quality and safety must be improved in the short term, which can quickly cause the shortage of results. Measure that prohibits all dental service except emergency is what a reduced daily limit on the patient acceptance. In addition, they have to go to the community to provide the knowledge of dental health education. This is another factor that makes it difficult to do online practicum on during COVID-19. And we move to disadvantage of online evaluation. Thank you.
Okay, thank you so much. Hello again, everyone. I am ber-SKP, the third-year nursing student of National College of Nursing. As we listened to previous speakers, we heard that students are facing many barriers of online learning. Importantly, we are not only facing problems with online learning, but we also see many problems of online examination. So let me share student opinion about why online examination wasn't not good enough. Typically, students have to take exams at the end of the class in order to assess to what extent do students develop knowledge and skill. Unfortunately, the COVID-19 pandemic has changed our traditional learning. Due to the novel COVID-19 regulation, quarantine, and shutdown policy has set and used for all colleges across Thailand. Most colleges and universities were required to close and let students to study from home. Then, our teaching and learning methods suddenly changed from in-person class to online one. Since our teachers let us take online exam, we as students had to change our learning habit and prepare ourselves for unfamiliar testing method. From student perspective, the first important barrier of online examination were a lack of IT personal equipment and the internet. During the first wave of COVID-19 in Thailand, BCNT students had to study from home. Some students didn't have laptop or tablet, so that they had to use their small smartphone for taking online exam. So students complained that they couldn't read and see questions clearly on their small smartphone screens. Some students also said that there were many technical problems of online exam application, such as they were kicked out from the exam or taking a long time for logging in due to the internet connection problem. Then, during the second wave of COVID-19, students were at the campus college internet access points were enough for students so that we couldn't use college Wi-Fi while taking online exam. The second big disadvantage of online learning for practicum class is ineffective of online simulation evaluation. Students expect to learn and practice their nursing skill with real patients in hospital and community. Practicing via online simulation is a new learning and teaching method for students and teachers. We students still wonder how teachers can assess our skill through online simulation. Is it effective? For example, if we are at home, how do teachers can evaluate our performing of Bundesing chef via camera? What we to prepare at home? There are too many things to think in order to make online practicum work perfectly. At the end of the day, I personally think it's impossible to evaluate nursing clinical skill via online platform. COVID-19 had been with us for almost 2 years. We have learned so far how to deal with online learning. Also, we learned that online evaluation had many drawbacks, especially academic integrity and impossibility. Because our online exam program couldn't prevent students from cheating and didn't have proper program. Typically, students take online exam on Google Form or other online exam application on our laptop, tablets, or phones. So students can capture screen or copy question and then send it out to ask someone or search for answer on the internet. Moreover, students could hire somebody to take the exam for them, and teacher didn't know it. Some colleges try to prevent cheating on online exam by requiring students to turn on other camera and let instructor to see them and their screen while taking the exam. However, this might be the good way to solve the program. Online exam without proctor isn't the best choice because students can easily cheat whenever and wherever. Thus, we should think whether college prepare student academic integrity or by online exam with proctor program. Which one do you prefer? Thank you. Back to Prim.
From the disadvantaged member said, it can be seen that online learning during the coronavirus pandemic has a lot to adapt to. Sometimes online learning has many obstacles, like members of my team have already spoken with a lot. But the main thing that those of us help students lost is that what training experience, because students like us need to apply the knowledge from the classroom to the world for real work in the future. And the work of career like us to work to the with like the passion. And we should not make mistakes just because of without internship experience. That online learning may prevent students from doing real internships. This affect we should learn to work or skill in the real situation. Online learning in the convenient method and best answer for the kind of time, but it must be admitted that the negative effect on online learning are also quite a few.
Okay, thank you for your information. It's over of discussion from the student from each group, gain group, and loss group. Okay, so even though school closing may also affect student because of disruption of teacher and student network, leading a poor performance. That means disadvantages of learning online in school and college. Instead, we also have technique and technologies education for student learning towards them during the pandemic season. Hence, this present student will have student objective is to develop a test conceptual model of student satisfactions of pretending online teaching during COVID-19 situation. And then to use the online platform and interrupt learnings and teachings. Michaela, do you have anything to say?
Yes, I have something to say. Since December 2019, coronavirus has attacked us and we have a lot of impact. So we already know that online learning has brought us some losses, such as being unprepared for online learning. the internet signal is unstable and pretending you are present in the class, but you are watching K-drama or doing other activities that are not related to learning. And the important thing is about the exam is that it is difficult to miss the student achievement, whether the students did the exam on day or not. These are the problems that students are facing right now.
Absolutely. So what we are going to do?
So the next session is Q&A session. Everyone will have 15 minutes for this. If you have any question or suggestion, you can ask below in the box chat in this room. So we have some questions from all audience. The first question is about opinion when COVID-19 situation recovery. Do you want to learn by online learning or class-based learning? Who answer this question? Miss Diana, please.
Okay, thank you for this question. In my opinion, I would like to study with in-person class. It doesn't mean online learning is bad, but I think in-person class is more effective for us. Nursing students seeing teachers and classmates in their classes will let me feel study. Thank you.
Okay, thank you for your answer. So next, what about Mr. Sila?
From my opinion, I think that I want to learning in class because of I have tension and a concentration with this class, and I love when teacher teaching, and when I in class I can ask teacher when I have a problem. But in the online class I don't attention for this because of when I have time I play my phone all this time. Thank you.
Okay, thank you for your questions. Wendy, I have some questions for you. I want to know how you to learn in online learning during COVID-19 situation and how daily life some students in Indonesia.
Well, thank you for the questions. What we doing during the how we study during the online classes, simply like all of you guys, we also using some platform for us to study online. For example, like we also using Zoom. Some teachers also using WhatsApp as for discussions when some students doesn't have a stable signals. So basically when the WhatsApp can't approach to these online classes, and then we use a WhatsApp group. Sometimes you also use a Google Meet for students to do online classes. And for me personally, I did it in my boarding house, both in my boarding house and also my hometown. Sometimes when it is come for me to have require a high signals, I would like to move to my boarding house to get a good signal, because I'm just far away from school. My hometown is just far away from my school, and sometimes I don't get a good signal, and it's become a trouble also for me to follow the online classes itself. And some of my friends also experience the same things, and they do same thing, like move to their family house or their brother or auntie house to just get a signal or better signal so they can follow the classes.
Thank you, Wendy, for sharing us. Okay, so I think we have some questions to ask. The person who will answer this question is Sholada. Yeah. Sholada, are you still? Okay, the questions is, how can you learn how can you collect organized practice sessions in where how learning? Please give us an example, and how do you think about it? Yeah, so I think she is not still here. Okay, next, what we are going to offer someone.
Okay, the question is for Mr. Tanit. I have some question to ask you about the COVID-19 vaccine that you want it from the government. So what do you think about COVID-19 vaccine right now?
Thank you for your questions. In my opinion, I think the vaccine in Thailand is ineffective because from the research, after we inject the Sinovac vaccine, the immunization can raise 20 to 30% in second dose, while Pfizer or Moderna can raise 94 to 95%, and importantly, there is side effect in Thailand very much. Moreover, some cases die by the vaccine and they don't get help from the government. Actually, the government, and now if you die from vaccine, you can claim 400,000 baht, but in fact, you don't get help from government. Thank you.
Okay, thank you for your answer to these questions.
So, is some question more is how can the college organize the practice session while online learning? Please give us an example. How do you think about it? This question for Ms. Savitri, please answer this.
Yes, thank you for the question. Yes, since we cannot practice, I hope our college can allow swab test for us so we can learn practice using our simulation laboratory. For those who are living up country, they can watch us who are here in Bangkok or around the Bangkok. We are doing practice using our simulation laboratory or fundamental laboratory. Our laboratories are equipped with the camera so they can watch us and they can watch a record video. But of course, nothing beats actual learning in the hospital. And in our college, a lot of students now, we are vaccinated already, almost the second dose. So we can, I think the next month we can practice in the hospital, and we will happy about this, that we can practice in the hospital. And yes, before that, the teacher tried to find the case study in the hospital to the student to practice this. So we can practice like normally, but we cannot go to the hospital. Yes, thank you.
Okay, so I have some questions to ask Mr. Tanit. Okay, about the COVID-19 vaccine that you want it from the government. What do you think about COVID-19 vaccine? What do you think, Tanit, about the vaccines from the government? Tanit, can you turn on the microphones? Okay.
Sorry, I just answered the question already.
You can answer it again because your microphone is up.
Okay, again. I think vaccine is ineffective because they have some people die from the vaccine, and I think the government should be change the vaccine to the Pfizer or Moderna or AstraZeneca and remove the Sinovac from the Thailand. Thank you.
Okay, thank you for your questions. And next, what we are going to do next.
Okay. Is last question I asked about some about the college organized. So I want to know how the college in Indonesia, what are they organizers? So Windy. what do you call it, organize the practice session while I learning? Please give me an example.
Okay, thank you for the question. Okay, so basically in Indonesia, in the very first times we are attacked by COVID-19 virus, it's hard for us to hold the practicums and we cannot go to the hospital. Even some students have a schedule to go to hospital for having a practice. So how the teacher organize it? The teacher would like to told the student to make a video assessment, giving assessment, interventions, how they diagnose the patients, and sometimes their family help them as a patient. So when we have to record our activities, start from the assessment until giving the evaluation of the patient conditions, and then we send it to the lectures, and the lecturer will review it, and we will had some conference, something like this, to Zoom. We have to play the video and we discuss it to the other friends or the other groups. Sometimes we are separated into different groups, a small group, so we can discuss it together. For example, like a skill for having like oxygenations, having a suture for the patients, having a wood treatment for the patient. We sometimes can use our creativity, like increasing our creativity, how we make it as a real patients, as a real patient, and a real wood, for example, for wood treatments. So we ask for our family or even friends as a patient. And in this current situation, some of students already going to the hospital for having a practice. Some hospital already open the chains for the student to go into the hospital because some of us already get a vaccine, but of course they require for swab test before we are going to the hospital for having a practice. And also in a hospital they will not be allow a lot number of students who go into the hospital, so the teacher will be like separated the student into a small group, and they have a sleep, like the sleep morning, afternoon and night sleep. So the amount of the student in the hospital will not be that much. That's how we organize it in Indonesia, especially in ITKS Bali. And for some nursing student out of ITKS Bali, sometimes they only have 4 hours of, sometimes they have only 4 hours chance to be in a hospital. So we have to find patients, like giving assessment, giving interventions, only 4 hours practice. So we have a limited time to be in a hospital. So we not to be exposure to this COVID-19 virus.
Thank you so much. And I have some question more, just more question. I need to know about the suggestion or the thing you need for practice online learning. So what about Ms. Priyanat? What are your suggestion or the thing you need?
Okay, thank you for this question. My answer for this question is yes. We need to practice using online learning tools such as Zoom, Google Meet, Google Class. Some students didn't know how to submit homework on Google Class. I also think we students need to control and manage ourselves for online learning. For example, set up learning schedule. Thank you.
Thank you so much. And what about the opinion, Mr. Tanit? What about you?
Thank you for your arguments. From the question, I will suggest my friend or anyone that's asking to me, I have 3 keywords for practicing online. The first one, auditory. The first one, visuals. Visual must be concentrated when your teacher are teaching and find material to help us when practicing online. The second, auditory. When your teacher are teaching online, you must to be listening and silent your cell phone. The third, kinesthetic. After a lecturing class, you must to reviewing your knowledge and your lecture and practice on your model, such as from my experience learning midwifery online. I practice online with my teddy bear. I think everyone think it can be work, right? But it can help me understand mechanism of labor. Thank you.
Okay, so the last questions, how do you practice in hospital and community during COVID-19 situation? The person who will answer this question is Sholada. Are you coming back? Okay, you can answer these questions. Okay, it's okay. No problem. Okay, so her internet was poor. Okay, so how are you feeling now, Miss Galayapon?
Yes, it's very fun, and I feel like we've been affected by a lot of the COVID-19 situation. This was student everything, and this is a huge challenge for us. I hope we can get through this for sure. I think it's definitely going to happen. And so, how are you feeling about the result of the discussion, Mr. Taton?
Yeah, I feel fantastic and so glad to be here for the opportunity to speak to the audience today. We hope this weekend will help you better understand how to learning online class during COVID-19 situation.
And now we are going to say thank you to everyone who came to watch us. We are very thankful and happy today. All I want to say is thank you for your guidance and support. Hopefully we'll meet again when the COVID-19 pandemic situation is over. Thank you. Terima kasih.
Okay, let's hand opportunity to Dr. Siliton. Please turn back to the stage.
Okay. Thank you, Taton and Galayapon. And all 8 panelists, Panada, Savitri, Sila, Tanit, Pisacha, Kadek, Chalada, and Priyanat. All of you done such a wonderful job. If we are together, we are separate, so we just give a hand to show our applaud and appreciation for your hard work. Okay. Very, very well done and very thorough. So now we know that how is students' view on online learning, practicum and evaluation on students during COVID-19 pandemic. Is gain or loss? See, we can talk more later, like in the group, and as a COVID-19 go on, maybe we will come up with a solution that will help release the pain, the loss that we are facing now. And from now, I will have a 5-minute break. Now it's 2:30 in Thailand time. So we will come back to meet at 2:35. Okay. And let's have a break for 5 minutes. Come back at 2:35 p.m. in Thailand time. And in Bali time, maybe 3:35. Okay. Thank you. See you later. Welcome back again. And the next session, we will start our panel discussion. That will be the last discussion for the conference today. The topic is Students Talk, how to help students success in learning with happiness in new normal era. That will run from 2:30 until 4 p.m. In this session, there will be 2 moderators and 7 panelists join the activities. And before we start, I would like to take this opportunity to introduce the moderators for the session. The first moderator is Mr. Attaporn Cherchan. He is the 3rd year Thai traditional medicine student from Apai Phubet College of Thai Traditional Medicine and at Prachinburi, Thailand. And the second moderator is Miss Piyatida Phukvira. She is the 3rd year nursing student from Boromarachanani College of Nursing, Nonthaburi, Thailand. Please join me to welcome Mr. Attaporn and Miss Piyatina. Now the time is yours.
Thank you, Ajahn Pilikorn. I sorry, it's my sound. The rain is so. Okay. Good afternoon, ladies and gentlemen. สวัสดีครับ Welcome to Health Professional Education for Effective Response to COVID-19 and Future Public Health Emergency Sharing Experience. I am Attaporn Cherchan. I am 3rd year student from Apai Phubet College of Thai Traditional Medicine at Prachinburi. Nice to meet you.
Hello everyone, my name is Piyatida Phukvira. You can call me Miu. I'm a 3rd year nursing student from Boromarachanani College of Nursing, Changwat Nonthaburi. Nice to meet you.
We are the moderator for student talk presentation today. Allow me to guide this presentation. Before we start the presentation from the presenter, let me introduce my team first to all of the audience. The first member, Awik, please introduce yourself.
So hi everyone. So my name is Putra Wisnawardani. I'm so excited to be here. You can call me Awi. I'm the 3rd year nursing student from Institute Technology and Health Bali. It was nice to meet you all.
Okay, thank you. The first member, Afnan, please introduce yourself.
Hello, my name is Afnan Ahmad. I'm the 3rd year nursing student at Boromarachanani College of Nursing, Bangkok. Nice to meet you.
Sorry. Okay, the next member, Prel Panarai, please introduce yourself.
Good afternoon, everyone. My name is Prel Smithan. I'm a 2nd year nursing student. I come from Papaka Nursing College, Nonthaburi. Nice to meet you all.
The next member, Hanitnan, please introduce yourself.
Okay, good afternoon, everyone. My name is Panitnan Nwanjan. I am 3rd year student from Boromarachanani College of Nursing, Chonburi. And you can call me Mina. Nice to meet you.
Okay, thank you. The next member, Chantapat, please introduce yourself.
Good afternoon, everybody. My name is Chantapat Yamhofai. You can call me Kim. I am a nursing student at Boromarachanani College of Nursing, Maharashtra. Thank you.
And the last member, Bunyanut, please introduce yourself.
Hi, my name is Bunyanut Jamsri. You can call me Pinter. I'm a 2nd year nursing student from seluruh College. Nice to meet you.
Okay. Thank you all presenter for introduce yourself. I so sorry. The rain is pouring. Now we will talk about how to help students success in learning with happiness in new normal era. So for the presenter, Chantapat, please, the time is yours.
Good afternoon, everybody. Let me start with some general information. COVID-19 or coronavirus disease started in 2019. It's a virus with multiple pandemics today. Currently, there are 177 million people infected worldwide. There are 3.83 million people who have died from this virus. The COVID-19 pandemic affected the people. It's almost 2 years since this pandemic happens around the world, including Indonesia and Thailand. This current situation makes all of society deal with a lockdown, start the work from home, can't go anywhere, as usual, because we have stayed at home in order to avoid the COVID-19 transmission as best as we can. Come from this reason, we as students need to study at home, do online class during this situation. The pandemic of COVID-19 leads to the negative impact in every sector, like tourism, health, economic, social, and also education sector. Mostly, students need to prepare their electronic device and internet quota for this online class. According to this previous hour, that this student will spoke about what they have gained and lost from staying online. That means there are both positive and negative experience on this situation. The students so need to get help to be successful in studying online. We are going to speak about the student need to support online learning. Thank you.
Thank you, Kim Chatapat, for your information of the COVID-19 pandemic situation. And now let's watch the interview video from 11 College. Please pay attention. Video, please.
In my college, we use online study, like online learning system that we use in our campus. When we start to study, we always use some application in our smartphone or our laptop, like WhatsApp, Google Meeting, Google Classroom, or Zoom application. But if we have a schedule with a presentation, we always use a Zoom application like that.
ถ้าช่วงปี 3ที่ผ่านมาค่ะส่วนใหญ่แล้วก็จะเรียนผ่านระบบ Google Meet โดยอาจารย์จะลงเนื้อหาค่ะแบบการเรียนการสอนมีบันทึกวิดีโอย้อนหลังอะไรแบบนี้แล้วก็ให้เรามาทบทวนได้ผ่าน Google Classroom.
I think about study during the COVID-19 situation is bored and not fun. It's my opinions.
ค่อนข้างลำบากนะคะเพราะว่าเราเรียนออนไลน์อย่างน้อยมันก็เรียกว่าอะไรเรา
เรายังไม่ชินกับการเรียนแบบนี้ค่ะส่วนใหญ่เราจะเรียนในห้องซะมากกว่า
ค่ะการเรียนออนไลน์นะคะก็ทำให้ตัวเองเนี่ยได้มีเวลาทบทวนเนื้อหาบทเรียนนะคะได้อย่างลึกซึ้งมากขึ้นแต่ว่าการสื่อสารประชุมงานกลุ่มเนี่ยจะไม่มีประสิทธิภาพเท่ากับการรวมงานกลุ่มการทำแบบจริงค่ะ
อย่างแรกเลยก็คือสัญญาณอินเทอร์เน็ตนะคะเพราะว่าถ้าเป็น Wi-Fi ที่หอพักนะคะก็ห้องน่ะจะอยู่ค่อนข้างริมสุดแล้ว Wi-Fi ไม่ค่อยถึงค่ะแล้วเราต้องแชร์เน็ตจากมือถือซึ่งมันค่อนข้างช้าค่ะอันนี้ก็คือปัญหาที่ผม
For me, tips and tricks to success learning during this pandemic is consistent. For me, consistent doing whatever is a simple tips and tricks to success. You can make a daily schedule so your activities will schedule, and we should consistent to study hard and just focus to our lesson. That's the point. And please don't play social media too much in your smartphone that make delay the activities you are going to do. And one more, please sleep on time. Don't stay up late. It will make you fresh, wake up in the morning, and you can do the daily activities well.
We must have discipline, and I use equipment to help that.
สำหรับสัญญาณอินเทอร์เน็ตนะคะที่หลุดหายไปเนี่ยทำให้บางคนเนี่ยเรียนไม่ทันนะคะก็อยากจะให้บันทึกและส่งไฟล์นะคะระหว่างการคอนเฟอเรนซ์หรือว่าการสอนนะคะให้นักศึกษานะคะได้ดูย้อนหลังได้ค่ะ
เวลาที่เราเรียนใช่ไหมคะเราก็จะนั่งเรียนอยู่กับที่ติดต่อกันหลายๆชั่วโมงมันก็จะอาจจะทำให้เรารู้สึกว่าปวดเมื่อยแล้วแบบจะไม่ค่อยมีเวลาพักเหมือนแบบถ้าเราจะไปเข้าห้องน้ำเราก็สามารถขอไปเข้าห้องน้ำได้แต่มันก็จะแบบจะขาดกับที่อาจารย์เขาสอนอยู่อาจจะแบบมีการพักชั่วโมงละ10 นาทีอะไรแบบนี้ค่ะ
ก็นั่นแหละค่ะอยากช่วยให้ลดค่าเทอมหน่อยเพราะว่าการเรียนออนไลน์เราไม่ได้ใช้แบบห้องเรียนที่อยู่ในวิทยาลัยนะคะแล้วก็สนับสนุนค่าอินเทอร์เน็ตด้วยค่ะ
มันสำรวจว่าคนที่ต้องการจริงๆมีเท่าไหร่แล้วเราจะให้การสนับสนุนแบบนั้นเขาอย่างเต็มที่ไหมหรือเขาขาดเหลืออะไรไหมอะไรเงี้ยค่ะเพราะอย่างที่บอกว่าแต่ละคนเนาะมีพื้นฐานทางบ้านหรือว่าความพร้อมในการเรียนมันไม่เหมือนกันอยู่แล้ว
พวกสื่ออุปกรณ์เนี่ยก็อยากจะให้สนับสนุนกันมีเซตเป็นฝึกทักษะด้านเทคนิคการพยาบาลนะคะแค่รวมอยู่ในกล่องเดียวกันค่ะเป็นขนาดพกพาก็ได้ค่ะแต่ว่าในกล่องนี้ก็จะประกอบไปด้วยเซตคำแผนนะคะเป็นแบบพลาสติกเป็นโฟเซปพลาสติกนะคะเป็นไซลิงมีเข็มมีไวรัลนะคะมีสเตปโตสโคปนะคะแล้วก็ให้กับนักศึกษาทุกคนค่ะ
ให้แบบเนื้อหาเพิ่มเติมในการสอนเพื่อจะทำให้เราแบบได้ทำความเข้าใจก่อนที่จะเข้าไปเรียนจะทำให้เราเข้าใจมากขึ้นแล้วก็อาจจะตั้งใจมากขึ้นจะได้ไม่ต้องหาข้อมูลในขณะที่เรียนว่าแบบเผื่อเราไม่เข้าใจ
ค่ะการเรียนออนไลน์บางครั้งนะคะก็ไม่ได้ทำให้นักศึกษาเนี่ยมีความแอคทีฟเท่ากับการเรียนในห้องจริงๆค่ะก็เลยอยากให้เพิ่มเติมให้มีเกมตอบคำถามเนี่ยสนุกๆท้ายบทเรียนนะคะเกี่ยวกับเนื้อหานั้นๆค่ะ
Possible, I want to get the best vaccine like Pfizer and Moderna.
Okay, this video just some simple opinions of the students who get a problem while learning in online classes during the COVID-19 situation, and they want there. So next, we will move to survey of students' opinion from 11 college by Panalai. She will explanation of general information, and then Afnan and a week will explanation of students' support needs. Your turn, Panalai.
Thank you. Next, we are research finding we made from the Google Form questionnaire. We get the following information. A total of 1,945 survey respondents from Thailand 1,717 and Indonesia 228 people. Next, most of the students are from Boromarashonani of Nursing, Changwat Nonthaburi, 27%, and students from Indonesia 12%. Next, according to the Google form, more than half of the students are nursing students from Thailand and Indonesia. And in Thailand, there is also midwifery, Thai traditional medicine, public health, and engineering. Finally, in online learning, next. In online learning, 55% of students use a notebook, computer, laptop, and 26% use smartphone. 8% desktop computer and 1% from iPad. Thank you.
So finally, we move to this session. It's about student talk, and we will discuss about what we face, the problem that we face during this online class as students. So should I say hello again to you? So hi everyone. So today we will discuss, so just relax. I know have been a long conference, so maybe we can just relax and get some information from this discussion. So I hope you're doing well and good health, everyone. So today we will discuss about some topics. Maybe Miss Alice, you can explain the topics that we will to discuss today.
Sorry, Afnan, sorry. Afnan don't have a sound. I can't hear you, Afnan.
Hello, test.
Okay.
Sorry for inconvenience. So, thank you, Ms. Awik. In our part, I would like to discuss the results of the survey we had conducted from the students of 11 colleges in Thailand and Indonesia, in the topic of how to help students success in learning with happiness in new normal era. So from the survey we had conducted, in which our focus is the student needs. What are those needs? Okay, the first need is about physical and psychological support. Second, financial support. The third is information technology support. Fourth, learning material support. The fifth is learning methods or techniques. And the last need is specific support related to COVID-19 situation. Okay, for the first topic, I would like to discuss the students need on physical and psychological support. As you can see from these two pie charts, there's a difference is quite big. Why is that? We'll find out later from Ms. Awik. Okay, in Thailand, we only have 9% difference between the majority and the second largest student needs. But in Indonesia, the majority concern of the student is to have break time during the class, which is 72%. In Thailand, the majority concern of the student is to have break time during the class. It is because most of us have a long class for about 3 to 4 hours per subject. So they just want some break to relax their body and mind. Okay, if we have a short break so that the mind will be clear and we can learn anything effectively, right? For the second largest of the student need is to finish the classes on time. It is because maybe some students still have to study another class. So to have a short break for them is they can go into the toilet or have some stretching before the next class. Okay, Ms. Awik, would you mind telling us why the percentage is this big?
Sure, I will explain it. So here's the data of Indonesia is we have that 72%, the majority concern is about break time during the class. And the second majority concern is about 22%, and it's about allow the student to express their feeling and problem. So I think why the blue one or the break time during the class can be the majority concern in here, because we all know some of students in Indonesia, maybe some of us know that when we doing online class at home, we also help our parents maybe to clean our house, or maybe to help our mom to cook. Maybe it because of it we need to more break time, and we also have much tasks, so that's why we need to have more break time to do our tasks and also give a rest for ourselves and make it better to join the online class. And also the second majority concern is allow the student to express their feeling and problem. I think it's also important because we as students, because this is the new situation that we face during this pandemic, I think it's really important to the student to approve their feeling and problem to the lecturer or to the campus. I think that's why the reason. And then maybe Miss Alice, can you choose one of our friends to sharing about their opinion?
Sure, Ms. Awik. How about Mr. Atapon? Do you have any need on physical and psychological support? Can you please tell us?
Okay. I need a break to the survey. I need a break 10 minutes every hour because I can't concentrate when studying online class, causing maybe not being able to focus on what is being studied. And I want the teacher to teach and finish teaching on time. I have a story. One time the teacher finished teaching late. This allows students to have less time of lunch on lunch. Because they have to study in the afternoon. So some students brought lunch to eat during class, making learning less effective. Yeah.
Thank you for your sharing, Mr. Atapon. I know finish the class on time. It's also important to us as students. So let's move to the next slide, please. Okay, the next slide, we will discuss about financial support. So we have the data in here from Thailand and also from Indonesia. So the reason why the majority concern from Thailand will be explained by Ms. Alice. So I will explain why the majority concern in Indonesia is about 44%, and it's about allocate internet SIM card, and then the second majority is discount for the tuition fees. So why the allocate internet SIM card is the majority concern? I think, from my opinion, most of the students in Indonesia actually lost their pocket money during this pandemic because they study at home, and then maybe they only get 50% from their pocket money, and they can buy internet SIM card for every day, ladies and gentlemen. So that's why the student need this allocate internet SIM card. So let's talk about discount for the tuition fees, and it's about 37%. And we all know that Indonesia, especially in Bali, is most of the parents of the student is work in tourism sectors. But during this pandemic, the parents cannot go their fee or their salary as normal as usual. So maybe discount for the tuition fees is really important for the student to continue their study in the college. I think that's the reason. So how about in Thailand, Miss Alice? Can you explain to us?
Sure. In Thailand, the student need is to have a discount for tuition fees because when we study online, we stay at home and we use our own money to buy the internet package for use of study. So if we have the discounted tuition fees, we can use it to allocate for our internet package instead. And for the second is they want to have an allocated SIM card from the college. It is because it will be easier for them to use it separately from their personal SIM card. In the internet signal in the personal is unstable. So that's why they want an allocated SIM card to use for convenient learning. That's it.
Okay, thank you for your sharing, Miss Alice. So let's choose one of our friends. So how about Miss Panitnan? What do you think about financial support that you need? Please share to us.
Okay, I will share my experience. For the COVID-19 situation in the past year, in my college, all of students have to stay at home and studying online, right? And students don't use college classroom or dormitories, and then have many students are worried about the class. Like me and my friends, we were worried about whether I can pay all tuition fees, and after that time, we so relieved that my college has reduced the tuition fees for our students, and students can postpone the payment of tuition fee if anyone is not ready to pay all of them. I think it can help students a lot. Yes, that's it.
Okay, thank you, Ms. Panitna, for sharing what you want from your college. And it's about to have a discount for tuition fees. Luckily, you already have got the reduced tuition fees from your college. And for the postponed day of paying tuition fees also. That's good. Okay, so we move on to the next topic. It's about the student need on information technology support. I think the students in Thailand and in Indonesia have the same opinion on this matter. And it's not surprising that why the students want to have a laptop and tablet for free, because it is more convenient for them to use it for online class. And they can use it to keep the PowerPoint, and it will reduce the expenses for printing the sheets. And for the gadget repairing service is important too, because when you use the device every day, overusing it may not function efficiently. Ms. Awik, how about your country? Could you give us more information?
So sure, so we can see in the screen that the majority concern in here is the blue one, and it's about 47%. They want laptop or tablets for free. Sure, we want it, but it is because why? We need it because we don't prepare for this online class. So maybe some of students don't have the laptop or tablet, so we need it for free. So, and then the second majority concern is about 30%, and they want gadget repairing service. I know all of us maybe have the gadget, but the gadget is not work optimal. So that's why we want it also. I think that's it. Maybe Miss Alice can choose one of our friends to sharing.
Yeah, for sure. And for more data, I would like to ask Ms. Chantapat for her opinion.
For my experience, when I study online, I think that online learning IT support is laptop or tablets, because we use this for reading and learning, and but some students don't have enough money for pay. I want to give the colleague support in this area. Thank you.
So, okay, you want laptop and tablet for free also, right? So let's move to the next slide. Thank you for your sharing, by the way. And then next slide, please. Okay, let's move to the student need on learning material support. So we also have the data in here from Thailand and also from Indonesia. So you guys can see on the screen that Indonesia have the majority concern. You can see the blue one. And then the second majority concern is the orange one. So you can see that the blue one is about 47%, and the student want learning material for practicum class via online, such as dressing set. So maybe in Indonesia, we also know that we practice or we do our practicum by online. So we need the real tools to do our practicum. So basically, during this COVID-19 situation, some of us use doll or something in our home to practice our practicum. So that's why we really need this learning material for practicum. So that's why it's the biggest or the majority concern. So and then the second one is about 13%, and they want ebook or e-journal for free. So Miss Alice, can you explain the data from Thailand, please?
Okay, from Thailand, the students need the lecture PowerPoint in advance. It is because they want to read the content of the lesson that they will study with teacher, so they can participate in the class discussion. Okay, that's the reason from Thailand.
Okay, thank you. So let's choose one of our friends. How about Miss Prupanalai? How about your opinion about this topic?
Okay, that is a good question. So for me, in the last years, in my college, we learned 100 online class, and the problem is some teachers don't have record the video or the file that they watch it. And we want the college to have a record for the teaching, so that the student who have the bad internet connection have a chance to come back and watch it again. Because if not have recording and the student have internet signal bad at that time, so student will not understand, and then the score will be low. Thank you.
Thank you, Ms. Parapanerai, for sharing what you want. and it's to have the recorded file or video of teacher while teaching to study more, because the weather can cause unstable internet connection when you study. And for Ms. Pranitnan, do you want to share us something?
Yes, I would like to propose to have exercises for before learning. It take about 2 or 3 minutes, such as dancing or aerobic, that's and maybe teacher may assign one student to be a reader for that day. I think it can make students more alert and ready to learn. That's it.
Thank you for sharing your opinion, Ms. Pranitnan. So let's move on to the next topic. It is the student needs on learning methods or techniques. Oh, look at this chart. Again, there is an obvious difference here. The largest percentage of the students' need in Indonesia is to have an interaction between the student and the lecturer during the class. Meanwhile, in Thailand, the student want an entertainment during the class, such as Kahoot or some game to make the study or the class more interesting and lively. I think the student will be more eager to learn if the methods or techniques is different. Ms. Awik, how about the opinion of the students in Indonesia?
Okay, first, please next the slide first. Next slide first. Okay, this is what we discussed about learning methods or techniques. So Indonesia, the largest concern in here is about the blue one. We can see that it's about 48%, and they won't interact between student and lecturer during the classes. And also the second majority concern is about the orange one, entertain during the class. I think why this blue one can be the majority concern, I think because it is a culture of Indonesia people. I think it's just like Indonesia people like to talk each other, like to communicate with each other and connect each other. So that's why they want to interact with their lecturer. So maybe it can be more interesting when they can interact between the students and the lecturer. I think it's more effective. So the second concern in here is about entertain during the class. I think it's also important because the student can be more interesting when we do some games on it. So maybe they can remember the material easily. So that's why. So maybe Miss Alice, can you choose one of our friends?
Sure. Thank you, Ms. Awik, for sharing to us. So let's listen to Ms. Piyatida if she have any need on learning methods support.
Thank you, Afnan. Thank you, Afnan. My problem is my concentration when the instructor start teaching and the lesson become boring. I lost my concentration immediately. Many instructors have different teaching methods from what I'm studying. I think that is interesting. Teaching is student-centered, which is not only lecturing from teaching material, but letting the students participate in the lessons. For example, the instructor may use the Kahoot or games or quiz to give the question. Not only does it become more interesting, but the students can remember what they are studying better. Thank you.
Okay, thank you for your sharing. So you want Student Central to study and you want more games to interest some students to join the online class, right? So let's move to the last slide. I mean the last slide for our topics. Okay, so we're going to talk about specific support related to COVID-19 situation needs. So here's we have the data from Indonesia and also from Thailand. You can see that the majority concern in here, we can see the blue one and then the orange one, and this is about 29%. And from Indonesia, we will hear the reason why from Miss Alice. And now, we just talk about from the data from Indonesia. So here's why the COVID-19 vaccination for free is the majority concern. I think, in my opinion, in Indonesia, we already have the vaccination for free, but some of our society don't get the vaccination yet, so they really want it for sure. So, and then the second majority concern is swab test for free if needed. So as a nursing student also, of course, we need it. And when we go to hospital, we need the swab test. And maybe if can be it can be true to give us a swab test for free, I think it's really great and helpful for the students. So how about in Thailand, Miss Alice?
In Thailand, the majority concern of the student is to have a swab test if needed and the COVID-19 vaccination as well. As you all know that we need to practice on ward at hospital, so they want this because they can feel free and feel safe in the environment and the people around them at the same time. That's the reason from Thailand.
Okay, thank you for your explanation. So let's ask some of our friends. How about Miss Bunyano? Are you here? Can you explain to us the reason why you need this specific support?
Sure, I'm here. In our college, all students have the first vaccine already and wait for the second vaccine on time. And our president, she had provided us free course and surgical masks last time. And we were also provided with knowledge on wearing protective suit in our fundamental class. But I'm not sure on how different is it with the PPE for COVID-19. As for the face swab, I don't know if before we go to the plastic in the hospital, we would be given face swab test. I think it is absolutely necessary because at this time, most of the coronavirus had almost no symptoms. Even if we are already vaccinated, we can still have COVID-19. So we really have to make sure. Thank you.
Okay, thank you for your sharing, Ms. Bunyano. Finally, this is the last topic that from support needs of the students. So thank you for your attention, everyone that joined in YouTube or in the Zoom. So thank you for your attention. May our information will useful for all of us. And finally, I give back the presentation to our moderator. Once again, thank you.
Okay, thank you to everyone to talk about what students need support. All of your opinion were really interesting. Ladies and gentlemen, that is the problem we all face during online class, and it is the support that we need from our college. We all know as students, maybe all of us face the same problem. So I want to know how you all adjust yourselves in the COVID-19 pandemic. Let's talk about the simple tip or trick to make your success in learning during this pandemic with happiness. Yatira, are you here?
Yes.
Yatira, do you have some trick for study online class? Can you share with us?
Sure, Atapon. My tip and trick. When I learning online class, I will take a note that the teacher teaching me, and I will highlight the important topic, and then finish my class. I will read again, review of what the teacher teach me today. And you, Atapon, do you have any trick or tip to suggest me and our friends?
Okay, for me, I when sleep, I think about what I learned today. If there is something that I don't remember, I will get up and open the study sheet again and keep doing this until I fall asleep. I think it helps me remember more. Yeah.
Okay, thank you for your suggestions to me. Now I want to know other tips from our friends. How about Pal Panalai? Can you share your experience to me?
Okay. For my tip and trick is when I'm studying online at my home, I am very sleepy person and I don't like to sit a long time because I can forget at something for a long time. So I have to have a water beside me to drink and stay in a quiet room with a bed and the air not too hot. And after finish the class, I will practice what I have learned today for 10 to 20 minutes.
Thank you for your suggestion, Pal Panalai. I think that same you because I think the water important of my life. And next, can Panisnan, can you share your tip and trick for our friend and us?
Sure. Well, I am the one of those students who feel straight from studying online at home in order to do a lot of homework. Yes, and I have many problems about my internet, right? And so that time I'm so straight, but I can deal with it by positive thinking. Yes, the positive thinking, it has helped me to managing my thoughts. For example, studying online has made me more self-study. Yes, and that's mean that I have more time to review my reason more deeply and have more time to relate and have more time to plan for living and studying by myself. And I think it's good for everyone. You can use it. Thank you.
Okay, thank you, your Panitnan. I think so that you, if I have free time, I will review other research or ebook like you. Next, can Bunyanut, can you share your tip and trick that you have while study online class?
Yes, sure. About my trick and tip to make me awake and alert during online class, I have some snack and water by my side. And I review my lessons by reading and listen to the song music after the lesson is over. And the last, I will read my book and hash out a week before the exam. This helped me a lot to get my better score. Thank you.
Yeah, hang out with friends is important of me like you. Okay. Thank you for our suggestion to me. And next, I will turn to top Atapon.
Okay, thank you, Piyatida. I think these are all good tips and tricks. The audience can adapt to you learn. So let's move to last part. May give us some so we can make sure that we understand same thing from the data that had been shared before. I think we will let Piyatida be the one to summarize. Piyatida, please.
Thank you, Atapon. This is the last part of our student talk. During this seminar or survey, we learn about gain and loss. We learn how to recognize our coping mechanisms. Sometimes we ask students think that it's not easy to learn online, but we still can survive for years because we have a support from our friends, our parents, and people around us. We may already have had electronic tools because this pandemic, but we know that not all of those tools accommodate us to do the online class. Deploy is as students, we need some power tools to study online or power tool to do our laboratory practice. So may the teacher or campus accommodate us to study well with some power tools and also give us a tuition-free discount. And then we have the time for question and answer. I will turn to Atapon. Your turn. Thank you.
Okay, we have 25 minutes for the audience. You can set question and opinion in chat box now. Okay, have a question from the audience. If you can use only one device for online studying, which one you prefer and why? I think Panitnan, how about you?
Yes. For me, I will choose notebooks. A notebook because it can make the documents and presentation easier than the other, and I can move it to everywhere. You know, when the page that you are using too bright or too loud, I can move on. Yes, and one when you have a problem, when the power goes out, yes, the notebook can be used. Yes.
Okay,
That's
thank
it.
you. Thank you for answer, Panitnan. So the next have an opinion from the audience. This is great presentation. Thank you. And have a question. Them ask, how can we help students engage in the online learning? Everyone, how about you? Bujanut, can you answer them?
Yes, sure. About help students engage in the online learning, I think teacher will ask more questions when they teaching us because it's about our lecture is help me to bold. It make me feel bold, right? Yes. And I think like the author says, I think the game or quiz before and after the class is good to help. Yes, thank you.
Okay. The next question: if the hospital allows students to work as volunteer in the hospital for helping with the COVID-19 activity, will you join that? Do you think that is good opportunity for learning? How about you, Awi?
Okay, I will answer this question. So the question, if the hospital allow the student to work as volunteers in the hospital for helping with the COVID-19 activities, will you join that? Do you think that it is good opportunity for learning? Yep, I think it's a big opportunity to learning. So if you ask me, do you want I want to help in that hospital? Yes, of course, but also I want to make sure that the hospital also give us a training to do or to give intervention for the patient of COVID-19. I think that's it. Thank you.
Okay, thank you for your answer, a week. I have other question from the audience. For students that have problems with internet and you have to study at home, how do you how do the students solve this problem? Afnan, can you answer this question?
Yes, for sure. If the student have the problem with internet connection, I would like to suggest them to ask some help from their relatives or their friends to use the internet, to use the strong internet connection from them, or if it's impossible, so they should ask for the teacher to recorded the file or recorded the video during the class or during the teach, and then send it to the student later when they have a internet connection. And if this is impossible also, so the college or the school should provide the internet SIM card or internet package for students to study online. I think the school should help in this problem also. Thank you.
Thank you, Afnan, for your answer. Next question is, in overall, do students like to study in classes or online, and why? Can Panalai please answer this question?
Okay, for this question, everyone like to stay at home, learn at home, but in the real life, we learners life. If I would like to come back to learn in college because face-to-face with teacher can understand more than in home, and in the college have a situation from me to make what they want. It will good if we come to learn in college. Thank you.
Thank you, Panalai. Next question. Could we use blended learning? Can a week answer this question?
Okay, for blended learning, maybe it's just based on what the campus that give to us. I think it's about the facilitation that campus have. I think because we use this, if we want to use this blended online class, so maybe we should to make sure that the campus already have a big room to make social distancing for the student, for their each other, and also we also make sure that the campus also have a proper to washing hand in every spot of place. But if the campus don't have a proper facilitation, I think we cannot to use this blended or online learning. So that's why.
Thank you, Awik, for your answer. Next question. If you can use only one device for online study, which one you prefer to use and why? Panitnan, can you answer this question?
Let's see. Sure, I will use laptops because it's useful for me. I can do everything I want when I use laptop. I can do everything I want when I use laptop. Yes. Yeah, I think that's good for me. Thank you.
Yeah. Other answer, who will answer this question?
May I answer this question, please? For if you can have only one device for study, I will choose my iPad or tablets because I think it's more convenient to write down what the teacher is teaching, or we can use it to make a note that it is the summarize of the lesson that we have learned, and it is so useful for us. Like I'm like to cut or edit the video. I can use it to download the app that used for video cutting or video editor, and I also like to use the option of these tablets to use it for my study also. There is an option, so I would choose this to use for online study. Thank you.
Thank you, Afnan, for your answer. Have the last question. How effective do you think online learning is, and will it be able to make students have enough knowledge to use in their work or not? Who will answer this question?
Okay, maybe I will answer this question. So, Miss Piatida, can you repeat the question first?
Learning is, okay. How effective do you think online learning is, and will it be able to make students have enough knowledge to use in their work or not?
Okay, I think is it effective or not? It based on that individual. I think it based on that person because we all know that every person have different tools or equipment to join this online class. If they have a proper like smartphone, laptop or tablets, maybe it will be easy to them to join this online class and it will be effective. But if that person or the individual is not have a proper equipment or tools to join this online class, I think it will be not effective enough. So because this is based on their personal, I think is it effective or not, it for me it's 50-50. If I can or I have a proper facilities to join this online class, maybe it will be effective. But if I don't have it, maybe it will be not worth it. So is it this online class will be worth it to our work later? I think it is will be worth because you will know this current situation is really urgent and we need to stay at home and we just need to learn from home, so we're gonna save and we can study also. So it's my opinion. Thank you.
Okay, thank you for your opinion. Okay, thank you to the audience for your question and opinion. Thank you to all the presenter for your answer and opinion them. So finally, that is all about our topic today. May we have learned something good, and may this survey make students get approval support. So we as students can successful in learning during new normal era with happiness. Now our time is over. Thank you everyone and have a good day. สวัสดีครับ
สวัสดีค่ะ
So let's move back to the main moderator อาจารย์สิริธร It's your turn. Thank you.
Okay. Hi everyone. We are finished like 20 minutes before the schedule. So I would like to move on to the rest of the session, which will be wrapped up of the conference for 5 to 10 minutes, and then we will do the poll questions and we will move to the closing speech by the director from Business Bangkok and Etiquette Bali. Now I would like to thank you all participants since from the morning and in the afternoon session. Everyone did a good job. This conference we consider the high quality one, that we get the real-time information, that we use everything that we got from students and faculty for improve the quality of teaching and learning for our college under Central College Network 1, BCN Trang, King Mongkut Institutes and St. Louis University. And for now, I would like to take time to wrap up the main point from the discussion that we listened today. I will start with the student session first because students come first in our philosophy as a teacher. We give the priority to students. For the topic of student views on online education, practicum and evaluation during COVID-19 pandemic, gain or loss. Students compare the advantage and disadvantage of online learning during COVID-19 pandemic. The presentation seems to point out that students have a lot of problems, but still there are some benefits that students see, that they get like from online learning. So I would like to start with the benefit first. Students said they are happy that they can spend more time with family and organize the time to study by themselves, even though they are miss school, miss their friends, and miss teacher. They will love teacher also, but they think study online, they can spend more time with the family and do things. So this is and the more important thing is can prevent them from getting COVID virus. So this is the positive point that study online. And for the problems and difficulty that students face, they seem that they feel that they are unprepared for study online for like almost 2 years now. And there are some problem about internet signal and unstable connection, and that make them feel frustrated. Can you imagine that, especially when you're going to take the exam, like if they disconnect the internet, right, that make them feel insecure. And more important point that I understand the student feeling that if they feel that they're not confident that they did online practicum instead of the traditional clinical rotation with real patients, as usually we did in a nursing curriculum or any field. So it makes them feel if this prepare them enough for they to have nursing skills and communication skills when they're going to provide nursing service with the real patients. And study in class and in the real setting, they feel that this will give them it's a better way to get knowledge, and they can control. And this way of study at the real setting will control their study behavior, because when they do the online study, they can pretend, someone can pretend that they are pay attention to the study, but the real thing is do something else, not focus on study at all, maybe see a movie or do other activity. And for evaluation, it is so difficult to prevent students from cheating the exams. This is the thing that students reflect for the situation that they do online study. In response to this discussion of students, as we can see in the morning, is the panel discussion for faculty. We as a faculty, we understand this also, and we are working hard in doing the teaching innovation and create new approach to use when we do online study, both in theoretical part and in online practicum part. So because we want to maintain the high quality and good teaching learning outcome. This is the thing that faculty is going to do in the future to solve the problem. And from student side, I think hardworking and honest and academic integrity is the way. People who do good thing will get good thing in response. Okay, you will be a good student, will be a good nurse, good worker in the future if everyone have academic integrity, honest, and do everything honest. And for the second part, the second discussion is the panel discussion about students talk how to help students success in learning with happiness in new normal era. This group did a wonderful job. You conduct research to find out what is student need for support from the view of student in Thailand and student in Indonesia. And the result come out that student need support in order to get success in online learning with happiness. So you want support and guidance in many areas, including effective teaching and learning methods. Students want to have knowledge, and at the same time they feel happiness during study. So in the morning, our teacher also talk about entertainment. We are thinking how to make study more fun. In the same time that the knowledge is still gain knowledge at the target that we set up, right? And another thing that is the second need for support is like students want IT support in form of a hardware like free laptop, tablet, and computer service on campus that when students have maybe when you study online at home, maybe can have online support also. And this will help students have happiness while facing this situation of COVID-19 pandemic. And for physical support, students want that have a break, take some break when doing online study. And may faculty please finish the class on time, not too late, so students can have a good health to face with the hard study during this time. Yes, and what else? And I think all the presentation that everyone made contribution today since the morning up until now is will be used for future planning that we are going to do to improve. It will be the take-home message for administrators, faculties, and staff, and also students themselves who involved with this situation, that we will working together for improvement, and we will fighting together. We will find the best solution that will benefit the life of students. We want everyone to be happy. Okay, from the heart of faculty. Okay. And the next section is about the poll question, because this is the first time ever online conference between CCN1, BCN Trang, Pamongkut, and St. Louis that we do online conference. So we would like to get the feedback from students who participate in this study. We have two kinds of participants. The one who register and log on to Zoom. Could you please answer the poll question as a real time? For students who views the conference as a group in the classroom, could you please prepare the cell phone, mobile phone, because we will have a QR code later that you can scan and you answer the question. For the poll question, we'll have 5 questions, and the answer are short answer. The answer is have a rating scale, like excellent, very good, good, average, and poor. So the Zoom question will ask you opinion on the 5 questions. Students, please have a cell phone, scan QR code, and take part on this. So we will use this feedback for improvement and do it better next time. For the poll question, the first one is the conference met my expectations? The second question is, participating the conference help improve my English language skills. The third question is, the knowledge gained in the conference can be applied to my academic field or my study, because we have both faculty and student participants. Number 4, the length of time for each session was sufficient. Number 5, the sessions were well organized. So please give us the answer so we will use it to improve our work, organize the conference in the next time. And moreover, because we have many interesting PowerPoint that we have present today. So for the audience who view the conference through YouTube or Zoom, we will have the link that you can access to the PowerPoint that we present today, both the PowerPoint of student and the faculty. We will have the link put for you to download the materials of the conference in the chat message on YouTube and on Zoom. Okay, I hope everyone get it. Thank you for your cooperation in providing the answer. Now, I think we will move to the closing ceremony. Okay. Could the IT person to invalid? Yes. Okay. Now the thing that you see on the screen is the link to Google Drive of the material that we present on the conference today. Okay. I will give you some time to take a picture of the link or to copy it. Give it. Okay. Okay. Now I would like to move to the closing. So the camera need to okay. Okay. Now we come to the end of the one-day fruitful conference that made the participants who attend today gain significant benefit for the faculty, staff, and students. And I would like to take this opportunity to invite Dr. Khwanta Bunwas, the Director of Boromarachunani College of Nursing Bangkok, Thailand, and followed by Dr. Putu Dhamma Suyasa, the Director of iTicket Bali, Indonesia, to deliver the closing speech.
Honorable co-host, distinguished guests, ladies and gentlemen, on behalf of the host of this conference, I'm honored to have this opportunity to thank all of you in participate this event. All of you have done well through today's online conference. It's my great pleasure that you had fruitful discussion, though I think one day is not enough. We have been facing the COVID-19 for almost 2 years, and everything including healthcare, education, has drastically changed. Therefore, in this year's conference, the main theme was health professional education for effective response to COVID-19 and future public health emergencies, sharing experiences. We have both teachers and students from Indonesia and Thailand sharing their thoughts, knowledge, and opinions with us. I hope that we have learned new ideas from each other, which we could adopt to further improve our instruction during this pandemic. I know that there were all interesting and useful presentations today, both in the faculty session and in the student session. I believe many good shared experiences and good lesson learned will help us facilitate online discussion, collaboration, and support student learning in the online environment effectively in the future. Finally, I would like to thank all co-hosts on this conference and staff for organizing this event and ensuring it ran so smoothly. Ladies and gentlemen, you have had a long day and have participated actively. So I thank you once again for your participation and wish you all are safe from COVID-19. Thank you. Terima kasih. ขอบคุณค่ะ
Good afternoon, colleagues from Indonesia and Thailand, Dr. Kwanta Bunfas, students, faculty members. I believe that throughout all this day, all of us have obtained a fruitful knowledge and sharing experience. In this virtual health and cultural exchange conference, with the topic of health professional education for effective response to COVID-19 and future public health emergencies, we have learned a lot from the keynote sessions delivered by the amazing keynote speakers, panel discussion, panel sessions, which are delivered by great speakers who have shared their knowledge and their interesting works. Also, our amazing students who share their values, who share their experience, especially during this pandemic period. Once again, on behalf of ITEKAS Bali and the committee from ITEKAS Bali, thank you very much for delivering such important materials so that all of us can deepen our knowledge on each topic. Furthermore, I would like to once again thanks to all presenters, participants, co-hosts who have joined this conference from all over Thailand and all over Indonesia. I hope that through the presentation and discussion afterwards, all of us can contribute to solving the educational problems in our own countries. Finally, I would like to thank all the committee members from both Thailand and Indonesia for organizing this conference and ensuring that it proceeds smoothly. I have some of the people beside and behind me, and I believe all our colleagues in Thailand feel grateful that we have this kind of conference. I saw some faces from our students after presentation. After closing, they take a deep breath. It means two things. Once, they relieve, and second, they also learn a lot from each other. We do hope that our discussion is fruitful and beneficial for learning and teaching in each of our own institution. I hope that once again, we can meet again in other conference or in other occasions, and hopefully to meet all of our colleagues in person when this pandemic is over and when it is safe to travel again. Thank you very much. Kap kun kap. Terima kasih.
Terima kasih ขอบคุณค่ะ
กล้องตัดมาให้จู้ยังอ่ะ
ยังไม่กล้องไม่มาเลยอ่ะ Now the conference is come to an end, and this is have been a wonderful conference so far. The conference makes us come together. This has been a wonderful conference that has brought us together. And now the conference is come to an end. It is a time for everyone to say farewell to each other. On behalf of the faculty from 11 institutions who organized this online conference, I would like to thank you for your participation. I will not say goodbye, but I will say see you again next year. Hopefully, COVID-19 will go away and we all will be able to meet each other in person in Thailand or in Bali. In Thailand or in Bali. So, would like to say bye-bye for now. And everyone please take care and protect yourself, stay safe. Get COVID vaccine as soon as you can. Thank you. Terima kasih. ขอบคุณค่ะ
Thank you once again.
Thank you,
Ajan
Dr.
Oi.
Putu and everybody.
Dr.
See you
Kwan
next
Kha.
time.